Yeah, good morning, sir.
Good morning, Dr. Ravindra. Thank you.
Sir, you can test your PPT if you are able to share and you can move the slides, then we will start the proceedings. Before we start the meeting, can you try, sir?
I'm trying.
Yes.
Already another screen is been shared. Dr. Ravindra, can you please stop that sharing?
Yeah, please try now, sir. Yes, sir.
Is
Slides
it
are
visible?
visible,
Yeah.
moving
Is
or
it? Yeah.
changing. Perfect. Okay. Can stop sharing, sir.
Yeah.
Good morning, one and all. We welcome you all to the international webinar cum workshop on health, life support systems, careers, sustainable development 2022. In collaboration with Sri Holistic Health Foundation India and Sri Research Institute and Center for Art, Sciences and Wellbeing, commemorating Azadi Ka Amrit Mahotsav, nation celebrating 75 years of independence, and also International Conference on Social Work and Sciences towards One Health and Sustainable Development 2022. We know we are commemorating World Social Work Month and also World Health Month as April 2022. Every year, April month is celebrated as World Health Month and 7th being World Health Day. On occasion of World Health Month, we are organizing series of topics related to health as part of the series which we are daily organizing from 5:30 to 7:30 and also on Sundays from 10:50 to 4 p.m. So today we have eminent speakers, very experienced speakers who have vast experience on respective topics. So before we go into the proceedings of the day, let's invoke the blessings of Almighty.
सम्पदः शुभं कुरु त्वं कल्याणम् आरोग्यं धनसम्पदः शत्रुबुद्धिविनाशाय दीपज्योतिर्नमोऽस्तु ते दीपज्योतिर्नमोऽस्तु ते शुभं कुरु त्वं कल्याणम् आरोग्यं धनसम्पदः शुभं कुरु त्वं कल्याणम् आरोग्यं धनसम्पदः
With the blessings of Almighty, we shall continue to the proceedings of the International Webinar Cum Workshop. Today, we have various sessions scheduled. So, we have eminent speakers, Dr. Sajid Kumar P., Assistant Professor, Government College of Nursing, Medical Surgical Nursing Department, Kozhikode, Kerala. And we have Dr. Reena George, Assistant Professor and Head, Department of Psychiatric Nursing, Institute of Mental Health and Neurosciences, INHANCE, Kozhikode, Kerala. And Sri Ravichandran Ji, Principal Consultant, HRM Mapper Consulting Co. He is currently employed in Ministry of Defense. And we have Prashant Joseph. He is a HR consultant and also Executive Director for JM Management, JM Distance Education Institute Partner, JM Faculty Management, Managing Director, and Eagleton Facility Management Shareholder. And we have Matt Perlestian, is CEO of EQ for Peace Worldwide Inc., USA. He is extensively working on emotional intelligence. And Dr. Ravindra RM, Consultant, Psychology, Medical, Psychiatric, Social Work, Counseling, Spiritual Mentor and Guide, and other speakers lined up for the day. So, we thank all the speakers for accepting our invitation and joining us for the wonderful day. And starting with the first session, I would like to invite Dr. Sajid Kumar P., Assistant Professor, Medical Surgical Nursing, Government College of Nursing, Kozhikode, Kerala. A brief description about our eminent speaker. Dr. P. Sajid Kumar has been a nurse consultant for the past 2 decades. He completed his basic education in St. Joseph College, Devagiri, Kozhikode, and then he obtained BSc Nursing degree from prestigious Muller College of Nursing, Mangalore, with first rank and gold medal in university. He was also the best outgoing student during his bachelorate program. He obtained master's degree in medical surgical nursing with specialization in critical care nursing with first rank and gold medal from prestigious Manipal University. His dissertation on effect of body position changes on hemodynamic parameters was selected as the best research for the year in the Manipal University, which is one of the 5 universities in the country selected as Institute of Eminence by the Government of India. He did another postgraduate program in Criminology and Forensic Science from University College, Chidambaram. He was awarded PhD degree in Medical Surgical Nursing and first rank in the Part 1 exam from National Consortium for PhD in Nursing funded by World Health Organization for the thesis Effect of Training of Trainers on Basic Life Support Training on Life-Saving Skills, Pro-Social Behavior and Preparedness of Public in selected areas of Kerala state. He completed postgraduate diploma in medical law and ethics from McMaster University, Hamilton, Ontario, Canada. So Sajid Kumar carries 21 years of experience in nursing practice, education and research. Includes 3 years of experience purely in clinical area and then 18 years of experience in the field of nursing practice, education and research. He has been serving as an international training center faculty and instructor trainer of American Heart Association for the life support programs like basic life support, advanced cardiovascular life support, pediatric advanced life support, and ACLS for experienced providers since 2022. He is also an international instructor for programs like International Trauma Life Support, Basic and Advanced Disaster Life Support, Advanced Medical Life Support, Pre-Hospital Trauma Life Support, and Emergency Pediatric Care. As an international trainer and course director in many life support training programs, he was also instrumental in imparting knowledge and skills to healthcare professionals in 28 countries across the globe, and also delivered life support training to the police, fire rescuers, school students, NCC, scouts, NSS, JRC, and also to the general public. Apart from these consulting assignments, he is voluntarily serving the state police to train police officials in various police academies across the state. Also serves as an active member of Scout Brotherhood from his school days and was awarded Rashtrapati Scout Award in 1993 and Rashtrapati Rover Award in 2002 from the Honorable President of India. He has been functioning as a mentor to many lifesavers in the recent disasters like floods in Kerala, Nipah epidemic in Calicut, and then current pandemic of COVID-19. He was serving and acting as a mentor. So he was deputed to many places by the government of India to train healthcare professionals and establishing first line, second line treatment centers and COVID ICUs. Director General of Health Services, Government of India has recently felicitated him for the remarkable services rendered by him during these periods. Currently serves as Assistant Professor in Department of Medical Surgical Nursing, Government College of Nursing, Medical College, Kozhikode, since 2012. During his period, he has published several research papers in the reputed international journals and presented scientific papers and invited talks to international conferences. He is generally considered as one of the leading experts in airway management, trauma nursing, disaster management, and restoration science. We welcome you once again, sir. We are very happy, glad, and fortunate to have you with us, a person who is down to earth and has so much experience and is committed to his profession. We are very fortunate to have you in this platform. Thank you very much, sir, for joining us and accepting our invitation and coming forward to take up session on adult and pediatric chain of survival and basic life support. Over to you, sir, for your session. Thank you.
Thank you, Dr. Ravindra, for a detailed introduction. And dear participants who have joined us directly, those who are viewing through the YouTube live, a very good morning to all of you. I now share my screen.
Yes, sir. It's visible.
Begin with, we are dealing with a very, very important topic. And at the very outset, I would like to honor the barriers. For the last 2 years, we were fighting the pandemic. I am sure all of you, those who have joined with us today as participants, as organizers, were fighting against the COVID-19 pandemic for the last 2 years, more than that. And we honor the barriers, those who have lost their lives during this period fighting against this menace, and those who are the survivors. Before I begin, I would like to acknowledge the organizers, especially Dr. Ravindra and his entire organizing team, for thinking about such a topic that need a lot of awareness among healthcare professionals, even to the general public also. In the beginning, when he approached me, I was a little hesitant because this topic is actually a competency-based, a skill-oriented topic, which is very difficult to deal with through an online session. But his loving persuasion has made me to take up this challenge to give you an overall awareness about what is the importance of the first responder training in this area, which will definitely motivate us to take offline programs in the days to come. I also acknowledge my own institution, Government Nursing College and Medical College, Kozhikode, and Government of Kerala for permitting me to deal with this session today. Also, my mentors and gurus, Dr. Nagendra Prakash and Dr. Ratna Prakash, for shaping me like this. My teachers, elders, colleagues, and students, I acknowledge their important role in my life. Before I begin, I would like to give a few disclaimers. The material and information contained in this presentation is general information only. I am not an authorized representative of the organization or Government of Kerala where I am employed. And so the opinions and suggestions included in this presentation are personal only. The material presented are based on the International Liaison Committee on Resuscitation, ILCO recommendations and 2020 updates. With that introduction, I would like to tell you the epidemics when our country is concerned. What is the pattern of or the total causes of death? If you look at this particular figure, you will be able to understand. Probably you can exclude the COVID-19 issues in this figure. That has completely changed, dramatically changed the entire system. But if you exclude that, the heart attack and the heart failure accounts for almost 16%. You can see in the right-hand side, the percentage change from 2005 to 2015, that is in 10 years, what change has happened? It has increased by 17%. Lung diseases, brain and brain hemorrhage and stroke. You understand that these are all not the communicable diseases. Even though there are some communicable diseases like bronchitis, probably lung infections like pneumonia, diarrheal diseases, tuberculosis, they all account maybe altogether 15%. You can see the percentage change. Over the years, that has reduced to a greater extent. But again, when you look at these two things, diabetes and chronic kidney disease have increased in an alarming way, 35% and 21%. So what does this mean? The non-communicable disease burden in the country has increased. And look at this one. When you look at the deaths due to cardiac arrest, sudden cardiac arrest, every day in the newspaper we use this. We used to see this particular type of outbreaks. The sudden cardiac, sudden death, people suddenly collapse and die. These type of deaths, there was a steady increase in our country. If it was in 2014, if it was 18,300, over last 5 years, it has increased to 28,000 and more. And in 2020 March, when the COVID-19 pandemic attacked, the number of sudden cardiac events has increased in a dramatic way. And look at this. This is really shocking. You see that the coronary artery disease, the disease affecting the the vessels that give supply to the heart, this 25% of them, usually the common public use the term heart attack. The medical practitioners and health professionals use the term myocardial infarction. Earlier, these type of diseases used to affect a little elderly population. Now, the age distribution of these diseases have completely changed. You can see that 25% of them, it happens, before 40 years of age. 50% of them occur before 55 years. 55 years, or they're all young people. And 90% of them were males. And these, things, the information that is shared, they are vitally important. 14% of them had hypertension. 8.2 were diabetic, and 64.8 had, and 65%, they both had the high cholesterol levels and abdominal obesity. So these are all not very good statistics you can see as far as our country is concerned. You can see two important persons, Yashpal Sharma and Ericsson on the right side. This wonderful cricketer who was a member of the team of 1983 World Cup winning Indian team, he suddenly had a sudden cardiac event and we couldn't do anything. He died. Whereas Ericsson, you all might have seen during the previous year European Cup, he was a very active player of Danish football team. He suddenly had a sudden cardiac event. He had a sudden cardiac arrest while he was playing, and you might have seen if you look at the YouTube, you can see all his co-players, players from the opposite team. They were making a shield around him so that the privacy is provided to him. Some of his co-players were giving essential first aid to him, and they could revive, they could rescue him from the sudden cardiac event back to life. And after getting a implantable cardioverter defibrillator machine, now he has come back to the playground very recently. See, you can have a look at these two players, one person. I just wanted to tell you, people who are working hard, athletes, they are also not excluded from these type of sudden cardiac events. Coming to the road fatalities in India, again, it is not very good statistics that we have got. You can see that there is a steady increase in the number of road crash fatalities. It is estimated that we have a maximum number of road crash deaths in the state of Uttar Pradesh and a maximum number of road crash injuries in the state of Tamil Nadu. But all the states are equally included. It is estimated that more than the number of a jet plane crash, that means almost 400 people are killed almost every day in India with the road, traffic deaths, road traffic accidents. Now, when you look at the statistics in detail, you can see that 75% of the bystanders, that means the first responders. Who is a first responder? The person who comes in the very beginning to help you when you are in danger. That can be a member of general public, maybe your colleague, one of your family members. Anyone can be the first responder. If you are in the hospital, probably the healthcare providers, your colleagues. So 75% of the bystanders are unlikely to assist a victim of serious injury. We were analyzing what is the reason for that. Because many of the bystanders, they stated that they were reluctant to help people. One thing, they didn't know what to do actually. They only knew they need to take them to the hospital nearby. Some of them were reluctant because they were worried about the legal hassles, the repeated questions from the police, the hospital authorities, and all those things. So that has prevented many good Samaritans to refuse treatment as a first responder. So what is the effect of all this? You can see that 50% of the number of road crash victims, they died due to treatable injuries. If the first responders, if you and I were excellent in giving the essential first aid to these victims, 50% of them would have been saved. This is not a small number. 50% of the all trauma deaths would have been prevented if the first responders were excellent. So I just wanted to tell you, being a first responder and saving a life is considered divine in all the religious groups, in all the religious beliefs, whichever religion you are born, no matter, life saving is considered divine. I do remember somebody asked me, what is the historical perspective of this life saving efforts? Actually, this is there in from the prehistoric time itself. Earlier, somebody has after my class, somebody has given me a message that it was there even in the epic Ramayana. I asked in which way. So he mentioned there is something called as Mrita Sanjeevani mentioned in Ramayana. That was to rescue Sri Lakshmana, who was injured by Meghanath, son of Ravana. Ravana's son Meghanath's arrow badly affected Lakshmana, and he was in a state of near death. And in Ramayana, it is mentioned that Sushena, the royal physician of Sri Lanka, Ravana's royal physician, he asked to get few important medicines from Dronagiri hills in Himalayas. You might have heard about this particular story or anecdote or incident, whatever you call. And one of these medicines was Mrita Sanjeevani. That means restorer of life. And it was, humanly not possible to travel from Sri Lanka to Dronagiri hills in Himalaya. And the story says that Sri Hanuman has taken this particular, task to get this particular medicine. And when he went to Dronagiri hills, he had difficulty identifying this particular Mrita Sanjeevani medicine. So he was capable of taking the whole Dronagiri hills and rescuing Sri Lakshmana. So that means saving lives, it has started from the prehistoric times. I was really attracted by some of the sayings in the Holy Quran. In one of the places in Holy Quran, it is mentioned, if you save a life, it is just like saving the whole humanity. If you kill a person, it is something like, killing the entire humanity. So saving life is being, portrayed as a divine thing in all the religious groups. In Holy Bible also, there are some remarkable, incidents mentioned. Once a widow, being a widow itself is the most disastrous thing. Widow, she carried her child. The child was the only, hope for this particular widow. She came to one of the servants of God named Elijah, and she told Elijah, "See, my child is not responding. Actually, the child was dead." And in the Bible, it is mentioned, Elijah took the baby in his hand and went to the upper story where he was staying, and he pressed his hands or his body 3 times on the patient's or the child's body, and he prayed to the God, "Oh Lord, let the life come back to him again." And in the Bible, it is mentioned that Lord has answered his prayer, and the life has come back to the child. So all these incidents, it reaffirms the importance of the saving lives in all the religious groups. So what is the purpose of doing a basic life support? Or, earlier we used to use the term cardiopulmonary resuscitation or cardiopulmonary cerebral resuscitation. This is actually to provide effective oxygenation to the vital organs. Even when the heart has stopped, it is possible for us to give oxygenation to the vital organs, especially to the heart and brain. Why am I giving more emphasis to the heart and brain? These 2 organs, they are termed as vital organs. There are other vital organs also in the body, but remember that brain is the most sensitive organ to hypoxia, reduced blood supply. It cannot survive hypoxia for more than 3 to 4 minutes. Heart also is a very sensitive organ to hypoxia. More than 10 minutes or so, the heart cannot survive hypoxia. So the purpose is to provide effective oxygenation to the brain and heart. And why we are discussing about the role of the first responders, some of you may ask me, all these type of things are to be learned by doctors, nurses, or people who are actively involved in the acute management of patients with critical injuries. No, because 90% of cardiac deaths occur before they reach the hospital. This is a very dangerous thing. Only 10% of cardiac arrests happens inside the healthcare facilities. And the problem is, once the brain tissue death occurs, it cannot be restored or repaired, because we have learned in our science classes earlier during school days that the mitotic potential, the cell division capacity for the brain cell, it is very limited. Once lost, usually it is lost forever. So the basic life support alone may be life-saving to a greater extent. We will talk about that a little in detail. Yeah, let us have a look at this particular video.
Is there any sound, sir, for this video? Audio?
Yeah, it's all right.
Yeah, okay, sir. Thank you.
So we could see that in some of the developed countries, even the police dogs, they are trained to do the basic life support. The puppy, which was trained by the police, was able to see whether there is a pulse or whether this particular patient is breathing or not, and the dog was trying to press on the patient's chest. But unfortunately, in the developing world, things are not like that. We are yet to go to the general public to train about the essential first aid that they need to know. There are efforts from different parts of the country to go to the general public, to go to the other type of professionals who are not healthcare professionals, to train them. we have a very important, non-gazetted, non-governmental organization working in this part of the country. We have another important NGO, which is named the Save Life Foundation India. They are all trying to go to the general public to train them as the first responder training. So remember, you can also be a first responder at any time. The first thing that you need to remember is we have to see that the scene is safe before you approach the patient. Your safety is very important. Your safety is your responsibility. You see, if you take this particular picture as an example, the victim is in the opposite side of the road and the rescuer is in the other part. Definitely all of us will be very much, we will be eager to know what is happening with him. We just want to help him, but at the same time you should be extremely careful to see that your safety is ensured. So think whether the scene is safe and you can approach the patient. And definitely in this time of pandemic, I don't need to mention this, you should always protect yourself with the maximum number of personal protective equipment, because we do not know what is the state of this particular patient, whether this particular victim has got some communicable diseases. You should always take a precaution to use the personal protective equipment. And the next step, what we are going to do is we are checking the response of the patient. How do we check the response of the patient? Ideally, we need to tap on the patient's shoulder, little in a very stronger manner. And we should call the patient, hello, can you hear me? In your own regional language. We don't need to use English. Since English is used here, so that all of us can understand, comprehend as a common language. So you check the response by calling the victim and tapping on the shoulder. And if the patient is in a sudden cardiac event, you don't see any response from the patient. Patient will not respond to your call or your tap on the shoulder. If no response, you should immediately call for help. That can be a call to the nearby person, or if nobody is available in nearby places, you should call through a telephonic assistance. Then ideally we need to check for a pulse or any breathing efforts. Let me tell you, it is not very easy to check the patient's pulse when the patient is in a cardiac arrest. The simple reason is that patient has no pulse. So the people or the healthcare providers who are used to check the pulse, for them there may not be much problem, but others who are not used to this type of procedure will find it very difficult. So I suggest we don't need to check the pulse. Rather, you check whether there is any breathing efforts. That is very easy to check. You look at the patient's chest as well as the abdomen. When the patient is breathing, definitely there will be, the chest and abdominal movement. If no response, if no breathing, you understand that patient has gone to cardiac arrest. Sometimes you see that patient has got some sort of abnormal breathing. You call it as agonal breathing or non-normal breathing. Agonal breathing. Suddenly patient will have one breath. And after that, there is no breathing at all. After maybe 10-15 seconds, again a deep breath. These type of breaths are called as agonal gasp. Remember, this is not considered as normal breathing. So if the patient has no pulse, if you know how to check the pulse, if the patient has no breathing or patient only has got an agonal gasp, definitely you have to activate emergency response system. How do we activate emergency response system? In all our phones, you can do that. In different states, there can be different numbers. In most of the Indian states, I suppose we are using 108. In Andhra Pradesh, I'm sure there is a 108 ambulance network. So if you call in 108, that call will be connected to a central console and they will direct you with a BLS or ALS ambulance. That's what usually happening in most of the Indian states. In Kerala, we use 102, 108, and we have another emergency response number of Kerala Police, that is 112. So in different states, there can be different. But it is very important that you activate emergency response system and you ask for an ambulance and AED. This is a very important equipment that we need to discuss today. AED. Anybody knows what is AED? Anyone of you have used AED? Dr. Ravindra, is it possible for the participants to respond, or they can only type in the chat box?
Yes, sir. If any of the participants know, you can type or raise your hand, or you can unmute.
Oh, all right. Any one of you have heard about the AED?
Yeah, there is no response.
Yeah, we are not getting any messages in the chat box.
Concepts are very much new.
All right. Yeah. That definitely motivates me to explain a little more about these concepts, because as people working in healthcare discipline, all of you, we need to know more about this, because we need to know about these concepts not only for our understanding. This message is to be disseminated to the general public. That is also our responsibility, being social workers, psychologists, or any other healthcare discipline professionals. So AED is nothing but automated external defibrillator. Automated external defibrillator. We will come to know about that a little more in detail. So in the very beginning, once we understand that patient has no response, we need to activate emergency response system. We need to ask for an ambulance. We also need to ask for automated external defibrillator. Now, what is the next step? We need to immediately start the chest compressions. What is this? What are we doing through chest compression? Heart is not functioning. Heart has gone to an arrest, that is called as cardiac arrest. So, if the heart is stopping, what will happen? We have earlier seen that the blood supply to the brain and the blood supply to the heart itself is stopped. They cannot survive hypoxia or reduced blood supply for more than 3 to 4 minutes. So, what are we going to do? We are going to press the heart from outside. So, when you press the heart from outside, the heart will be pumped. Because fortunately, the heart is placed in between two bones. In the front, we have a breast bone or sternum. There is a bone here, a very heavy bone. In the back, we have the vertebral column or backbone. Fortunately, our heart is placed in between these two bones. So what is the benefit? When you press this bone, the heart will be compressed. Provided patient should be on a firm surface. If patient is on a very cushioned mattress, you can't do that. You have to keep the patient onto the floor or to a very firm table or so that when you press on the patient's breastbone or sternum, the bone that is placed in the middle of your chest, you can automatically compress or press the heart. Fortunately. So I will tell you where to keep your hands. It is in the middle of the chest as shown in the figure. And you see that this part, the heel of your palm should be placed on the patient's center of the chest. And this part only should be given compression, not your finger part, because your fingers will be usually kept on the the ribs, that should not be pressed, because when you press on the rib, naturally what will happen is the rib may get broken. That shouldn't happen. Probably, may I demonstrate it with the help of a dummy here. Okay, so if this is the patient. This is the middle of the chest. Hope I am visible properly. Yeah, can you see here? This is the middle of the chest, and this area is to be pressed. Usually the middle of the chest, but you should always see that at the tip of this breastbone there is a a depressed portion. You call it as a sternum. That should not be pressed. It should be the middle of the chest. You should keep your hands, and you can see that I have kept my hands. My elbows are straight. So this should be the way you keep your hands for giving the chest compression. You can also see that in the figure, my shoulders are perpendicular to the sternum or the breastbone. What is the benefit of keeping it like this? I can transfer my body weight. I'm almost 90 kg. That can be transferred to the patient very easily. So we will look into the details of the chest compression. That is one of the most important parts in the basic life support. So when you press, what are the important points that you need to remember? The first one is the rate. You look at this figure, you can see the rescuer, the person who have come to save the life, has kept the shoulder perpendicular to the patient's sternum. His elbows are straight. Hope you can see this. Yeah. So now, the second, so the first aspect is the hand position that we are now very clear. Middle of the sternum or middle of the chest, elbow straight, the shoulder of the rescuer directly on the patient's sternum, that is perpendicular to sternum or 90 degrees. And here the patient should be kept on a firm surface, and preferably you should undress the victim. The chest part dress is to be removed. If it is a female patient, definitely you can give privacy for them, but it is preferred to give them on a bare chest, not on the dress. Now, the first important thing is how faster you need to press on the patient's chest. This is very important. How fast? You have to give it very fast. At least 100 compressions per minute you should be able to give. 100 compressions per minute. That's not a very small number. It's a very, very high speed. 100 compressions per minute. That should be the speed with which you give the compression. We have observed that during when we give the practice and in the real clinical practice also, some rescues give very high speed. That is also not permitted. The maximum speed can be 120 per minute. So in other words, the rate of chest compression should be limited in between 100 to 120. At a rate of 100 to 120. Now, what about the depth? How much you have to press the chest? Many people ask us the doubt whether if you press the chest very harder, can it break the bone? No, if your hand placement is excellent, if you have placed your hands on the sternum, nothing bad will happen. But if you have misplaced your hand to the ribs, definitely it will break. That shouldn't happen. So that's why I told you, maybe this is an awareness class for most of you. We have to take a physical training that we will arrange in consultation with Dr. Ravindra later. So the depth should be at least 2 inches. At least 2 inches. Dr. Sujit Gupta has raised his hand What is it regarding? Can we unmute him and shall we hear from him?
Yes, sir. Yes, Sujit Gupta ji.
Good afternoon, sir. Sir, can you speak Hindi?
Oh,
Question, sir.
It's better if you can communicate in English, sir, so that
Oh.
everyone can understand.
Okay, sir. Sir, one question, sir. Can please, sir, consider Hindi language, sir, please.
probably during the question answer session at the end, I will get help from Dr. Ravindra also to translate to Hindi. Even though I have learned Hindi up to 10th standard, in Kerala we rarely use Hindi and I'm not very proficient in Hindi.
Okay,
I'm
sir.
very sorry. Probably during the question answer session, at the end of the
Okay,
session,
sir,
we would like
continue,
to.
sir.
Yeah. Thank you.
Okay, sir.
Thank you, Dr. Sujit Gupta. Thank you.
Okay.
Yeah, so I was mentioning about the depth of chest compression. How much should be the depth or how deeper you should compress the chest? At least 2 inches or 5 centimeters. That is the answer for that. If it's a little more, nothing bad will happen. But it should not be less, because we are trying to compress the heart, or you're making the heart functioning from outside. Heart is not pumping by itself. You are pumping the heart from outside. So the depth is vitally important. It should be at least 2 inches, but not more than 2.4 inches, or it can be in between 5 to 6 centimeters. If it's a little more, nothing bad will happen, provided your hand placement should be in the proper place. The third important point that you should remember is, once you press, you should completely release the pressure. Give pressure, release the pressure. You don't need to take the hand out of the chest, but how much you press, that much release should be given. Because I have observed some healthcare providers, they keep it pressed and then press from there. No. What will happen if you are not allowing the recoil, or after pressing you are not releasing the pressure, heart will not be able to relax and fill the blood for the next contraction. So in between your pressure, you should release the pressure. So heart will be getting filled, and with your next compression, heart will be pumping the blood to the major vital organs like brain and heart itself. So release or recoil is very important. And the last important point is, once you start the chest compression, do not stop the chest compression unnecessarily. You should give continuous blood supply to the brain until the healthcare providers of high training, ALS training, or advanced cardiovascular life support trained people, or pediatric advanced life support trained people take over the patient. Until that, you need to continuously do this chest compression, so that the chance for survival for this patient will not be affected. So remember these 4 key aspects. The first one, before I go to the right depth, your hand placement is vitally important. Where do you keep your hand? At the middle of the chest, on the breastbone or sternum. The rate should be 100 to 120 per minute. The depth should be 2 inches or 5 centimeters. You can go up to 6 centimeters or 2.4 inches. After each compression, you should release the pressure. That is release or recoil. And once you start the chest compression, do not stop the chest compression. Now, after 30 compressions, what are we going to do? The modern studies show that you don't need to do anything. Earlier, we used to teach the people, you have to give rescue breaths also. Rescue breaths. You have to give mouth-to-mouth breathing if you are outside the hospital. This was the teaching that we have given earlier. But now in COVID scenario, and especially for adults, it is believed that, it is scientifically proved that there is already some oxygenated blood in the body, in the heart, that need to be circulated to the brain. So we don't need to give artificial breathing if you are outside the hospital and rescuing a patient. You can give continuous compressions. But if it is a child or a small child named as infant, less than 1 year, they may require artificial breathing. In such cases, after 30 compressions, you have to open the patient's airway. It is very easy to do. How to open the patient's airway? You keep one hand on the patient's head, tilt the head back. With your other hand, the fingers, you hold the bony part of the chin, lift the chin. So this particular maneuver is called as head tilt chin lift maneuver. This is very easy to do. So once you do this, the patient's airway will be opened. Why are we doing so? Our airway is otherwise also open. If you are not doing head tilt chin lift also, we can breathe. But remember, for these patients, patient who has gone to cardiac arrest, their muscles of this part will be completely, the muscle tone will be lost. The normal muscle capacity will be lost. What will happen is the tongue will go back. That is called as tongue fall. That will obstruct the airway. So when you open the airway like this, head tilt chin lift, it is easy for you to give rescue breaths. So how will you give rescue breaths? I am giving rescue breath like this, but this is a very, very rudimentary method. You are keeping your mouth onto the patient's mouth and you are giving 2 rescue breaths. There are a lot of risk involved in this. One thing, if the patient has any communicable diseases, you may also get transmitted. But then if the patient is a very, very significant person for us, we may not hesitate to do so. So I would suggest you not to do this. If it's an adult patient and if the help is available within a few minutes time, you can give continuous compressions. You don't need to give this artificial breathing. But if it's a child or infant, you consider giving rescue breathing. Now, don't think that there is only one method to give artificial breathing, only this mouth-to-mouth breathing. There are other methods also. I will explain about that later. So after your 2 rescue breaths, remember when you are supposed to give, or when you are trained to give rescue breaths also, you need to be very, very vigilant. You should be extremely cautious not to give breaths in a very stronger manner. Only a visible chest rise should be there. Too much of air, that can also be dangerous. Because we know when we take breath, we are taking very, very less amount of air inside. It is estimated that some 400 to 500 ml or maximum 600 ml of air only is taken by us during a normal breathing. This is known as tidal volume. The normal amount of breath that we take in and out during each breathing is called as tidal volume. So what I mean to say is, don't give too much of force when you give the breathing. After that, you have to continue the chest compressions. If you are alone, you have to give the chest compression. You also have to give the breathing if it is a child or infant. But for an adult, you don't need to give this. For if the help is available within few minutes time, you can continue to give chest compressions. But if you are giving the breaths and compressions, the ratio should be 30 chest compression, immediately 2 rescue. That should be the way you need to proceed. So one more important point has come here, if you have observed, that is regarding the ventilation. I already mentioned that you should not hyperventilate the patient. You should not give too much of air to the patient. Only what is required should be given to the patient. That is 400 to or 500 ml. How do you know that? Can you measure 400 to 500 ml? No. The chest need to raise a little bit. That means you have given the breath. That's all. So you can see I'm giving a mouth-to-mouth breathing to this patient. But I have used a particular device called this is a barrier device. This is a plastic sheet with some pores there. I have used because I don't want to keep my mouth over the patient's mouth. Now there are other methods also to give breath. You can see here. Most of the healthcare providers, especially in the acute care, we carry a mask like this usually in our pocket. Okay, this is a very small mask. You can keep it like this and you can keep it in the pocket. This is called as a universal face mask. Now, what is the benefit of this? You don't need to give directly to the patient's mouth. If something happens outside the hospital, so we usually keep it in our vehicle. You can keep this onto the patient's mouth, and this will cover the patient's mouth as well as the nose. So if you take this dummy, you can see that it will completely cover the patient's mouth and the nose, and through which you can just give one breath over to the patient's lungs. So it is very easy. So give one breath, give 1 second break, one more breath. Like that, 2 breaths is to be given. So I advise after you take a training, you can buy a very small pocket mask like this. If an emergency happens somewhere, you can be a lifesaver with this. This is called as a pocket mask. During the physical training, I will be able to give you a training with all these things. So actually, all of us need to practice these skill sets so that we can be of immense help to people around us. Now, if you get an ambulance service immediately, some of the states you can see that there will be a trained person in the ambulance. In most of the 108 ambulance, there are trained nurses or emergency medical technicians. In some of the states, even doctors are also available in ALS ambulance. But in certain states, only the driver will come. So the problem is he has to drive and he has to take care of the patient. That is not possible. In that case, as a first responder, you should continue your care. So you can see that in most of the ambulances, there will be a device like this. You might have definitely seen this. This is called as bag valve mask device. So if you keep it on the patient's mouth and nose, you can give breath very easily. You can press this and you can see that the patient's chest is getting raised. And there is an option for you to connect the oxygen, what is available in the ambulance, to this particular port so that oxygenated air can be given to this patient. So there are 3 main methods to deliver breaths. One is the mouth-to-mouth breath. If you have nothing with you, then if you are a trained, skilled healthcare provider, you can use the universal pocket mask. And the third method is using a bag valve mask device. Bag valve mask device, what is available in the ambulance or in any healthcare facility, even in a primary health center, you can see this. All right. So we have a question here. What is the total duration of CPR? That was the question, I suppose. Okay. Actually, how long can you give CPR? If that was the question, we would like to answer it towards the end. But the sequence is 30 compressions are to be given and then 2 ventilations. 30 compressions, 2 ventilations. That should be the ratio until the patient gets a pulse or patient starts breathing or until the advanced health providers take over. And there is no answer for how long you can give CPR. The answer is until you get the patient back, or else you think that this patient cannot be saved. You call it as unsalvageable patients. Unsalvageable patients. there are different, I will explain that probably towards the end of the class. There are different administrative decisions on how long you need to continue CPR if the patient is not coming back to normal life. Patient is not getting a pulse or respiration. That's a very good question. I appreciate that question. I motivate such type of excellent question in the remaining time also. Excellent. Now, what is remaining? We will have a look at. The next one is, so we have now seen how to give a chest compression effectively, how to open the airway by head tilt, chin lift, and also how to deliver rescue breaths by 3 methods. Now, I already mentioned about the automated external defibrillator in the beginning, because if you remember, we have asked for an AED when we asked for help. So what is this automated external defibrillator? Most of you might have seen giving shock to patient. Giving shock to patient, what is that? Giving shock to patient, at least in the movies we have seen, when the patient, not the shock that you give to psychiatric patients, okay? That is a different shock. Here, you might have seen a particular equipment is placed on the patient's chest, and patient suddenly jerks and the patient comes back to normal life. These type of scenes are usually included in the movies. This particular machine that we use in the hospital is called as defibrillator. But we are not talking about that. That cannot be used by us. This is an automatic external or automated external defibrillator or AED. This is manufactured for the use of general public or trained people. Any trained health care worker can use this. Even the public can use this with the minimal training. I will explain about that. So what is the importance of using an AED? Because most of these patients, when patient goes to cardiac arrest or sudden stoppage of the heart, if you can take an ECG at that time, or if you can connect the patient to the monitor will show like this. This will be the ECG of the patient when the patient is in cardiac arrest. And this is called as ventricular fibrillation. Ventricular fibrillation. See, remember, if you have seen a normal ECG, you can see that it is totally different from a normal ECG. Here, a lot of unwanted electrical discharges are only there. No normal ECG for such patients. So remember, the commonest rhythm in adult cardiac arrest is this. So what is this? This is called as ventricular fibrillation. Instead of one proper contraction, hundreds of unwanted electrical discharges are happening. And it is estimated that 90% of adult cardiac arrest, ventricular fibrillation is happening. So we need to stop this unwanted electrical discharges so that you can rescue the patient back to normal life. So only problem that we have is the third statement. 90% of cardiac arrest occur outside the hospital. 90% of cardiac arrest occur outside the hospital. So that means the machine that we have kept in our hospital has no much role. This can be only used for people who are already hospitalized. But can you imagine if these type of automated defibrillators are available in the general public, in the public places, the things will totally change. So that is why we are talking about the automated external defibrillator. Now, so in that case, if the patient has got a ventricular fibrillation, giving chest compression alone will not be sufficient, because you may need to use an AED if it is available. So now automated external defibrillator also is a part of basic life support. So why are we discussing this? Is it available in the general public or in the public places? Yes. Now, the government of India has made it mandatory that all public places need to have a automated external defibrillator. The public places like bus stations, train stations, airports, very huge shopping malls, or huge public government buildings, all these need to have a automated external defibrillator placed or located in a central place, so that if anything happens, an untoward incident happens for anybody, you can immediately use this. Because you can see, if you defibrillate or if you shock a patient with this shock machine, in the first minute of his collapse, there is a 90% chance to revert the patient to normal. But as the time passes, the chance of survival is getting reduced. It is estimated that every 1 minute delay is reducing the chance of survival by more than 10%. So imagine after 10 minutes, if you defibrillate, probably patient has nothing to do with that. No effect will be there. So when you get trained, you search whether there is any AED nearby. You can easily use AED. I will show you how to use an AED if it is available. Some places AED is marked as not AED. They write it as life-saving machine. I don't know whether you have seen it somewhere. I have seen now most of the airports, most of the railway stations, AEDs are now placed in India. Certain metro cities, it is even available in all the platforms. So we have grown to that extent. But what is the problem? Many a time people are not aware about this machine. Machine will be there. A person may collapse just in front of the machine, but nobody is using that. So this is very unfortunate. Now, if at all you get a life-saving machine or AED, you defibrillate the patient as soon as possible. So if you get an AED, this is an AED, okay? It's a very, very handy equipment. You can see this AED, very small machine that will be placed on the wall. It will be mounted on the wall of the public places. And along with that, there will be these type of pads will be available along with this. These are disposable pads. Some 15 pads will be available with the machine always. Now, what is the important thing that you do as you get the automated external defibrillator? Let us have a look at, in a stepwise manner. The first step is you should switch on the machine. That is very simple step, right? Any electronic machine do we get? What we do in the beginning, we switch on, because it will tell you what to do, or it will give you some instructions. Say, for example, if you switch on your mobile for the first time, it will tell you, requesting for configuration, or something like that. The messages will appear, or it will ask you to set the time and date. So instructions will come. This particular machine is a wonderful machine. When you switch on, this is the on button. One, it is mentioned as one.
Pads to patient's bare chest. Plug in pads connector next to flashing light.
So the benefit here is it will give you voice instruction.
Apply pads. Plug in connector.
As soon as you switch on, it will give you voice instruction. What is the instruction that is given?
Apply pads.
Yeah, it is
Plug
saying
in connector.
apply pads to the patient's bare chest as shown in the figure. So where is the patient? I told you we have to make the patient's chest undressed, because we need to keep this to a bare chest. You can't keep it on the patient's dress. So remember, there are pads available with this. So you can see this pad. You can see on that there is a picture where to attach these pads. So it is very easy. This is something like a adhesive plaster. There is a plastic material that is to be peeled off so that this can be pasted here. It will automatically get pasted here. Where do you keep this? Right side of the breastbone, below the collarbone, here, somewhere here, upper right chest, below the collarbone, right side of the chest. It is very easy, it will stick there. Now the second one, this is the second pad. You can see a picture is given there because this particular machine is to be used by the general public. This is not for the healthcare providers. So it should be very easy for them to use. So that is why machine is giving you voice instruction where to attach the pad, and the figure is shown here. So this is a little below the left armpit, left axilla here, left armpit, a little below here. You can place it here. It will stick there. So that is the second step. I hope you understand. The first step is to power on the machine, because when you power on the machine will give you the instructions. Say for example, and the third one is analyze the rhythm, and the last one is to deliver shock. So the first important thing is you switch on the machine. So the benefit is you will be getting voice instructions. Machine will speak to you. Machine will give you voice instructions. Second one is as shown in the figure. It will be shown in the figure where to keep the pads. So you have to attach the pads to the places shown in the figure. The third important thing is you should not touch the patient. You should not touch the patient. Why you should not touch the patient? Is there any problem if you touch the patient? Yes. If you touch the patient, your heart's activity will be checked by the machine because you are in contact with the patient body. So, you know, electricity is like that, right? So the machine will automatically identify the better heart rhythm. You have a better heart rhythm, right? So machine will confuse. It is an automatic machine. Machine will come to the conclusion that this patient is all right. Actually, machine is analyzing our heart rhythm. So never touch the patient when the machine is analyzing the rhythm. Machine will give you an instruction like that, okay? Don't touch the patient. I will once again show you what to do.
Apply pads to patient's bare chest. Plug in pads connector next to flashing light.
So as per the instruction, I am attaching the pads to the patient's bare chest.
Apply pads.
And
Connector.
you can see there is a light indicator here. This is the place I need to attach the pads. I am attaching the pads, okay?
Analyzing heart rhythm.
Again, it says analyzing the heart rhythm.
Do not touch the patient.
It is giving the instruction that do not touch the patient.
Shock advice.
Now the machine is advising shock because
Charging.
this particular dummy, it has no
Stay
rhythm.
clear of the patient.
So now
Deliver shock now.
I need
The
to,
orange button.
you see, machine is charged. I need to press the orange button. Orange button is blinking. If I press that, machine will deliver shock.
now.
But remember, when you
Press the
deliver
orange
shock
button.
also,
Now.
when you deliver shock also, you should ensure that nobody is touching the patient. Shall I deliver the shock?
Shock delivered.
Shock delivered. Now what you need to do?
Start CPR.
Immediately we should start the chest compression, okay? So what is the problem if somebody touch the patient when giving the shock? Obvious, that patient also will, that particular person also will get a shock free of cost. Actually, we try to shock the patient, but if somebody is in close contact with the patient, that person also will get the shock. So 2 times we need to be extremely careful not to touch the patient. 1, during analysis, 2, during the shock delivery. These 2 times we should not touch the patient. Now there are some problems that we experience while using the defibrillator or AED. The first problem is, especially in Indian population, we can see that there is hairy chest. So what will happen, this particular pad will not get attached properly, especially in males. A lot of hair will be there in some patients. It will not get attached. So what will you do? You have two options. Either you have to keep a razor with the AED machine and you have to shave. That will take a lot of time. Okay. So the better option is a lot of pads, disposable pads will be available with AED. So you attach one pad and machine will tell you no proper contact. Attach the pad properly. That means you understand the hair is not allowing this contact. So take the pad, the one that you have attached, you just take it forcefully so that 75% of the hair will come along with that. It has got an adhesive tape, right? Adhesive plaster like material is there. So most of the hair will come along with that particular. Apply a fresh pad so that it will attach properly and you can deliver shock immediately. Some patients, they may fall in water or drowning, near drowning. Okay, while swimming also, patient goes to cardiac arrest, or because of drowning, patient goes to cardiac arrest. Such patients, they will be wet when they are taken out of the water. They will be wet. Don't try to wipe their entire body because that will delay the time. But you should wipe at the chest. Wipe the chest and attach the pad. So you don't need to wipe the whole body. Some patients, you may see some medication patches. Round patches you can see when you take out the dress to attach the pads. Round medication patches can be there. In that case, you can take it out. You can take the medication patch, wipe the chest and attach the pads. Some patient will have a pacemaker implanted. So how do you understand that? When you undress, when you attach the pads, you can see that some patients, most of the patients, it is kept in the left side. A raised portion of the skin can be seen. Usually it is kept in the left side, but if there was some infection in the left side, some patients, it might be kept on the right side. That is the place you need to attach the pads, right? If you see that there is a raised portion in the skin, that might be a pacemaker or an implantable cardioverter defibrillator. In that case, keep the pad a little away from that, at least 1 to 2 inches away, you can keep it so that it is not injuring the pacemaker. Now, if it is a child victim or infant victim, you have to use child AED or infant AED if it is available, but that is very, very rare. Infant AEDs are very, very rare in our country. So, if child AED or infant AED is not available, you can still use an adult AED for them. But remember, you have to use a smaller pad. I have got a smaller pad. Yeah, probably at the end of the class, I will be able to show you. Not the adult pad, a very small pad is to be used for infants. Now, we have seen almost all the steps of adult basic life support. I would like to emphasize the importance of adult and pediatric chain of survival. So look at this. This is known as chain of survival. You can see that it is arranged just like a chain with the different elements in the chain of survival. The importance is if any one of these elements is missing, it will badly affect the recovery or the chance of survival of this patient. For example, take the first element in the chain of survival. That is getting an early access, getting early help. The first responders, early help is the first element in the chain of survival. If somebody is there nearby when the patient collapses, if the first responder knows what to do, there is all chance of survival. The second step, you can see in the figure that it is the early chest compression or high quality chest compression. As we have earlier seen, the trained person can do an excellent chest compression. The third element in the chain of survival is early use of AED or defibrillation. We have now learned how to use an AED. Another important one is, as soon as the ambulance comes, you should take the patient to a place where you get an advanced resuscitation. In the hospital, we may need a post-cardiac arrest care in the ICU. And later, so after so many days, the patient will be able to discharge from the hospital with the full neurological capabilities. Most of the patients may walk from the hospital with all the neurological potentials. This is known as the chain of survival. I hope this is clear to you. If one element in the chain, suppose the person who came to help him, he doesn't know how to give a proper chest compression, the chance of recovery is very, very minimal. Or if the patient is not transported to the hospital very faster, again the chance of survival is very minimal. Now, coming to a child. If it is a child and infant, what changes that you need to do when you give the help to the patient? That's what we are going to look at. All right. So if it is a child, is there any difference? The first question that comes to us is, who is a child? Who is a child? Usually, maybe you can say one year, above 1 year, but upper age limit cannot be prescribed. Usually, we say from 1 year up to 1 year, you call them as infants, very small babies. Above 1 year, but up to puberty. Puberty is the time the child becomes, or it is a transition time to the adulthood. So, how do you know whether the child has attained puberty or not? Definitely, you need to undress the child, right? To give CPR, chest compression, to use AED. So, when you undress the child, you can see that for a male child, if there is a hair growth in the chest or in the axilla, underarm, you can understand the child has attained the puberty. If it is a girl child, if the girl has got secondary sexual characteristics like a development of breast, the breast bud has developed, you can understand the girl child has attained puberty. You can consider these changes as adulthood changes. You can consider them as adult and continue giving compressions as we have learned earlier. You can consider them as adult. But if they have not attained puberty, you should consider them as child. So what are the difference in the changes? Or what are the difference in the way you give the rescue in child victims? Remember, if nobody is there nearby, don't leave the child to go and call for help. If it is an adult victim, you can leave the victim, you can go and get help from somebody else. But for a child, don't do that. If you are alone, you can call somebody by phone, but never leave the child. You should start the chest compression. You should try to give rescue breaths, because most of the time, child cardiac arrest is not because of the heart problems, like in adults. It is usually because of some respiratory problems. The child may put something in the mouth or nose that has caused an airway obstruction, or the child might have kept his hand somewhere in an electric plug that has caused electric shock. So in all these type of cases, the respiratory arrest and cardiac arrest occurs. So it is very important that you need to re-establish the circulation. So start chest compression for 2 minutes. Most of the patients, the child patients, will come back to normal life after your 2 minutes of CPR. If patient is not responding even after 2 minutes, you can call for help. When you give breath to a child, you know their lungs are smaller compared to the adults. Better you give lesser volume to ventilate. It is very difficult again to check the pulse, but here either you can check the pulse in the neck or in the femoral pulse. Now that I'm not advocating for that, you can look at whether the patient's breath movements are there, chest and abdomen is moving or not. And if the child is very small, you don't need to use your two hands like this. Only one hand can be placed on the patient's chest and you can give compressions very easily. Remember, there is no change in the rate of chest compression. At least 100, maximum 120. 100 to 120 rate you can. Depth also is the same. 2 inches or 5 centimeters you can. But there is a very important change. If there are 2 rescuers, if someone has come to help you, that person can give breath. You can give compression. I told you, for children and infants, giving rescue breath is very, very important. In that case, earlier for adult we have seen we are using 30:2 compression ventilation ratio. 30 compressions, 2 rescue. But for a child or infant victim, if 2 rescues are available, you have to use 15 compressions and 2 ventilations ratio, because children and infants require more breaths, because hypoxia may be one of the most important reasons that the patient has gone to cardiac arrest. Hypoxia is nothing but reduced oxygen level in the body. Now, coming to the pediatric chain of survival, the blue colored or purple colored part is explaining the pediatric chain of survival. You can see there is slight change in the pediatric chain of survival. The first one is something like a seat belt sign. That means most of the pediatric arrests, they are preventable. If the parents, if the teachers, if the healthcare providers take an extra step of care, most of the pediatric arrest won't happen. You might have heard this pediatric death, child deaths. Child has drowned in the bucket of water. Child has got a burn attack, burn injury. All these probably due to the negligence or carelessness of parents. So, or teachers in the school, there can be several injuries. I just want to emphasize that most of the pediatric arrests are preventable. So that is why the beginning, prevention. Second one is early activation and early access to help. Early high quality CPR, again the same thing that continues, okay? Early advanced care, ICU care in the hospital and the recovery. Now, we are going to the last part, that is the infant. The small child, less than 1 year. From birth to 1 year. Or after a few days of birth only, we call them as infants. After 28 days after birth, we call them as neonate. Now, what is the first step? How do you check the response? There is a slight difference. Because the baby is very small. You cannot tap on the patient's shoulder. That is very dangerous. Rather, you need to check the patient's response at the sole of the foot. Okay? You have to give firm, painful stimuli in the sole of the foot. Okay? Do like this. And you can call the baby, baby, baby. So baby should respond by crying. If no response, immediately you call for help. Because we may need help. We have to take the patient to the hospital. We may need a help to get the ambulance, to use AED, to give rescue breaths. All these things we may need a help. You see whether the patient is breathing or not. How will you check that? Look at the chest and abdomen. If no breathing efforts, activate emergency response system, ask for an aid. And if no pulse or no breathing, you have to start the chest compression. Here you don't need to use your entire hand. 2 fingers are enough for the infant. 2 fingers, keep it on to the patient's breastbone as I have shown in the figure here. You have to give compressions. So it is middle of the chest, only on the breastbone. Never keep it on the ribs. If you keep it on the ribs, it will break. So the best method will be you to place your fingers in between, maybe an imaginary line if you draw between the 2 nipples. That will be the excellent place to keep your fingers. So usually people ask, if it is a small infant, do you want to change the rate of chest compression? No. The rate of the chest compression remains same, 100 to 120. But the depth can be a little reduced because it's a very small child. You can give 1.5 inches or 4 centimeters, a little lesser than that we have given to the adult. Now, when you give rescue breath also, you should be very, very careful because they have got a very small lung. So give very less amount of air to give rescue breath. Okay. Now, I hope this is clear to you. Now, if there are 2 rescuers coming, instead of giving like this, you can keep the patient like this. And with the 2 thumbs, you see, I'm using my 2 thumbs on the patient's body, and I can give compression like this also. But provided there should be 2 rescuers, 1 person should hold the head. You know, the infant's head is very, very important, right? Especially when the mothers give you small children to you to take care of them, they will always support the head and neck part. So the same way, this part is not fully developed, the cervical part, the neck part. So you should always give a support to the head when you give the chest compression. All right. Now the last part is adult and child choking. You know what is choking, right? It is nothing but all of us have choked. Choking is nothing but entry of a foreign material, foreign body, maybe a food or water or milk or whatever it can be, to the airway, to the respiratory tract. This is called as choking. Definitely all of us have choked once in our lifetime. Maybe a small, food item might have gone there. Especially this happens when we laugh or speak during eating. This can happen. And people, some of our friends or relatives will try to come and help us by tapping on the head and all those things, unscientific methods. Fortunately, we were fortunate because the material that was choked was a very small one, maybe a 1 rice or a very small piece of chapati, something like that. That cannot obstruct the airway fully. So the benefit is we had only a partial choking. Somehow we were able to cough and take out the material. For some time we will have some irritation, otherwise we were safe. Suppose a larger part, larger food item has maybe a very big chicken bone or a very bigger fruit, something has gone to the airway, it will completely obstruct the airway, and this is called as real choking or complete choking or complete upper airway obstruction. This can be life-threatening. That can be very dangerous. So usually people with choking will show a sign like this. They will keep their hands on the neck because they can't speak. Airway is completely obstructed. Speaking and breathing come through the airway. Speaking, the organ that is help us in breathing is the larynx. That is there in the airway. So the person who is completely choked cannot breathe, cannot cough, cannot speak. So they will keep their hands on the patient's. You can see, this patient is about to die. Okay. Now this is another type of universal choking sign. Now look at this, patient is trying to talk, but no voice is coming outside. Patient is trying to say something, but you can see her, yeah, they are all choking signs, okay? Patient is not able to talk anything. He is about to die. So what are you going to do? You have to help the patient. You should ask the patient. You should tell him, don't get worried. You know how to relieve choking. And you have to use a particular technique called as Heimlich's manual. Heimlich's manual. How do you do that? Can you see this patient's eyes and all are protruding because he is going to die if you are not helping him. So you should approach the patient from the back side. You should keep your finger, you have to make a fist with your hand like this. And the fist, the thumb part should come to the abdomen. You can see in the picture how I have kept my hand there. That should be below the sternum, below the breastbone and above your navel, the umbilical area, the umbilicus area. Above the umbilicus, but below the sternum. On the abdomen, you have to keep. So do like this, and above that, you support with your other hand. And what are you going to do? You are going to place, give firm pressure onto the patient's abdomen. This is called as giving abdominal thrust or Heimlich's manual. Abdominal thrust or Heimlich's manual. So, what type of movement are you doing on the abdomen? Backward and upward. Backward and upward. So, what will happen? Intra-abdominal pressure will increase. This will increase the intrathoracic pressure, and the foreign body that has obstructed the upper airway will come out. So, when you do this, you will be looking at the patient's mouth, whether it is coming out or not. Maybe you have to continue this procedure until the foreign body comes out. If the foreign body is not coming out within a few seconds time, patient will become unresponsive. He may collapse onto the floor. Once the patient collapses, you place him onto the ground safely. You immediately start chest compressions. No worries. The chest compression that we have learned, you have to do. That can also bring the, as you give the chest compression, intrathoracic pressure increases. That will take the foreign body out. But only one difference. After 30 compressions, if you give a breath, look at the mouth whether the foreign body has already come out. If you can see the foreign body, take it out. But don't keep the finger unnecessarily thinking that the foreign body might have come back. No, don't do that. No blind finger sweep is allowed. Now, if the patient is a pregnant woman, remember, don't give abdominal thrust. Or if the patient is morbidly obese, very huge person, you can't give the patient from the back. You can't hold the abdomen like that. Very huge abdomen is there for the patient. In these two cases, use chest thrust. Instead of keeping it in the abdomen, keep it on the chest. The same place where we have given the chest compression earlier. Same place. Now, if you are alone, give 2 minutes of CPR, because you know what is the reason for this cardiac arrest. It is an airway obstruction. Give CPR for 2 minutes, then only you leave the person if you are alone. Otherwise, call for help through telephone. Suppose an infant chokes. If adult or child chokes, we may use the Heimlich's manner or abdominal thrust, as I just mentioned. If a small infant or less than 1 year old infant chokes, this usually happens because these infants, they do not know. They may search for some toys and all those things, and they try to keep, you might have observed, they try to keep all those things what is available to their mouth or nose. So remember, what you need to do is, you have to keep the infant in the opposite way. Like you have to keep the infant in the, you have to turn the patient in the upside way, like as you can see in the figure. Patient's mouth is secured very well, and you have to give back slaps. On the back side, in between the two shoulder blades, you have to give slaps. 5 shoulders or back slaps. After that, you have to turn the patient to the supine position, the normal position, and you have to give 5 chest thrusts on the chest, just like you have given the chest compression earlier. This should be repeated. 5 back slaps, 5 back slaps, 5 chest thrusts until the foreign body comes out. If the infant becomes unresponsive, now there can be a question: how do you know the infant is not infant is choking? The adult, we have seen the adult universal choking sign. A child will have show distress, and child's cry will not come out. Child will be crying, but a sound will not be there. This indicates that the infant is in choking. So you have to use this back slaps and chest thrust. If the infant become unresponsive, you have to start chest compressions with one difference. Each time you open the mouth to deliver breath, if there is a foreign body, you take it out, but no blind finger sweep. I think I have almost completed all the important elements of basic life support, pediatric life support, and advanced life support and orientation to you. Remember, this online interaction will only give you a broader awareness that these type of skills are to be learned. If you can learn these skills through a physical training, definitely that can be helpful to many of our significant people around. That can be a family member, that can be your colleague, that can be anybody from general public. So your life has a meaning when you save lives of people around you. Remember, if no training is given, we advocate people to do chest compressions alone. They don't need to give artificial breaths. It is very difficult without training. This is named as hands-only CPR. But with some training, with a one-day training, even we can make the people very, very proficient in basic life support. There you can advocate rescue breaths, where you will give a 30:2, 30 compressions and 2 breaths. The ratio will be used for people with a small training. When you become an advanced healthcare provider, we usually use teamwork, multi-rescuer coordinated CPR. So if there are questions, I will take it up a few questions, and I can see in the chat box, what is the ratio for 1 and 2 rescuer? That is one question that is being asked. That's a wonderful question, again, from the same person. Very happy that he is asking meaningful questions. If it is an adult victim, the ratio of compression and ventilation is 30:2. How many rescuers are also there? No matter. 1 rescuer, 2 rescuers, 3 rescuers, the ratio remains same for adults. 30 compressions, 2 ventilations. For a child victim and infant victim, if 1 rescuer is there, 30:2. 30:2 is a universal compression ventilation ratio. But for a child and infant victims, if 2 or more rescuers are there, you can give 15 compressions and 2 ventilations. So 1 rescuer, all the age group, same. 30:2. Adult, how many rescues also? Same, 30:2. But for children and infants, the compression ventilation ratio becomes 15:2 if there are 2 or more rescuers. 1 rescuer will give compression, another rescuer will give breaths. Are there any other questions? You can either raise your hands or you can type it in the chat box. Usually, basic life support training is a highly interactive and competency-based training that we give for 1 full day. Usually, the session starts at 9 o'clock and it will finish almost by 5:30 in the evening. Everybody will get a chance to practice these things with a high fidelity mannequin. They give compressions, they give breaths, they use AED, they use manual defibrillator, they relieve choking. So by the end of the day, you will become very proficient in saving lives. In this, we will deal with adult arrest, child arrest, infant arrest, adult and child infant pre-arrest scenarios. So this can be arranged if you are interested. ALS training, advanced life support training is usually given after the BLS training. Once the person qualify in the BLS, we give advanced life support training for 2 days. 2 days fully interactive program with mannequins and high fidelity dummies. That is again 2 days program. That we will give only to the healthcare providers, healthcare professionals only. But BLS can be given to anybody. Healthcare providers, teachers, any first responders, anybody from public, students, everybody can take up. Actually, it is our social responsibility that we learn basic life support and save a lot of lives being responsible first responders. Pediatric life support training is again for 2 days for people who have qualified basic life support. That is again only given for healthcare providers, people who are in the healthcare profession. But basic life support, if you learn, that will be very effective in saving lives. Until the advanced providers arrive, you can manage the life. One more question is there, yeah. Yeah, that is a thank you message. Excellent. If there are any other questions, I would like to spend maybe 5 minutes. Otherwise, yeah, thank you for your active participation. At least one person was asking a lot of questions in between. That made me more, enthusiastic and motivated. If there are any more questions, otherwise we will wind up because there are afternoon sessions. You may have to take a lunch quickly and come back for the afternoon session. Yeah, if the ribs fracture during the CPR, then can we continue CPR or? Yeah, this is a very important question. Ribs should not fracture during CPR because if you keep it on the patient's chest in the proper position, no rib fracture will happen. But if you are not proficient and you keep it on the ribs, rib fracture will happen. In that case, that much pressure may not be applied to the chest because if already ribs are fractured, you can simply press from outside. You can simply manipulate the heart from outside. But remember, if you are trained, if you get a very good BLS training, single rib fracture won't happen because your hand position will be exactly on the sternum. Your heel of the palm will be on the sternum. Otherwise, the ribs may fracture, but we still continue to give chest compression because if you are stopping chest compression, patient will become RIP. That's a good question. Any more questions? So thank you for active participation and let me now stop the sharing and now if there are any questions, I will clarify that. Otherwise, I would like to thank Sri Dr. Ravindra for thinking about this particular topic as the first topic of the discussion of the day, understanding the importance and relevance of this topic. And I hope most of you, those who have listened to me, would definitely take a offline, a 1 full day skill training program that we may arrange later. And I once again appreciate the efforts by the organizers of the program and for your invitation, Dr. Ravindra. Thank you very much. And everybody, those who joined us in this platform directly, those who listen to us through the YouTube live, thank you very much. And if you have any question, you can access my number, you can access my email through Dr. Ravindra. You can contact me directly also. I'm very sorry that I couldn't speak in Hindi. I'm not very proficient in Hindi. But if there are any questions in Hindi, if Dr. Ravindra can translate, I will be able to answer those questions also.
Thank you, sir. So we will take a query from Sujit Gupta. Yes, Sujit Gupta जी.
यस सर.
हाँ बोलिए आपका.
सर यदि हम चेस्ट कंप्रेशन कर रहे हैं उस टाइम स्टर्नम की हड्डी फ्रैक्चर कर जाए तो क्या कर सकते हैं? मैं वो पेशेंट कहीं डेथ भी कर सकता है?
Understood. If fracture happens to the sternum, what will happen?
Yes.
What to do?
Yes.
Yes, sternum won't get fractured. Sternum is a very strong bone. It is called as the breastbone. That is in the middle of the. If you have seen the skeleton in our schools, you or in the science labs, usually we have seen the skeleton is exhibited. This particular bone is a very strong bone. It will not get broken. The chance for break or fracture is on the ribs. So the way you keep your hand position is of immense importance. You should not keep your hands on the ribs. It should only touch the sternum. The pressure should be on the sternum. Sir, can you translate?
Yes, sir. Thank you. Thank you.
Understood.
Any other participants? If you have any queries, you can unmute yourself or you can put in chat box quickly so that we can take up queries. Feel free to discuss. This is a very important topic. In fact, every person needs to know this because we don't know when this life-saving technique or the strategy could be used, because we see lots of people, we are working with people, and it can come into action at any time. I mean, it can be used with family members and in any emergency situation. So this is very important. Yeah. In fact, this has to be part of school and college curriculum itself. It has to be mandatory, but somehow it missed from the curriculum. Hope this new NEP curriculum will also address that issue.
Very true, sir. Very true.
Yes, sir. So, yeah, there is a lot of appreciation from everyone. So, okay, sir, if by that time we can introduce ourselves that we are skilled in, yeah. Yes, sir. Okay, I was going through all the chat messages. Everyone is appreciating you. There are no query as such, but yes.
There is one query on joules for shock. Yeah, this particular question, yeah, this is again excellent question. In automated external defibrillator, we need not select the joules. This is already automatic. There is a prefixed joule. You can't change the joule. Joule can be adjusted only in the manual defibrillator machines that we use in the hospital. That should be used only by trained healthcare professionals like doctors and nurses who are specially trained to use that. And ALS certification is mandatory to use that. For the manual defibrillator, we have different joule settings that need to be explained. But AED, you don't need to do anything. There is a prefixed joules. So we have nothing to worry about that. You can get my number and probably you are a very good candidate for an advanced training. Probably we'll discuss. Yeah, tomorrow onwards we have a training in Chennai and Calicut simultaneously on basic life support and advanced life support. So you can join one of our training programs. Excellent.
Yeah, we are also planning with support of Dr. Sajid Kumarji soon, because this we want to take up this training, as this is more skill-based training. We just wanted to give the overall overview of how this actual process goes on and how we can save lives. So that will bring us more motivation and curiosity to take up. So definitely it has done justice to the sessions, and whoever is interested, I mean, can definitely reach us. You all have our contact numbers, so you can reach us. So we will accordingly we will plan and we will organize soon in Hyderabad. If you because people have joined from across India and abroad also, we see few participants. So if you need any training at your place also, we are welcome. So we will forward your suggestion or queries or request to Dr. Sajid Kumarji, and he will definitely do the needful, and he will coordinate, and we will also coordinate with you, and we will try to see that training happens at your place also, if feasibility is there. So that is always possible because Dr. Sajid Kumarji has been training across the nation and also trained abroad participants also. So this shouldn't be a constraint to conduct any kind of training. Definitely, this has given a lot of input, sir. We are very thankful to you. I think at least if 50 participants and many participants have been joining and leaving. So at an average, if we can see that taking 50 participants also at any time, so 50 participants has taken this knowledge, and also other participants watching on YouTube. So definitely, I think all the 50 participants maybe who have joined directly can save at least one life with this session. So that itself is a great takeaway with this session. And definitely we look forward, sir, for your physical sessions also. So I will speak to you later on and work on the practicality of that. So anyone, whoever is interested, there is an option in the feedback form where we have customized this feedback form. So if you require any particular training or any specific training also, we have included certain fields in the feedback form so that you can opt for that. And whoever has opted now, then definitely we'll communicate to you, and we will organize one such offline session where we all can come together and learn together under the expertise of Dr. Sajid Kumarji and other professionals. So
thank you very much, sir. May I take a leave now, since we are proceeding to the maybe afternoon sessions are planned a little early, I suppose.
yes, sir. Thank you, sir. Thank you very much.
Thank you very much.
We are very fortunate and we are very thankful and grateful to you. We express our gratitude to you and organizations like Government Nursing College, and also your family especially, because Sunday they have given their valuable time so that you can spend with us. Especially we are very grateful to your family because we got an opportunity. Thank you very much, sir, for joining us on behalf of Sri Holistic Health Foundation India, and also Sri Research Institute and Center for Art, Sciences and Wellbeing. And on behalf of all the participants, we express our sincere, heartfelt gratitude to you and offer our sincere thanks for joining us and for accepting an invitation and contributing enormous awareness, knowledge in saving lives. God bless you and wishing you all the success.
Thank you very much, sir. May I take a leave now? Thank you all. Thank you all participants and Dr. Ravindra and the entire organizing team.
Thank you, sir. So with that inputs taken from Dr. Sajid Kumarji, we know that with the basic training, we can save lives. So often this training is missing in the mainstream. So we all need to get trained in these basic skills that will help us not only save ourselves, to save people around us. The motive for this training or awareness program is to create an awareness that such a program exists, and we all need to get trained as an first responders, as social workers, as psychologists, as counselors, and also as medical and health professionals. We all need to know these basic skills which can help in saving precious lives, which otherwise could be lost in no time. So timely, adequate procedures and skills will always help in saving lives in times of crisis as well, in pandemics and endemics, and in times of floods and all these crucial times. So thank you once again, all the participants. So we will move on to our next session. So if you have any queries, you can keep putting them in chat box. We'll take it up at the end of the session or whenever the speaker permits us. So let's take a quick break, maybe 2-3 minutes, and we will continue with the next session. Good afternoon, ma'am. Can you unmute yourself and share slides, ma'am? We can check whether they are working or not.
Okay, sir. One minute. Screen is there. Screen, it is not powerful, no, I can share screen and then. Sir, is it visible? The first slide.
Yes, ma'am.
Sir,
Ah,
am I audible? I'm not using headphone. Planning to use this computer audio only. So, am I audible?
Yes, ma'am. Now it's fine.
Thank you, sir.
Yeah. You can check, ma'am, whether slides are changing.
Yes.
Yeah.
Is it visible, sir? Okay, sir.
Yes. You can stop sharing, ma'am. I will introduce you.
Okay.
Yeah, good afternoon, one and all. A warm welcome to you to the afternoon session. And after listening to Sajid Kumarji, and we are very motivated and inspired to take up the cause of saving lives. So let's move on to our next session. And fortunately, Dr. Reena George is Mrs. Sajid Kumarji. So we are very fortunate to have both of them with us. And Dr. Reena George, we welcome you once again to this wonderful international webinar cum workshop on health and life support systems, careers and sustainable development. And Dr. Reena George is the assistant professor and head in Department of Psychiatric Nursing, completed PhD and from Research and Development Center, Bhartiyar University. She also completed MSc Psychiatric Nursing from Father Muller College of Nursing, Mangalore, and MSc Applied Psychology from Annamalai University, PG Diploma in Counseling from Calicut University, Certificate Course in Family Health Care from KUHS Thrissur, and Diploma in Community Mental Health Nursing from NIMHANS. And her areas of interest are qualitative and mixed method research, palliative care, hardiness training, community mental health, preventive mental health of family caregivers, adolescents and women. She served as member board of studies nursing at Kerala University of Health Sciences, and she has vast experiences of 16 years of clinical, UG and postgraduate teaching experience along with clinical experience. So we are very fortunate to have such a experienced speakers lined up for the day. And I warmly welcome you, ma'am, once again for your session on managing psychosocial issues of women in India. Over to you, ma'am, for this session. Thank you.
Thank you, sir, for your great words. I'm going to share my PPT once it is visible. Please tell me, sir.
Yes, ma'am.
Can you see the first slide, sir?
Yes, ma'am.
Okay.
You can put it full screen mode. Yes.
Is it okay, sir? Okay. Well, good afternoon to one and all. I'm so happy that Dr. Ravindra has invited me for a talk. Actually, we had some contact when he came to India, came to Kerala to attend a conference in IMHANS. And what I feel is he's a man who is respecting women. From my experience, he was very professional and kind-hearted. So I have kept contact with very few people only I keep contact with, and he's one among them. I'm so happy to share my ideas, views on this. I don't say that what I'm sharing will be 100% correct with regard to our psychosocial setup. But most of the time, from my experience and the cases I am seeing, I have taken for the presentations. So we know that when we consider Indian culture and how India has considered women, what are the psychosocial issues we face? We know that the famous slogan taken from Manusmriti is "Yatra naryastu pujyante ramante tatra devada." Etraidastuna pujyante sarvastrauta phalakya kriya. That means where women are honored, divinity blossom there, and where women are dishonored, whatever is our actions, no matter how noble it is, it remain unfruitful. So it's women are a part of our society. They take up major role in maintaining health of the family, even mental health of family, and so that through by the society, and our country can be well maintained its mental health through health of women. So when we are seeing the social status of women in India, we know that women has been given the status of goddess in all epics, our Puranas and all stories. And we consider them as mothers, or we do Nari Puja, all this. But when we think the current status, the women are experiencing opposite of this due to many various issues. So when we consider, tell that we worship them as goddess, and on the other hand, some of them are experiencing abuse and inferiority feelings due to various type of treatment they are experiencing from the society. So this is a famous quote of Gandhiji. He has told that the day women can walk freely on the roads at night, that day we can say that India has achieved independence. So independence is not for any particular culture or particular gender, it's for everybody. We can say that if all the people who can enjoy freedom, then only we can say that our country is really independent. So we know that we expect a lot of things from women, like if we are considering their roles, we feel that they should be obedient daughter. If we have a child, two children, one male and female, we expect the female child should be more obedient than our men, because we feel that they should be well adjusted to a family in the future. So obedient daughter, the polite and never complaining wife, and suffering mother, an altruistic grandmother, a productive working woman. So just understand, if they are standing in the problem like a lotus bloomed out of mud, can our women be? So if we are giving them a peaceful environment, you know that they will be outperform our expectation. So better to give them a warm environment to bloom. Then only we can expect all these whatever our expectations. Otherwise, what will happen when the atmosphere is or environment is highly negative? How a person can grow? So you know that you may speak. I know the women. Even I'm not commenting on men. Most of the men are very decent with women, as per my experience. I don't comment that they are creating all the problems. So don't take in that way. So women, the women you know is different from what they experience. So the more than what you know, like a mother spends sleepless nights. Most of the time when family is sleeping, all others are sleeping, some of the mothers are woke up and they take care of their children, thinking what will happen in their future, or treating the ill family member, and they are thinking of health, kids education. Sometimes above all their work, they have to take care of kids education. They have to earn for the family, compromising their own health for others. Sometimes if the spouse left them, they have to work as a single mother. Then role reversal. Sometimes if some husband fell ill or leave the family, so sometimes the mother has to take up the role of the father also. So role reversal also they have to do. And you know, if they smile and laugh for you when their heart is leaking in pain, even though the women are smiling, their heart may be leaking in pain. So just see, they are focusing on your happiness when they cry inside. So when we are considering a wife, you know that, oh, it's my wife. When you speak, you see the back, what happens in her life, like absorbing stress of family, sometimes silent sufferer. Very few only take courage to get out of the pain of torture from the family. If at all they get some pain or torture, physical torture from family, very few take courage to leave the home. So living for kids, struggling to get appreciation and love from spouse. Most of the time we need appreciation, we seek love. So when we are not getting it from family, there is a chance that we may feel depressed and we may rely on others for this. So better to give them love, affection, appreciation from the family itself. I'm not telling about women only. Men also have to get appreciation, love from spouse. So whatever it is, so complementing with the body image disturbance, when we are considering men and women undergo a lot of body changes due to hormonal changes and imbalances, or the role they take up from a wife to mother, all this type of their roles. So sometimes they may be disturbed in their inner side because of body image disturbance. So that also they have to compete with. Then managing spouse who uses substances, one of the important problem our India is facing. Some of the spouses are using drugs and illicit drugs, alcohol. So that is another issue of the family. Then assert, if the woman is being assertive, saying that this is not okay with me, then they are considered as pride women. So sometimes women cry bitterly when world sleeps or when she's alone. One of my friends told me, my pillow is wet. Only my pillow is wet because nobody knows that I'm crying. So I wait for everybody to sleep on or sleep and dream well when I'm crying. So they are crying for the families. It happens. So her smartness is only recognized by the family when faces sort of crisis. So if family is going financial crisis or they can't take a decision, male members are not able to take a decision in particular situations, the women come up, and that time only we respect them and their presence. They may run the family. I have heard many stories from many business families that when business profit came down and it was in the loss, the mother has taken up the responsibility and she started selling things and started business well, and they have again sprouted from that crisis, and now they have become rich people. So sometimes when crisis faces only, we recognize their presence. So this is a question for the persons who are hearing my class. To the men, have you ever told your kids, my wife was a beautiful girl when I married her, and the current look of unattractiveness is the result of her hard work for her family. She's beautiful beyond comparison. Most of the time children say that father has to attend their parent-teacher meeting. Papa or dad, you come and attend. We don't want mama to come because mama is not beautiful, or she's fat, or she's dark. This may be the comments of, this is from my experience. Some of my friends also have told. So sometimes these comments will come and father also join them and enjoy laughing. It's not nice. So whoever is not there, its spouse has to say to the children that she was beautiful when I married her. She was thin, or she was whatever. Her body image doesn't matter. She is doing good work for our home. So you have to start. If you are telling that you are a lovely spouse, and understand you can't expect a zero size for a struggling woman when they are struggling to many things that to meet both ends of the family by their cooking, their actions, all this work. How can we expect zero size from our spouse? So working women, when we are taking in consideration, most of the responsible and talented, and they stand behind the curtain when the company is leading to the profitable status. But we don't mention that it is she, or she also work. Most of the time they stand behind the curtain and working hard to fulfill the responsibility and struggling to see that personal life pains are not affecting their work. Some of the women I have seen, they come to the office crying due to family issues. They come, wash their face, do makeup, and they are happy there. When they are going again, they are carrying the burden of their pain and going. Most of the time they see that their work is not affected by their personal life issues. And sometimes the women are bringing lunch and taking it back home because they don't have time to eat. And sometimes the women may not take water thinking that they have to go to washroom for urinating. If that much also work they can do if they don't take water. So working women are priceless. So just appreciating her if they are at your family. And when they are coming to the pregnant and lactating women, stress and strain, most of the time they are not able to enjoy the happy moments of maternal experience. Actually, maternity and lactation is a happy experience in a woman's life. That should happen. But most of the time, due to stress, how to live and how to manage all this balance in family, balance between family and work, all this making this happy moments a stressful experience for. And not only that, criticism of body image. So we know that we are always appreciating the external appearance of a woman or man, and we think, why you are so fat, why you are so looking ugly, this, that created sort of what their mind may get pricked because of our negative words. So uncertainty of child here is another issue. Sometimes when nobody is sometimes parents are not healthy, grandparents are not healthy enough to look after the child or give supervision, or sometimes we are depending on the maid, whatever it is, they feel that it's not how to take care of the child is another issue. So this also causes stress in women, working women. And most of the marital issues happened in pregnancy and lactation. Just observe the pregnancy and lactation period. Most of the family therapy cases are coming during this period, because men are commenting that my wife is focusing on child, not spending time with me, and not loving me as she was before. And wife is telling, husband is not supporting when I have to work up all night for the child, husband is sleeping. So this combined with mild what interventions, good discussions, we can tackle this problem in family. But understand that women are experiencing a lot of stress during pregnancy and lactation, and dignified men only stand and support during this time. Some men, they will stand with the wife, they will help, and they will help in rearing the children. And I have seen most of the males stand with their wife. Very few are creating issues. So the woman, is more than what is regarding unmarried women. They don't think that they are free birds, they can do anything. They are also in struggle. Most of the time, though they are happy, people will comment, why are you not getting married? What happened? Oh, what's the reason for not getting married? Is it a love failure or somebody cheated? All this type of comments. And so she has to be her own bodyguard. Like we can say that we have family member, if she's staying alone, she should work as her bodyguard, being assertive, managing stress. Sometimes they are not getting married due to their responsibility towards family. They have to give financial assistance to family, or sometimes they have to agree for the marriage which they don't like. Because of the force from the family and the society, they are getting married. So sometimes they appear to be bold, but they cry when they are alone. Understand, all the boldness you are saying in women is not as it is, as the real. Sometimes they cry when they are getting good person to cry out, or good understanding people in and around them, or they will when they are alone. And sometimes women without children are also experiencing a lot of pain. Some people are enjoying their life, though they have kid or not. It doesn't matter. That's my belief. Kid we have or not, we should enjoy our life and stay peacefully. But sometimes they get comments, why are you not becoming pregnant? Being her own mental health guard, they have to do. And sometimes they have to also, they have to be assertive, manage their stress, and they have to care all family members. Some people may comment from the family, no kids, so no property is needed. This type of comments they have to face. In-laws are not agreeing for adoption. Recently, one of my relatives, they were planning to get a kid for adoption, but their family members told, no, we are not allowing somebody's kid to come to our home. We don't know what is their genetics, this, that, and all. So this comments also we may get. So they appear to be happy, but flows tender heart out when alone with intimate friends. So whenever you are coming in contact with women, understand they have a lot of pain at the behind. They may appear very bold, very beautiful, very, they are able to manage everything. But above all, they have a ability to comfort others, though they are facing a lot of issues. So coming to the common psychosocial issues related to women are social issues. As you all know that violence against women is one of the areas we have to comment. So negative comments on body image, to dowry-related harassment, marital rape, and genital mutilation. So when I was learning for this presentation, genital mutilation, I have believed that it is only in some countries like Africa, some continents. So they see this showing that Middle East Asia, where female genital mutilation is common. But when I have read Indian situation in May 2017, a public interest litigation, PL case was raised in India Supreme Court also. This case was filed by Sunita Tiwari, a lawyer based Delhi, and sought a ban on FGM. So it is not rare in India. It happens in India also. Female genital mutilation means the removing the clitoris of women, that is so that they should not experience the sexual feeling. That's what. So this type of procedure is done by some community. This is a case in 2007, only 5 years back. So when we are telling that we are highly literated or we are educated, we are having culture status, everything, some people are experiencing pain due to some beliefs and culture also. So this is not very familiar to us, but when I referred, I got this details. This is the Hindu news that time on May 11th, 2017, it is published. A lawyer speak on what prompted her to take up an issue, apex count, like wagging a legal battle to ban female genital mutilation. So this is not rare for us, it happens. So another issue. So gender discrimination is another issue. It happens from ancient times that then women are not getting equal pay for their job. It's commonly not seen among professionals. So they are getting equal pay. If I consider my institution, everyone are getting equal pay for their equal work. But some of the coolie work, like or unskilled work, laborers, they are not getting equal pay. So lack of female education and gender pay gap is another issue. Females has to be educated. They have to get education. Education is the only ultimate source for us to maintain our psychosocial balance. So we don't say that, we don't consider that if women are educated, they will overrule us. Not that. If women are educated, they will highly understand what's the situation, how to manage their stress, all these things. So they should get educated. And mood and behavior changes is another issue. You know, their menstruation, menstrual cycle, or this associated with their hormonal changes like irritability, restlessness, anxiety, tension, migraine, sleep disturbance, sadness, dysphoria, and lack of concentration. All this happens during premenstrual and menstrual phase. We know that premenstrual syndrome is a condition which has to be treated, and some women are able to manage it well, some are not, who needs treatment. So understand this is another issue. So, and during pregnancy and lactation, it's pregnancy and lactation, this mental health issues are common now. It's perinatal psychiatry is an emerging area where women are supported during their pregnancy and lactation. Most of the cases were not coming to hospital for treatment because grandparents or some others may tell that, oh, it's common. The mood changes are common. It's okay. But when it crosses the limits, like harassing child or but it's a danger to their own health or child, then only they come to hospital. Not like that. It's an issue. So during pregnancy and lactation, anybody is showing mood changes like features of depression or anxiety or some psychotic features, please take them to hospital. If at all they are telling you they are stressed, they need counseling or they need psychosocial support. So it's not alien to us. Pregnancy and lactation is a period for some people which they can experience stress. So their women's health is focusing on these areas like biological, psychosocial, and social areas. If our support system are good, there is the women will be able to maintain their mental health, psychological factors, and biological like neurotransmitters, endocrine system, family and genetic, sleep, dysfunction. All these things are contributing to the health of women. So you understand that mental health problems in women happens due to various issues. Like we can't say that one reason is the sole responsible for a mental health issue, but gender discrimination, poverty, hunger, malnutrition, overwork, hormonal changes, domestic violence, sexual abuse, all this and all these are connected to frequency and severity of biopsychosocial factors. All this causes frequency and severity of mental health problems in women. As the frequency and severity of psychosocial factors increases, the mental health issues also increases. It has a positive relationship. So if we can tackle frequency and severity of biopsychosocial factors originating from gender discrimination, poverty, all these issues, we can manage our mental health issues. Like then common psychological disorders in women are depression, psychiatric disorders related to reproductive events like postpartum depression, postpartum psychosis, anxiety disorders, panic disorder, phobia, PTSD, all these are somatoform eating disorder, borderline personality can be experienced by women. You know that mood disorders, sometimes they will be very happy, sometimes they are very depressed. So bipolar affective disorders is one of the area. And we thought the substance use are common in men. It were believed to be predominantly male phenomenon, but now for the last few decades, we know that it's shifted to female drug use and repercussions in women. So it's not uncommon among women. Substance use also are increasing among women. They are finding this type of sources to manage their psychosocial issues. So it's going to an unhealthy type of managing their stress. And another issue is anxiety disorders. So sometimes they are not able to face their relatives or public family members. So social anxiety symptoms also can happen. Then somatoform disorders are very common. So largely due to psychological origin, this happens like a somatization, conversion, hypochondriasis, all this. Eating disorders are also common. Bulimia and anorexia nervosa are common. Then the common psychiatric disorders related to reproductive health, I have already mentioned. Due to socioeconomic factors, reproductive health, quality of intimate relationship, experience of family violence, common perinatal mental disorders, and use of psychiatric and essential preventive health care is essential to manage this type of behavior. So what can we do to tackle this common psychosocial issues? How can we tackle it? Like service provision and utilization, you understand that whenever women have a psychosocial issue or mental health issue, they don't go to hospital thinking of the stigma or underutilization by suffering women. Why it happens when one woman for every 3 men, when 3 men are approaching healthcare system, only 1 woman is coming. Actually, population, when we take, women are outnumbering men in most of the places, but they are not coming. Underutilization by suffering from it, attributing it to greater stigma attached to women's mental illness. If a lady is telling that they are mentally ill, the family may think they may not get married, or what people will tell, or what society will tell. But in case of men, they may think it's okay. They get treatment and they'll get a wife. It's not a major problem when considering with the women's problem. So they may not take women to hospital, and they will go for utter mental illness. This is not told by me. It's WHO's 2020 data. They have published saying that so lower importance according to women health is generally happens in the world. So managing psychosocial issues is not a easy method, but days and years are not sufficient to find solution for psychosocial issues faced by women. By one day we can't tackle this. We have to join our hands to work. We should have a focused objective to work and solve this issue. All the people from different areas of society should come up, starting from the politicians, lawyers, public professionals, psychosocial workers. All people have to stand together to tackle this issue. Then only it will work. So, but productive solution enough to save. I'm not saying that solution is not there, but one productive solution may work. So how can we tackle these issues, like sensitizing the society? The society should understand and create a safe place for women to live. Equal education opportunities, compulsory women education, equal pay for same job. Laws must be made more stringent for crime against women. We know that government has produced a minimum age for marriage of women recently, 21 years. What I feel is, along with that, there are criticisms, whether it has to be done or not, whatever it is. I'm not going to that criticism, but when they are thinking that its age has to be increased, they have to see that women are educated also. Before getting married, they should have at least compulsory education. They have to complete 12th. Then it's good. So they should have some education before getting married, not only the age. That was my feeling when I have read that news. So women should get compulsory education. It's not only good for herself, it's good for the family. At least she will have some ideas how to move, how to behave, or behave when stress is there, or how to find a job. All this, the minimum qualification for public service commission, what jobs are +2 or pre-degree. So at least we have to give them that much education to make them to stand on their own leg. Then only arrange their marriage or what. So next is policies. People working in the public should influence political and economical system to develop policies. So women's health must incorporate in mental health, physical, and you know that when we are considering women, always maternal and child health is given important. Not only that, complete mental health care of women has to be addressed. And education, training, and interventions, including targeting social, physical environment, are crucial for addressing women's mental health. Identification of significant persons in government departments, relevant groups in the community. You know that government departments and government and those who are making policies are not getting adequate data from us. So public and the public leaders, or we have to give them information that women are suffering. Otherwise, the policymakers may not know that how they have to. They will be making policies thinking that it's benefiting to the whole community of India. But we should, the one who should sensitize people, saying that this is the issue. So we have to focus on that when developing policies. So, and extent of women's problem and burden associated with the women's mental problems and development of policies to protect and promote women's mental health are extremely crucial in this era. So we can't say that government is not giving proper guidance or proper policies or support. They should know it from us. Like we have to do a lot of research and give the data to them, or inform them that this is the problems happening in various areas. Then only it may happen. And when I was searching, I have found this from the net. What are the benefits available for women? There are a lot of government schemes for women in India, but they are not aware of it most of the time. Our women are not aware of most of the policies or procedures or available schemes, benefits in India. So somebody should sensitize them or inform them, like savings bank account, health, life insurance, whatever, being a woman, whatever advantages they can take from this available policies. I think this itself is a topic for our workshop or conference, like benefits of government scheme for women in India itself is. So whoever is working in this area has to educate people that whatever is available for women, like Mahila Udyam, Nidhi scheme, Stree Shakti, or in Mahila Vikas or Dena Shakti, all this they have to get. All this they have to get informed. And another one is assertiveness training for girls. Educate your girls to say no when they are. I'm not telling them, make them to be aggressive, assertive. Assertiveness is we are expressing our need without harming the rights of others. So they can be passive sometimes. So when they are passive, they are not making eye contact, stumble shoulders, struggles to project voice, agrees often. This is passive. If they are passive, they will, they may have to undergo exploitations. They are aggressive, people may fight with them and argue with them and make them and physically sometimes harass them. They are becoming aggressive means. But being assertive, makes eye contact, use calm and confident voice tone, use active listening skills, verbalize need without feeling of guilt, listens to the need of others, stands or tall, shares thoughts and ideas in confident voice. If I am feeling sad about somebody's touch, I have to say, I'm not comfortable with your touch, I don't like this. This tone I can speak. If I'm passive, I may not listen. I may not mind. I may sit quietly and suffering what other person is doing. If I'm aggressive, I'll tell, hey, don't do that. This way shouting. This shouting and passive, aggressiveness and passiveness will not work properly. And assertiveness only will work. Assertiveness is not keeping quiet. It's expressing the right of us without harming the right of others. So what I feel all the women should have a job, whatever is the job. Even we are getting 10 rupees per day, it's enough. So try to get a job, whatever it is, have your own income. So you don't have to beg for others for buying your necessary things, your dress materials or your essentials. You should have your own income. I don't say that you should have a hi-fi job. Even you can have some type of work in agriculture field based on your education. You can get So be proud that you are a woman. Some people will talk, oh, I am a woman, what to do, and this, that. So don't have that feeling. What's your problem? You are more powerful and you know how to use your power. That's all. You should know what is your value. So be proud that you are a woman and communicate that your girl children also that, oh, I'm a woman. I'm proud of that. I'm doing my work. I am able to do whatever. Don't focus always what you can't do. You try to say that what you can do and encourage your children to grow with grow with courage and what they can do, that type of feelings. So train your male children to respect girls. Don't feel that, oh, I have only male children, so it's good. So educate them to respect women. I have seen my friend's kid. He was going and touching all girls. He was only 4 or 5 years, touching all kuti girls, small girls, in curiosity. So his mother was educating him. I overheard this. Don't touch girls unnecessarily. They will have a lot of pain. If you touch, they will start crying and other people come and beat you. Okay, so based on their level of age, you educate them. And when they're growing up, we can tell them the problems related to this type of battery or unaccepted touch, all this type of things. So then one more thing, if they are seeing violence from family, social learning theory says that it's a learned conduct. So they can do or repeat same. If they are seeing that their father is harassing their mother or their sister, it may be repeated to the family. That is social learning theory. So individuals pick up their behavior patterns of those they're taught to respect and learn. So if you are showing respect to your wife and your kids, same thing will be the same thing will be repeated by your son. One more thing is there, when the men are showing respect and to care to the women also should behave well. When they are respecting you, don't take an advantage that you can do anything. Not like that. When they are respecting, you have to respect them in return and maintain the balance of the family, and homeostasis have to be maintained. Don't take advantage over anybody. So be a role model to your daughter. Develop confidence, positive self-image, self-esteem has to be developed. Able to make your girl child able to face challenges. When they are facing challenges, failures in life, tell them, oh, it's okay for one time. Next time we will do. Okay. Don't sit with them and cry, oh, it's happened to you. Very sad. If you were a male, it would have been like this. No, not like that. So make them courageous enough and help them. So help to live in the midst of helplessness. Understand that world is not a bed of roses. We have to understand there are a lot of pains in the world, thorns around us. Struggles, stress. This is life. So stand out and say that it's okay. I'm able to adjust with them and I will move forward. So know your own value. So women have many strengths. Their major problems are not internal personal deficiencies. Instead, problems are primary societal ones, and such as sexism and racism. Some of them are facing racism in India. We know that we consider high caste, low caste, all this type of things. When we are considering it, it doesn't have any base. All human beings are same, right? How can we say that all of us have same blood, same, this only skin color may be different. That doesn't matter. So equality of gender has been prime concern across all ages movement pertaining justice for women, that are not commenting on the gender equality and all. I feel women are one step above all, because they have to carry a lot of pain, a lot of load on their shoulder. It's not that we are finding where men stand, where women stand, who is equal, who is high. Not that. We have to maintain balance. If we want to lead a fruitful life, we have to maintain balance. Each one should respect others in the family. Men should respect women, women should respect men, appreciate each other, maintain the balance. Don't think that one person is under your feet. In two ways. Women should not think that he is my security or this he has to be obedient. Men should not think that she should be obedient servant. All this, it doesn't matter. Respect each individual, give individual respect, and appreciate each one. Maintain balance, love each other. Then only we can maintain our family. So women empowerment needs multi-modal strategies. Protesting against exploitation is only one strategy. So social awareness and community participation, indoctrination of value system, all this has to be contributed. Then you know that social dimensions of mental health is capacity of the individual, group, and environment to interact with one another, promote subjective well-being and optimal development of use of abilities, cognitive, affective, and relational, to achievement of individual and collective goals consistent with the justice and attainment and preservation of conditions and fundamental equality. So how to all women learn to manage your stress. I don't say that only women, men also learn to manage your stress. And have me time. This is for both gender. I have, because this is my topic, I have just put a women's picture. You should have your own time to listen your music or read your book or think or call your relatives or whatever. You should have your own time. Otherwise, what will happen when we cross 50 or 60 years, when we turn back, we'll see, oh, I have spent whole life for my family, whole life for my work, institution, and now I am alone. This feeling should not have. You should have your own time. Here, one example I'll tell. I have to do all household work, and I'm going for work outside also. So what I will do is, I play music and wash my vessel. So I feel I'm listening music. So you have to have and do exercise 30 minutes. Whatever happens, I tell my family, I need 30 minutes for myself to do my exercise daily. So this is not somebody has to force on us. We have to find our own time. Family will not tell no. Okay, you do that. Family is the only thing we should be assertive and ask for our rights. Then only they will do. So have me time, seek assistance. Don't try to be a superwoman. You don't feel that if I only put my hands, then only things will work out. You delegate your work for somebody who can. If you tell your family members to help, surely they will do. Only thing you are not asking them. They will think you are able to do. That's all. And later you are telling, my husband is not helping, my son is not helping, my daughter is not helping. You are telling that without asking their help. You just ask them to help. They will surely do some or the other way. They will help you. Okay. And you are doing all the work without asking help. And at the end of the day, you are struggling, sad, and thinking that you are doing all the work for everybody and you are not living. So this is one of the examples for women's role. We can't say that women only for namesake, they can be in the business or something. They have to do a lot of role. So whenever you are working, a lot of role you have to do. You know that this was during last budget statement, our Mrs. Nirmala Sitaram, Minister, she has told Nari to Narayani. So it's that. See the hands, women has to do all the work. One is work, child, her own personal life, all this has to do this. So you understand, if you are feeling, if anybody hearing me, women, you are feeling that you are not supported by anybody, not motivated by anybody, or not encouraged by anybody, understand you are there for you, right? Behind every successful woman is herself. So decide you have to grow from this situation or make your life more beautiful than today's situation. Work hard and work, enjoy and work, and lead your life by yourself. Don't expect others to pat on your shoulder and say that it's very good. Okay, most of the time I do my work, and when I'm alone, I say, well, congratulations, you did it. Okay, you did it. So stay happy, do it. Don't wait others to appreciate you. If you're waiting others to appreciate you, you will never reach anywhere. Be your own motivated, and you play your role well. This is Indira Nuyi's word. Like at the end of the day, don't forget that you are a person. You are a person. First, you think that I am also an individual. There's a limit for me to be perfect. Don't seek perfectionism in anything, everything. So it's okay if some flaws are there. It's okay. Don't forget that you are a mother. Forget that you are a wife. Don't forget that you are a daughter. So all these roles you have to, and some of the times you be a trendsetter. Don't wait someone else to come and speak for you. It's you can change the world. This is Malala Yousafzai's words. So women like these came out of their society. So they are, what to say, they are leading their life. And take care of your health is another area. Most of the time, women are not taking proper food, and when they get retirement, they have calcium deficiency, iron deficiency, anemia, that is various illnesses. And one lady told me, my husband has all overnutrition disorders related to overnutrition, like cholesterol, diabetes, all this. I have all deficiencies, calcium, iron. I asked her why it happened. She told, when I'm working, I was not eating any food. I was feeding everybody, and this happened. So focus on fruits, vegetables, balanced diet. Balanced diet means all things should be equally placed. Like, don't eat a lot of rice and carbohydrate. Balance it. If you search in net, you will get balanced diet, how to eat, like vegetables, fruits, all curries, non-veg, whatever you eat, you balance it and eat. Don't increase any sort of any one type of food. If you are eating in a lot, it will affect your health. Sleep properly, take self-care, take water, exercise. You all have to do. At least you just walk around your balcony or home, 30 minutes, any exercise you can do. A lot of exercises are available in YouTube, like what I follow is Robert Tuss. I'm not promoting that. Okay, Robert Tuss exercise. Many type of exercise are available. You can do it for 30 minutes. You know, once we start that, you'll feel like you will have a feeling of accomplishment that I'm taking care of myself. So another issue is now to communicate with opposite sex. When we have to work with the men or women, you should know how to communicate with them. If you are able to read, you can read a book called, I forgot who is the author, John Step something. Men are from Mars and women are from Venus. It's one of the good books which I have read. How to communicate with opposite gender is written there. So, for example, if a woman is speaking, women will think that men should understand without my telling, and tell. They may tell, oh, today is a bad day. They might have got one bad experience. That's all. But whole day was good, only one bad experience. So men will think, oh, their life is in utter flop. It's not like that. You tell, today was a good day, but this thing went on well. This thing was painful. Okay, but men are speaking. They will give clear cut sentence only. Okay, we will think today this happened. So when we are communicating with male, give proper sentence. What we want to communicate, only you speak. Don't tell all these unnecessary things. So how to communicate with the men, you have to understand. So come back to your past hobbies is another thing. Most of the ladies after retirement coming back to their hobbies like music, dance, volunteering in cooking, camping, whatever you like, you do. You should have your own time. Come back here to your past hobbies. This is another way to tackle your stress. Then stop ruminating on the past. How much happy life you have now. Some women have a feeling, or some women have a character. They will go back to your past pain and ruminate it on. Okay, and make your life a mess. I tell my patients who are visiting, when you are dressed up for wedding and you are putting a towel which is very dirty on your shoulder, the same way, how dirty it will be looking. Don't do that. Remove the towel and stay happy. So it's the same way, the ruminating thoughts, painful thoughts of the past, we are putting like a dirty towel on a well-dressed woman. It's not good. So rumination, you have to stop. Live in the present. And if a girl alone in your territory, don't think that it's an opportunity. It's a responsibility to keep her safe. And women, most of the time, I have seen men are respecting women, or men are not harassing women, or men are not telling gossip about women, but women does this. So please don't degrade another woman. So whatever cases we take, if you read newspaper, sometimes behind all these cases, women also are involved to degrade another woman or harass another woman. So please don't do this. You respect your women. And respect the man who respects you. When your husband or spouse, your brother or your friend respects you, give it in return. Respect them. So understand, men of quality respects women's equality. And these are the content reference which I have taken. And you can do a lot of things. Stay happy, stay peaceful. And you should understand that you can't find solution for all the issues, but you can find happiness in the midst of issues. So I thank Dr. Ravindra for inviting me for the class. After a long time, I have involved in this talk. Like I have stopped talking for public from the last few months because of various reasons. And this is the one, this year, this is the second time I am talking to the public. Thanks a lot. Where are you, sir?
Yeah, thank you, ma'am. You spoke, I mean, very close to hearts. I mean, you touched upon every aspect of women. In fact, even both the genders also. Like they are not substitute. I mean, they are not an alternative to each other. So both of them has to go in hand, understanding each other, respecting each other. That is what required. But unfortunately, we all are in the rat race, and we are running, fighting each other. That we all are equal with each other, and we forgot ourselves in the very first place. That we are not able to recognize what we are and what we are aiming at. So in the race, we forgot ourselves, and we started comparing ourselves and abusing, and all sorts are coming as part of the race that is happening. So we need to appreciate ourselves as a very good human being. So that is the very first thing we need to do. I mean, recognize and appreciate ourselves, and then irrespective of gender, we need to appreciate. And definitely, women has a greater role, has been playing greater role initially and now also. You can see now with more responsibilities, that is managing the homes as well as the workplace. Now they have additional responsibilities. So there is a definitely, I mean, we need to be more considerate, in fact, because handling many things like we have seen, women are more efficient and handling much more tasks now. So we need to be more considerate in different aspects. And also at the same time, as you have rightly pointed out, women also should consider that the changes that are happening over the time, that are from a homemaker to transforming as a entrepreneur, a woman, or working woman. So there are a lot of challenges that is and changes that is taking place in the family also, because lack of having caretakers or a family member who used to be at home, and they are also missing that. In fact, we see most of the times it's not that women are not allowed to work, but because they are missing them actually. So when they are going out, they are missing them, and there is no one else to take care of them. That is what aggravating the issues. Because otherwise, say if you are at home, then you could have taken care of us. Because you are going outside, we are not being properly taken care. So these things are there, which you have rightly given solutions, like effectively managing them and being proactive and being assertive and being, I mean, addressing also all these issues at the same time, managing things. We can understand these are not simple things. Maybe we can say so much, but managing is very difficult. And like as you have rightly said, many challenging situations. In spite of that, we have seen women has done a wonderful job in managing these things. So hats off to all the women, and especially who managed very well and have been very successful. The one such example is role model is you yourself. We can see as a role model how you have been able to manage a family at the same time, work and also your passions also. You are very good at pursuing your hobbies also at the same time, being close to nature. That itself says, in spite of so many challenges we face, still we can pursue our hobbies and also take up our tasks in a very efficient way. That family support or the social support or the friend support is very much necessary. Only when we understand these and concepts in a holistic manner, then we will be able to rightly manage things. Very well presented, ma'am. Thank you. Covering each and every aspect of it. No, you are the right person to do justice that comes to women topic. I know that very well. So thank you once again for accepting our invitation and joining us, ma'am. Participants, if you have any queries, you can unmute yourselves or put in chat box or raise your hand so that we can quickly take a few queries. You can raise your hand. Okay, Geetanjali. Yeah, Geetanjali, ma'am.
Yes, sir. Good afternoon, sir. Good afternoon, ma'am. My question is that I am PhD scholar. Just I am not decided my PhD topic very clearly, but my interest is over the gender issue and women issue. So I am just sort down in some point like violence against women and reproductive health. So I asked to ask a question to ma'am that what are the area where I can do research as a PhD scholar on the violence against women.
From your question, I understand that you have asked for social issues faced by women or violence against women.
Means any issue related with women generally where PhD scholar can do research in India.
Actually, when we are thinking vast topic, it's better to narrow down to one topic. Like if we are thinking about violence against women or psychosocial issues, I have pointed many issues, right? Related
Yes,
to social. So when we are doing research, we should be focused in one area. That is better. If reproductive health, you can focus on perinatal, like if women during pregnancy, their experiences during pregnancy or lactation, that issues experienced during that time. Anyone, when we are doing research, we should have some data to show, and we should do statistical analysis if study is quantitative. Okay, so it is better to narrow down to one topic, not all topic.
So what are the area left where the research is most demanding?
See, you can search in many areas, like if you give common psychosocial issues faced by women, you give in the net, many topics will come, many points will come. Or World Health Organization site, if you search, many points will come. You select one for which you will get patients, sorry, or you will get sample, and you can do in time. You will get tool, all things you have to see, whether it is feasible, then only you select a topic. You should search for tool, whether you can collect data using particular standardized tool. All this you have to see first, then come to the topic. That is best. So if you have taken a topic may be very attractive, but you may not get a tool for that, data collection instrument, I mean, and if you are not getting sample adequately for that, you can't complete, right? So better to see whatever is available, current situation, how from your experience, you ask which sample you can take easily. Like a women experiencing, like women in menopause or pregnant women, or women experience a dowry deaths, families experience a dowry death, all this type of, you say, search, and which sample is okay for you, then you take. That is best, I think. At the end, we should be, after 5 years, we should be able to complete the study, right? Studies will appear very attractive, but think that what I can complete in time. If 5 years are given, within that you have to collect data. You should have data collection instruments, all things you have to focus. Feasible the study should be. So focus on any one topic which I have mentioned, all issues I have mentioned, focus on one topic and see that whether tools are available.
Analyzing tool, skills are available or not?
Yes, Data collection instrument should be available, right? Otherwise, you have to make it. Making itself is another study. Or you can make a tool for analyzing any of these issues. That also is study. Data collection instrument you can develop. That itself is another study.
Okay. Thank you, ma'am.
Contact Dr. Ravindra. He's expert in all research, right? You
Okay,
are near him. Where are you staying? Near him?
I'm in Bihar, from Bihar.
Far, I think.
Okay, ma'am.
Yeah, maybe we can guide through, we have pan-India professors across. So maybe we can, if you can just contact me on WhatsApp, or we can guide you to the nearest professor, because accessibility is also important, because research is not one thing that you take up today and complete today or tomorrow. You need to be in contact, take supervision, guidance. We can always help you. Ma'am is there to help you in case if you need any suggestion or thing. We are there, but you have to be constantly under supervision. You have to select a proper guide who can work, who has experience in relevant concept, or who have proper understanding, so they can help you with better tools. As ma'am said, topics, maybe we can find many topics, but completing them in time and finding a right tool or questionnaire or interview schedule, that is very important, so that you can conduct your study, and getting the right sample or population is very important. So all these are aspects which ma'am has rightly pointed out. So maybe if you can contact us later on, we will definitely guide you to the concerned professor at your locality or in your university or somewhere, so that you can select them as a guide and go ahead. Otherwise, also we are always happy. Even after session, you can contact us. We will be happy to help you. Any other query? If other participants have any query, then you can unmute yourself, or you can put in chat box. Okay, I think there are no other queries. Appreciation from everyone, ma'am. It was a wonderful session. Thank you.
Thanks a lot, sir, for inviting. If no other queries or clarifications, shall I leave? Thanks a lot once again for Dr. Ravindra, such a wonderful man whom I have had interactions when he came for workshop. The person who respects women and animals, environment, everything. Frankly speaking, when first time I met you, seeing your dress, way of dressing, I had different idea. But when we had a close talk or interaction, I understood you are a wonderful person. I thought you are a Swami when interacting with you, and I was afraid to come to you for talk. But later I got knowledge, what to say, epitome of knowledge, experience, and love towards environment, animals, all this. I adore you. Thanks a lot for inviting. Continue in the same vibrance.
Thank you, ma'am. It's your greatness that you are able to appreciate. In fact, our knowledge, wisdom lies in our simplicity. So down to earth, like sir and you, we all are like when we appreciate the humanity and towards our nature, that itself shows how grateful or how indebted we are towards the nature and universe. So that itself keeps us very humble towards our nature, our planet. So thank you very much for your kind words, ma'am. And a special thanks to you both because you have given your valuable time to us and contributing a lot of insights to all of us, and look forward for your future sessions also on various aspects because you are so experienced, we can have so many sessions if time permits. Thank you, ma'am, once again for joining us on behalf of Sri Holistic Health Foundation India, Sri Research Institute and Center for Arts, Sciences and Wellbeing, and also on behalf of all the participants. We once again express our gratitude and sincere thanks to you, ma'am. Thank you, ma'am, for joining us. So friends, after listening to these two wonderful sessions from eminent speakers, so let's move on to our next speaker. So we have with us for the next session, Mr. Matt Perleston. He is CEO for EQ for Peace Worldwide Inc. USA. He has been teaching emotional intelligence and social emotional learning for over 35 years in USA and across the world. The organization goal is to have 1 billion people actively practicing emotional intelligence by 2039 and sustainable global peace by 2050. And Mr. Matt has been a very good researcher and a very good proponent for emotional intelligence on various topics. So recently also he delivered wonderful sessions on emotional intelligence, and today also he agreed our for the session and accepted our invitation. So I invite you, Mr. Matt, for session on emotional intelligence for health and life support systems, professionals and careers. Over to you, Matt.
Thank you. Thank you.
Thank
Yes,
you.
am I audible now? Can you hear me?
Yes. Sorry to disturb you
All right.
in the middle of the night.
Yeah, that's okay. That's okay. It's important. It's a very, very important subject, and I love talking about it. And I'm trying to educate the world on how this works, how emotional intelligence works, and how important it is to bring us peace. To bring us peace. That's the goal. Inside, with between us and among us, and we need it so badly now, so badly. So, thank you for having me, and thank you for listening to me. The really important subject. Okay. All right. Well, let's go. I don't have anything brilliant to say. To start with, we're going to, I have way too many slides as usual. EQ is emotional intelligence is not very complicated, but there's a lot to it. And sometimes it's not easy. It's difficult. Our emotions are difficult to deal with, but we need to. It's super, super important. So I'm going to be going quickly. Feel free to put questions in the chat or comments in the chat, or raise your hand and interrupt or whatever, or we can take questions at the end. But I'm going to be going quickly. So hang on. Here we go. You guys are helping professionals. Thank you for everything that you do. Thank you for caring. Thank you for helping the world. It really does matter. It's hard sometimes. Again, simple. Well, just be nice and help people. Well, that's not so easy sometimes, is it? It's not so easy sometimes. So, and it can be quite painful. So thank you for doing that. And I'm hoping this will help you some to continue doing what you're doing, do it more, do it better, do it in ways that work for you. So you'll keep doing it, because burnout and overwhelm and people just losing it is going up, skyrocketing right now, especially in healthcare professions. And so so it's very important that we learn how to take care of ourselves as well as our patients. Very important. And in my opinion, emotional intelligence is one of the keys to doing all of that. So that's why we're here, and thank you. My goals for the session are to introduce you to emotional intelligence, which we call EQ, even though it should be EI, and I'll explain why that in a minute. I want to explain how important it is and how it works inside of all of us, and that the goal of it is peace. Our goal is to get peace inside and among us. So I'll talk about that. I'm going to do a little assessment later on how well you process your emotions. Okay, it's educational and quantitative at the same time. It's very fun, and we're going to do it as a poll this time, I believe, Dr. Ravindra. So this is the first time we've done that. I'm looking forward to that. I'm hoping to inspire you to place more importance and focus on your emotions and your emotions of your clients, because they matter, and because we don't in our culture and your culture, emotions are kind of pushed away, and we don't really talk about them much, and we don't deal with them too much, and that's a bad thing. That's a bad thing. We need to put some importance on them because they are critical to us and to others. So I'm hoping I can inspire you to do that. And I am hoping to encourage you to share this information, because we did not learn it in schools much. I didn't learn it in school growing up. I was very disappointed with my education. I went all the way through school, all the way through college, and then like, that's it. That's it. How could that be? I knew a lot of good stuff to get a job, but I didn't know me. I didn't know me very well at all. And because that was not part of our education, it's starting to be, which I'm very happy about. And we have a nonprofit, an NGO, international NGO. We're trying to get emotional intelligence and social emotional learning into schools everywhere. Kids need to know, teens need to know, adults need to know how to deal with their emotions. We don't know. And that's causing some very serious problems in our world today. That's why I'm here at 2 o'clock in the morning, jumping up and down about emotional intelligence, because it is critical. It used to be a nice to have skills set and language and competencies. It used to be good to have emotional intelligence. Now it's not funny anymore. We've got to have it. We've got to be able to understand ourselves and deal with our inner world, because violence is going up, child abuse is going up, divorce is going up, suicide is skyrocketing in India, in Bangladesh, in Asia, in Europe, in Africa, in the United States, shooting up. And that's because that's the ultimate, to me, of not being able to deal with what's going on inside of us. We go, I can't do it. And we tell ourselves, I can't. And we think it's going to go on forever. And so we go, that's it, I'm out of here. And that's not okay. That's not okay. And it's an education problem. It's not nothing else. It's an education problem. And we can change that. We can educate people. That's what I'm here doing right this minute. So hopefully, you tell me. So emotional intelligence, what is it? What the heck is it? So I hope you've heard of it. I ask people all the time, you ever heard of emotional intelligence? I met some people tonight at dinner. They were sitting at the next table. I ask people all the time, have you ever heard of it? And these are very sharp, very successful people. A couple, neither of them had ever heard of it. And she was a teacher. I'm like, come on, how could that be? How could that be? But it's true. Most people don't know what emotional intelligence is. The whole concept of being smart with our heart, it's smart with our inside world, is just foreign to people. And so we got to talk about it. I think it's the most practical subject there is, being that we think, we can't not think, and we can't not feel. I'm pointing to my head because it's both sides of our brain. I'll show you in a minute, but we can't not do it. So we better be good at it. So it's the most practical subject there is to me. We need to know ourselves, and it makes, the better we know ourselves, the better we can deal with ourselves, the better we can deal with other people, in that order. Okay. Why do we call it EQ? People know what IQ is. You guys know what IQ is, right? So they get that EQ is something different yet complementary. So IQ is our cognitive intelligence. Here's a cool picture of it. We have two sides of the brain, right? That's split. You guys know about that, obviously. That's split on the sides. And our left brain, mostly, this is to scale, it's not exactly true, but mostly our left brain is our cognitive intelligence, our knowledge, our information, our sequential processing, our logic. That's what we learn about in school. That's what we talk about at home. That's where our society's focus is, on our left brain. However, we have a whole nother part of us, our right brain, which is our creativity and our passion and our feelings and our senses and all the stuff, all the rest of life, the color, the joy, the love, all that stuff is on our right brain. And we don't focus much on that, but it's very, very relevant, very relevant. So the key is to balance the two. We need to deal with our thoughts, which is cool, and our feelings, both. So we're pretty good over here and we're not so good over here. So we're increasing this side so we can balance, Okay. So IQ is cognitive intelligence, our knowledge. EQ is our emotional intelligence, which is our wisdom. And it's about psychology. It's our personal, very personal. It's positive if we want it to be. That's the cool part. We're at choice. So we can choose to think and feel positively, or we can choose to think and feel negatively. It's up to us. 24/7, 365, it's up to us. And so that's a wonderful thing. And I'm going to talk about that a lot because it's very, very, very good news. Emotional intelligence is very good news, in my opinion. We have tons of bad news in the world today. This is the best news that's come out in a long time. We're going for peace. We're going for peace. And how do we get to peace? It begins the moment you choose not to allow another person or event to control your emotions. In other words, we are in charge of ourselves. We get to think and feel what we want to think and feel. Nobody can make us think anything without our permission. They can try. You can make somebody feel something physically without their permission, but you can't make somebody feel anything emotionally without their permission. So it's up to us. And that is what I'm talking about, is very, very, very good news. Our emotions matter way more than we thought they did, more than I thought they did. Most people are very surprised that critical sometimes about emotions, they don't matter. I was told my whole life they don't matter. They're just a fleeting thing, and you don't pay any attention to them. What matters is our logic. Well, yeah, they do matter. They do matter. Also, they matter very much. They matter very much to you, and they matter to your patients a lot. And so they're called soft skills, or bedside manner, or connecting with your patients, etc. But they do matter, and I'll explain more in a minute. There's 4 basic parts of emotional intelligence. 4 very, very simple. Again, very simple, but not so easy. There's our thoughts. There's our feelings. We then take into account our thoughts and our feelings. We then get to make decisions based on what we think and feel. And then we take actions based on our decisions, which are based on our thoughts and feelings, right? It's very simple. But not so easy sometimes, especially if we don't know what we're feeling, because we do take into account our decision making. Our feelings matter, and we've got to know what's going on there to make good decisions, take better actions, and make our lives look like we want them to. Emotional intelligence is about what we do, how we do it, and why we do it. Those are all very important. Oh, I'm going to go back to this one. See down the bottom, there's 6seconds.org. If you want to learn a bunch about your emotions and about how all this works, they have 6 Seconds has assessments, they have information, they've got classes, they've got YouTube, tons and tons of videos. I watched one yesterday. There's an amazing amount of information. Try 6seconds.org to get started in your growth on emotional intelligence. I hope you want to learn more about that. So this is one of theirs. The thought, think, feel, act symbol is from theirs. The decision part I put in there because that's critical to the whole thing. That's where we get to choose. This is also one of 6 Seconds symbols. What we do, how we do it, and why we do it. And those all matter for you. They matter for your career, and they matter for your patients. Here's when we're dealing with problems and stuff inside and dealing with life, there's a big difference. There's a big difference between what are we going to do about something, right? Here's a problem. What are you going to do about it? Well, about something is an action. What are you going to do about it? Do, right? About it as an action versus what are you going to do with it, right? For example, the war. There's a terrible example. I mean, it's a good example. What am I going to do about the war in Russia and Ukraine? What am I going to do about it? Well, there isn't that much I can do about it, I don't think. Well, actually, I am doing something about it. I'm teaching the world, I'm teaching people about emotional intelligence so that hopefully this can happen less, maybe someday not at all, and we can get from inner peace to world peace. So I am kind of doing something about it, but that's an action. That's what I'm going to do about it versus what do I do with it? Wow. What you guys have probably, I'm sure you've had this struggle is just, what do you do with it, with the feelings, the thoughts, and the pictures in our mind of what's happening, how horrible it is to go in and just blow somebody up? And I heard yesterday a 15-year-old got killed, and they're bombing from, they're bombing from far away, and they don't know who they're hitting. And how could you do that? How can you do that? What do you do with that? Those are feelings and emotions, and that we gotta, they're relevant. They're relevant. They matter. And sometimes we're not sure what to do with them, but I want you to know the difference between action and a feeling. I don't think I have a slide on this, but one of the biggest skills on emotional intelligence, one of the biggest freedoms is to think and feel intensely and not do anything about it, or to adjust our actions wisely, to consciously and wisely use our actions based on our thoughts and feelings, but we don't have to do something. A lot of times we are trained, or we end up, somebody hit me, well, I got to hit them back. Well, no, you don't. You don't. Or I'm angry, so I have to express it, or I got to tell somebody, or I got to do something with this. Well, you don't have to do anything with it. You can decide. And that's a wonderful thing. That puts you in control of your life. That's a very big deal, in my opinion. Success is about knowing yourself and knowing what's going on around you. The emotional intelligence, a lot of times what people see is the actions and the results, right? You get your results based on your action. That's what the world sees. But what's going on all behind the scenes in your heart and inside your body is a whole bunch of other things that we have to deal with. And that's what the emotional intelligence is about, is all those things underneath the surface that we need to deal with in addition, or in order to act in good ways that work for us, right? So you get the idea. It's what's going on underneath the surface. There's an iceberg picture, which is a good way to do it. Iceberg, right? You see a little bit of it above the water, but there's a whole bunch happening underneath the water that matters. And that's where we're going with this. With emotional intelligence, we can think better thoughts. We can believe better beliefs about ourselves and about the world. We can feel better feelings. We can make better decisions. We can take better actions. We can get better results, and we can live better life, all based on our thoughts and our feelings, based on knowing what's going on inside of us and being able to consciously decide what we're going to do based on our thoughts and feelings. Again, most practical subject there is, in my opinion. Like, I'm shaking my head like, well, how you got to know this stuff. Well, you got to know this stuff, and it's all around us. It's not just sometimes, and it's not just at work or just at home or just at school. It's everywhere, all day, every day. This, our thoughts and feelings affect us. And there's a science to it, right? The way our brain works, the way our synapses work, the way our amygdala and our prefrontal cortex and all that, and how emotions happen. The name 6 seconds, they're called 6 seconds because they have found that if you have a strong emotion, it takes about 6 seconds for it to settle back down. If you just wait 6 seconds, like counting to 10, you probably heard that before. Just count to 10 before you say anything. That's a real thing, and it's a very important skill, and it's free. So just give it a couple seconds for your feelings to calm down. And because what happens is our feelings go up and our logic goes down. So we do stuff out of reaction rather than responding. We react, and that sometimes doesn't go well. It doesn't lead to good results. So if we let it settle a little bit, we can balance a little bit and use some thinking, because if our emotions get really high, then sometimes our logic goes down, and that's not a good thing. So there's a science to it, the way our body works, like the 6 seconds thing. It's real inside of our body. The art to it is to wait the 6 seconds, right? It's going to happen. So just wait, give yourself a sec before you react, if you can. And so there's a science to it, and there's an art to it, right? This is how it works, but how we work it is the art to it. And if we combine those two, it's kind of magic. It's kind of magic. So, I crack myself up. It's kind of magical. It's so cool how emotional intelligence works, that and so profound and effective that that it kind of is magical. Emotions are teachable skills. These are teachable skills, including empathy and compassion and understanding and listening. Shut up and listen to people. And some of these skills that we have for emotional intelligence are all teachable. Even love, proper love, or healthy love is a teachable skill, right? We can learn how to do that and learn how to do it better. So this is really cool. And by the way, emotional intelligence is completely, totally free inside of all of us. I don't think I have a slide on this, but the nature versus nurture thing, what are we born with? Well, we're born with, you watch little babies, they're pretty, most of the time, most babies are pretty happy. They're pretty calm. They're pretty peaceful. They're pretty loving. They look at you, you go, gada, gada, gada. I have a 9-month-old granddaughter and a 3-year-old granddaughter. And if the 9-month-old, I've been watching her, well, both of them their whole lives. And I think this is so fascinating to watch them. They are pretty darn happy. When they came out, they were happy, and they're still happy unless there's something not going well. And they express that, right? The baby is hungry or tired or hurt or needs a diaper change or something like that. They express that. And then once they get their needs met, they go back to being happy and loving and calm again and peaceful. And so we are naturally peaceful. We are naturally pretty happy coming out. And we stay that way if we can. What happens is the negative emotions get put on top of the positives and cover them and cloud them, and we don't know how to deal with them, and we don't talk about them, so we have to make it up on our own and that doesn't usually go very well. So what we need to do is to remove the negatives, and then we get back to positive naturally. It's really cool how that works. It's very, very simple again, and not so easy again. So simple, not easy. We get hired a lot of times for our IQ. That's kind of, but we keep our jobs and get promoted for our EQ, being able to manage ourselves, being able to communicate with others properly, being able to deal with patients and their emotions, because a lot of times your patients are probably in pain. They're probably scared. They're probably confused or have questions, and they don't know what's happening inside of them. All kinds of emotional turmoil and happening there. If you can deal with your emotions and you can deal with their emotions, you could do amazing things with them, even regardless of the physical ailments. The dealing with their emotions and their thoughts and such is a huge part of it. And working with teams and being able to lead, being able to direct people, being able to explain things, being able to stay calm when other people are upset. All those kind of things are stuff that you get to keep your job, and you get promoted based on EQ, regardless of your IQ. One of the biggest emotional intelligence skills is opening your heart or not. We get to decide. We get to decide how much we open our heart and how much we don't. When things are going well and it's safe and it's okay, we can open up and we can be very loving. We can be intimate. We can be close to people. We can care about people. Probably if you're in the helping profession, you care about people, right? You care about people, and teachers, they care about their students. But there are problems. What do we do with our emotions? What do you guys do with overwhelm? What do you do with burnout? What do you do with when you're working these incredible hours? What do you do when you watch somebody you really care about going downhill physically and maybe even pass away? What do you do with that? If you can manage your emotions, then you can keep doing what you're doing and do it effectively and do it well, and continue your own self-care at the same time that you're caring for them. Really, really important. As I said, most practical subject there is, in my opinion. Dr. Ravinder was interested. There's a thing happening in the United States where there's what's called the Great Resignation. And this is something like 4.5 million people left their jobs in the USA in 1 month last year. I just found a chart on it, but I didn't have time to put it into this PowerPoint. But it goes wham, and it's shooting up like that. And one of the most affected industries is healthcare. And they're thinking it's because of burnout and overwhelm. And there's no balance. They're working, and you're not getting enough for it. A paycheck is not enough to continue it. And so people are leaving. They feel unfulfilled and they don't have a balance. So they're leaving. They're saying, I'm not going to do this anymore. I can't do this anymore. I'm out of here. Most people who lose their jobs can do their job, but they lose it because of not being able to deal with their emotions. So 3 very simple steps to EQ. Awareness first. Always, we can't do anything unless we're aware. So be aware of your feelings, your thoughts, and your feelings. I'll mention again, and your feelings. It's not just our thoughts. We have to be aware of our thoughts and our feelings. Both. They're happening. They are happening all the time. We got to be aware of both of them. All right. Second, acceptance. All right. You can be aware of it and then fight it. Oh, no, I didn't. No. I'm not feeling that. And we lie to ourselves and we deny it. And we end up, poo-poo. Oh, no. Yeah, that doesn't matter. And we push it off to the side. It's okay. We just accept. I am feeling scared right now. I am feeling angry right now. I'm sad right now. And it's okay. It's just, we can accept it. or not, or not. So I highly recommend that we accept what's going on. Just then you can do something with it, right? It's number 3. I can take some action. Once I am aware and I accept it, then I can take some action or not take some action, but it's up to me. It's up to me. And that puts me in charge of, in control of my life. And I like that. I like that very much. You call me a control freak if you want to. It's true. But in this area, I want to be in charge. I want to control myself. So this is how you do it. This is how you do it. Awareness, acceptance, take some action or don't take action. With strong emotions, sometimes, a lot of times, no action is a good action. No action. Keep your mouth shut sometimes, right? If your boss or your patient's being stupid or your kids or something like that, don't say anything. Don't do anything. It's a good, no action is a good action a lot of time with strong emotions. The good news is that you decide not to take the action or to take the action, but you get to decide. You decide, which put you in charge of you, puts you in charge of your life. That is huge, I think. So we identify down at the bottom, identify your feelings as specifically as you can. And I'll show you a chart on that in just a second. Accept what you find and then consciously decide what, if anything, you are going to do about and with your thoughts and feelings. That puts you in charge of your life. We have lots of feelings. We have lots of feelings. This is one of the many, many charts there are about how many feelings there are. This is called Bletchnik's Wheel of Emotions, also on 6 Seconds and elsewhere. But it's pretty cool to be able to identify what you're feeling. Maybe check in with yourself right now. If you want to, put it in the chat. And what are you feeling? What are you feeling right now? Or what are you generally feeling? Or what specifically are you feeling right now? Be able to be aware of it and accept it. You don't have to take any action, but at least know, at least for yourself, tell yourself what's up. And this kind of wheel help with all these specifics helps to be able to identify what it is you're feeling, at least to yourself. At least to yourself. You don't have to tell anybody, but at least be able to tell yourself. This link right here has over 4,000 words in English language on feelings. They're feeling related words. It's really helpful to be able to describe, at least to yourself, what the heck you're feeling. It really matters. And at the same time, it also is helpful. We've been finding over many years that to kind of sum it up, all right, this is a whole bunch of feelings. That's too much going on, right? That's too much going on for me. I'm not that smart IQ wise. I'm just not. And so it helps me to just sum things up. The big 3 negatives are fear, anger, and sadness. That's it. So all of this big wheel can be broken down, in my opinion, to fear, anger, and sadness, mostly. And the reality is, here's the coolest part of this. You ready? If I can deal with my fear as much as my body is afraid, and I'm afraid a lot. I've had fear issues my whole life. I've been afraid of a lot of things my whole life. My dad was in the Air Force, in the United States Air Force, and we moved all the time. And it was very difficult for me as a kid because I felt like I had no control over my life. That's one of the things I'm jumping up and down about, is that now I do feel like I have some control because I have emotional intelligence. But I was afraid. I still am. I'm afraid a lot and of a lot of things. And I felt very powerless, which adds to fear, is feeling like you can't do anything about it. So, now I found that if I can deal with my fear, my big fears, if I could deal with the stuff that I'm really angry about, and I can deal with my sadness. We just had, I mentioned that suicide is skyrocketing. Day before yesterday, we lost another kid around here. They're not talking about it very much, but a kid that I've known since he was, I don't know, 7, 8, something like that. And I've known him his whole life. gone. He's gone. He committed suicide just day before yesterday. And I was so sad about that. I still am. I'm going to be sad about it for a long time. I think whenever I think of him, it feels like it's avoidable. It feels like it's avoidable, and it's avoidable through education. And that's what I'm sitting here doing right now is one of the reasons we can is to help people not have to deal with their fear and anger and sadness by themselves, and then not dealing with it, and then they're out of here. It's the ultimate decision of whether you want to be here or not. And so I understand that and I accept that, but still, I want people to be able to deal with their emotions so they don't have to do that. So if we could deal, what I'm getting to is if I could deal with my fear, my big fears, my many fears, if I could deal with my anger, the stuff that really upsets me, and I can deal with my sadness, my big sadness, and as much as my body feels them, then they're just those three, then there just isn't that much that life can throw at me that I can't handle. Think about that. It's pretty cool. I used to be very shut down. I used to be very quiet. I would never stand in front of a group like this and make a fool of myself. No way I would do that. But now I can, because if it doesn't go well, I'll deal with it. I can deal with it because I can deal with my negative emotions. So it allows me to go from this, oh my gosh, I need to keep quiet. I need to stay contained. I need to stay in my little box kind of thing. That's all fear-based. It's all fear-based. I don't have to do that. I don't have to do that. I can be out here. I can open up. I can be bigger and louder and more stupid because if it doesn't go well, I will deal with it. I didn't used to be able to deal with it. Now I can. And so I can allow myself to a much more bigger life. And I'm pretty happy about that, as you can see. So those are the big three negative emotions. If you get good at those three, you can do incredible things, right? If not, then they're bigger than you. That means you're afraid of your own self, and that's a horrible thing, like I used to be. The big three positives are joy, peace, and love, right? The big three positives. That's where we're going. That's the point. So if we can deal with the negatives, we can get to the positives pretty naturally, which is a really wonderful, beautiful, fantastic thing. And the same cost, nada, zero. It doesn't cost anything to go from fear to joy and from anger to love. It doesn't cost anything, but it's harder than it sounds. It's simple, not easy. Right? Okay, so there are 5 basic components to emotional intelligence. So this is called social emotional learning. You may have heard it called that. It is in the schools, in academic world, it's called social emotional learning. And emotional intelligence, same thing. It's basically the same thing, but it's also called social emotional learning. It's also called mindfulness, also called consciousness. It's EI, EQ, whatever you want. It's all the same stuff, basically. So here's the steps to it. These are from, I should have on here, Daniel Goleman. You may have heard of him, Goleman. He wrote the book called Emotional Intelligence, why it can matter more than IQ. He wrote the book in 1995, and it was wildly successful book, and it kind of opened the world's eyes to emotional intelligence. I was teaching it way before that. We didn't have a word for it. I remember when that first came out, and I was like, yo, that's what that's called. Yay, that's what that's called. That's what we're talking about, emotional intelligence. So it's a beautiful thing. So 5 basic steps to it. 1, self-awareness. First, always, we got to start with ourselves. We got to start with awareness. Obviously, until we're aware, we can't do anything with it, right? We can't do anything. So first is open our eyes and become aware of what's going on, and that we have thoughts and feelings, and we can become aware of what they are. Okay. So self-awareness first. Next is, once you're aware and accept, then you can manage yourself. Self-management is next, right? So you can react or you can respond. I choose to respond, which means reaction is right, habitual, fast, emotion-based, and all that kind of stuff. Reactive, and not necessarily very good way to handle things. Respond, however, means, okay, let's see, here's what's happening. How am I going to handle this? So I'm now taking it and becoming intelligent about it, making smart decisions and taking smart actions. We're taking both sides into account. So self-awareness, then self-management, right? Next is social awareness. And that's about that we have thoughts and feelings, and they matter to me. My thoughts and my feelings matter a lot to me. Well, guess what? They matter to other people too. And other people have thoughts and feelings, and they matter. And if you care about what other people think and feel, and you listen to what other people think and feel, and you accept what other people think and feel, guess what? They like that. They like that very much. And you become very important to them. You become safe to them. And that will take you to the next level, which is relationship skills. You will have much better relationships if you care and show that you care about other people's thoughts and feelings, what's going on with them, just like it matters what's going on with you. So next step is relationship skills. And, the longest study I've ever heard of, they did at Harvard, are still doing at Harvard Medical School. I think they've been doing it 85 years now. And it's a longitudinal study, long time, and they're following these people, and now them and their kids, and now their grandkids. It's been going on for so long, and they're finding out what works for you to be the most successful. What is the most important thing in your life? And they come up with one thing, most important thing for longevity and happiness and success in life. One thing. Any guesses what that is? Relationships. Having good, strong, solid relationships, people that you care about and people who care about you. And you have relationships in your life. That's the number one thing they're finding for happiness. Pretty cool, huh? So we have to create those relationships, and we have to nurture those relationships, and we have to stay in touch with people. And it's up to us, not them, us, to make sure that we have cool relationships in our lives, in our family, at work, at home, everywhere, at school. We have to nurture those relationships. It's up to us. So I'm aware of myself. I can manage myself. I'm aware of you. I can manage my relationships, and I can make responsible decisions. Responsible meaning we're taking into account both our left brain and our right brain, our thoughts and our feelings, not just one, but our thoughts and our feelings. And the way that looks is we go, the logical side, does this, when I'm making a decision, does this make sense? Does it make sense for me to decide this? And does it feel good or feel right? Our intuition, our gut feeling, that kind of thing, does it feel right? So our best decisions make sense and they feel good, right? Sometimes they get out of whack both ways. You can have things that make a lot of sense, but they feel awful. Or you can have things that feel really good, but they don't make any sense, like addictions. Many of our addictions, they feel really good. They feel really good. They don't make any sense at all. Some of them don't make any sense at all. Why would I possibly drink that much? Why would I possibly eat that much? Why? That doesn't make any sense. Guess what? It's because our emotions are really high, and that's what we're going with, but they don't make any sense. So our better decisions they make sense and they feel good or feel right. So So that's kind of the basis of the whole thing. And this is Daniel Goleman stuff. So we're trying to educate our mind and our heart, or left brain or our right brain, however you want to call it. It's actually the thoughts, feeling, actions. Another way to put it is head, heart, hand, right? So we're trying to get our brain and our heart, or our left brain and our right brain, to get along and to balance them out. Aristotle said, we think, educating the mind without educating the heart is no education at all. Well, that's a little bit severe, but you get the idea that we need to do both sides, right? We need to do both sides, and it is an education thing. We're born with all the stuff we need. We just don't know how to use it. So that's why we're doing this. I like to do hashtags. They're fun for me, and it kind of sums things up. So check these out. These are some of my favorites. I have lots of them, but these are some of my favorites about thoughts and feelings. First, name it to tame it. Okay, what awareness? Remember, awareness first. What are you thinking? What are you feeling? What is it? With the feelings, identify your thoughts behind your feelings. Okay, identifying the thoughts behind your feelings, and I'll talk more about that in a minute. But if you can identify what it is and become aware of what it is that you're thinking and feeling, you make sense to you. You make sense to you, and sometimes that's all you need. You're like, oh, that's fear. Okay, all right. Or, oh, I fear because I don't believe this is going to happen, so I am now afraid. Well, I can adjust that. But first, we got to identify and name it to tame it, I call it. All right. Second, spin it to win it, which means once we realize what it is we're thinking, we can spin it. We can adjust our thinking to go from negative to positive. Example, I have cancer. And when I get to thinking that it's really bad and that it's not going to go well and that I'm falling apart, and I look at my symptoms and my numbers and that kind of thing, and I start thinking that that this is not going to go well, guess what? I have negative feelings. I get very scared and I get sad. And so that's where it goes. My thoughts, my negative thoughts create my negative feelings. But if I can spin it to win it, if I can adjust it a little bit and go, well, it's going okay. Right now, it's okay. Right now, it's okay. Settle down, dude. Right now, it's okay. If I can adjust them, then obviously, if I can adjust my thoughts, then I will feel better, right? Another way to put it is, no one ever made you angry. No one has ever made you angry. No one has ever hurt your feelings. You did that. You did that because with your thoughts, your angry thoughts make you feel angry. If you think that's not fair, or you can't do that, or that's not right, right? If I start thinking that stuff, then I'm going to feel all kinds of stuff, right? Negatives. If I think negative thoughts, or angry thoughts, I'm going to have angry feelings, right? Well, I can adjust those. I can spin my thoughts a little bit, calm them down a little bit, make them not so personalized, maybe not so generalized, maybe, and then have better feelings based on that. So spin it to win it. And that's a great, more good news because we are in charge of us. We get to adjust that inside of us. People can't make us think or feel anything. I get to do that. And I like that. And the last one is feel it to heal it. Now, some people have trouble with this or with the whole concept of it, but basically what I'm saying is, if you have a feeling, let yourself feel it. It's not, again, not rocket science, and you will feel better. My mentor was PhD Doc Downing, and he said, negative emotions felt as strongly as they are felt in my body will reduce in intensity and are free to change, which means feel it to heal it. It means if I let myself feel something as strongly as my body wants to feel it, even just for a minute, even just for a couple seconds, my body goes, oh gosh, thank you. Thank you. I needed to express that. I want to get that out of my body. I don't need to hang on to that. We don't have to carry around our fear, our anger, and our sadness. We think we do. We think we're right about it. We have the same thoughts over and over and over again, which create the same feelings over and over and over again. And we carry this garbage in our body, and our body doesn't like it. Our body does not like it. There are lots of studies now showing the direct connection between unresolved negative emotions in our body over time. Our body starts crashing, right? Stress and high blood pressure, and our veins and constrict, and we're not breathing correctly, and we don't exercise, and all that good stuff, or all that bad stuff, because we have negative emotions in our body that we never dealt with. And they're showing the direct connection between not dealing with your emotions and severe medical problems as an adult. It's very very enlightening, but also scary to think of how much that our emotions can affect us physically, and it's a very real thing. So the alternative is to feel it. Let your body feel it, let your body release it, and you don't have to carry that around, and your body will thank you. Because it wants to let go of this stuff. It does not want to carry this around. You do that based on your beliefs and your judgments and your culture and your thoughts that I'm not supposed to and I shouldn't and all that kind of stuff. But your body doesn't want that stuff in there. I guarantee it. So feel it to heal it. Let yourself, if you're angry, just let yourself be angry for a minute, or let yourself cry for a minute, and you will feel so much better. Little kids get this. Little kids, that's where you can teach SEL, social emotional learning, even in preschool. Little kids are like, you know what? If you're really sad, then let yourself cry just for a minute, and you will feel so much better. And the kids go, oh, okay. It's us adults that fight it and deny it and all that stuff. It's kids go, oh yeah, okay, that makes sense. I'll do that. So get in, get it out, and get on. I love that. Or let it flow and then let it go. We don't have to carry this stuff in our body. I should have put this earlier. This is the balance thing about this guy on the left has got good IQ, but not very good EQ. And so he's going to spin around in circles when he flies. The guy on the right has got good balance. And when he takes off, he's going to soar, right? Because he's got both his IQ and his EQ. I'm going to put this up higher. So, okay, so again, good news. This is really good news, you guys. This is really good. I probably should put this up earlier too. We are in control of our own lives. What that means is that no matter what's happening outside of us, the pandemic, the job situation, school's not going well, my parents aren't treating me right, my teacher's not treating me right, all that stuff, it doesn't matter in a way. No matter what's happening outside of us, we get to control and have the power to control what's happening inside of us. That is the best news on the planet, in my opinion. That was a life changer for me, and that's why I want everybody to know about this. It's really, really important that we are in charge of us, and I don't think most people know that. I don't think most people realize that. So super good news. Let me show you how that works. So I'm going to drill down a little further into how this works. Okay. Stuff happens right outside of us. Events, we call them events. What happened? Stuff's happening. If you get out of bed in the morning, stuff's going to happen. If you don't get out of bed in the morning, stuff's still gonna happen. Stuff's happening. It just is. It just is. Life's going every day. Stuff's happening outside of us. Okay. Any argument there? No, probably. I hope not. Outside. We then have a thought and a feeling about what's happening. Guess what? Now it's inside. We just took it inside. We just had a thought and a feeling with it about it. So what are you going to do with that? Right. But right. So it's our perception and our point of view and our belief systems and all this stuff goes into the thoughts and feelings about what's happening outside of us. So, okay. So now it's inside. We just took the outside and brought it inside. Okay, now we got to deal with it because now it's ours. It's not them anymore. It never was them, actually. They're just doing what they're doing. We then perceive what we perceive and bring it inside. Okay, now what do we do with it? What do we do with it? Not about it. What do we do with it? So, number one, again, awareness. Oh, look, I had a thought and a feeling. Huh, that's it. That's all. I had a thought and a feeling. Okay. Number two, acceptance. I had a thought and a feeling. Okay, that's okay. That's okay. I don't need to deny it. I don't need to make up some story about it. None of that stuff. I just did. Okay, I had a thought. I had a feeling. It's okay. It's all right. Okay, so what? Number six, evaluation. What am I going to do with that? All right. What do I like that thought? Is that working for me? Sometimes we like our thoughts, but they're not working for us very well, right? Like the addiction thing. Evaluate it. Is this something I want to do something with? And that is up to us. That's very cool. That's up to us. Next is decide. All right. Do I like it? Okay. What am I going to do with this? Am I going to do anything with it? I get to decide. Again, nobody can make us do anything without our permission. So we get to decide based on our thoughts and our feelings that we are aware of and accept, right? Now we take action. Now we're going back outside. So we did this processing thing. We realize what's going on. We check it out. We make a good decision and then we act. Now we're back outside again into the world. Or not, right? We can decide not to act, but again, that's what people see. And so we're now back outside. Of course, our actions, a bunch of actions become our behaviors, our personality, who we are, what we do, that kind of thing. And that's the results we get in our lives based on what we do and say and think and feel, all that. So stuff happens outside, we bring it inside, we got to process it inside, and then we bring it back outside again. I hope that makes sense. But that's kind of, I believe, how it works. I don't know. So I hope that works for you. Again, here's the good news. Here's the good news again, is that our thoughts and our feelings, our emotions, our decisions, our evaluations, our belief systems, our attitudes, and our actions are ours. 100% every single time. They are ours, all of them. And we created them and we can manage them. It seems to be the tipping point, in my opinion. It seems to be the tipping point between whether you are going to do well or you are not going to do well, is whether you take responsibility for your inner world. If you believe that your thoughts and feelings are because they made me feel this way, or they did this to me, or they're not letting me blah, 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 blah. And so boom, 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 it's going downhill. If we believe it's them that did it to us, we're going to be a whiner, blamer, victim. Oh my gosh, right? It's not going to go well. And we start heading downhill. However, if we think, oh, okay, yeah, they did what they did, but how I respond to that, how I'm going to react to that is up to me, then I am in charge of me and I can get better results. I can go, okay, I don't need to do it that way. I can do it this way or this way or this way or this way. I can respond how I think is right. And that puts me in charge of me, and it makes much more successful. People with high emotional intelligence studies are showing are more successful. They make more money. They get promoted faster. They stick with their job longer. They actually, ready for this, they live longer. They live longer because we are in charge of ourselves. So Emotional intelligence, emotional responsibility is the basis of this whole thing. If you don't take anything from this talk at all, please, please, please take that your emotions, your thoughts, and your feelings are yours. Own them and manage them. It's up to you. Okay. We calling it positive mental health now. As you probably know, mental health is kind of has a negative connotation to it when we talk about it. Mental health assumes that there's issues and problems and disorders and all that stuff. And that's all true. That's all true. And we need to be able to deal with all of that. But like positive psychology said, we don't have to just go from negative, the problems. Therapy used to be for the purpose of getting people from the problems, negative, back to normal, back to zero, back to okay, right? From negative to zero. And positive psychology came out, Dr. Seligman came out some years ago and said, wait a minute, we can do better than that. We don't have to stop at normal. We can do better. We can find out how successful people became successful. How did you do that? And the people that are happy, how did you do that? And we can go up from here. And that's what positive psychology is about. And as you probably know, positive psychology is doing fabulous because people we do need to deal with our issues, but we can deal with them in a way that we can be wildly successful with them. Same thing with mental health. Same thing with mental health. We can deal with our negatives. Like I was saying, we're born pretty happy and pretty loving and peaceful. And if we can learn to deal with the negative that gets put on top of it, the fear, anger, and sadness that it puts on top of that, and we can move those out of the way, we can be okay. We can be happy. We can be peaceful and loving and joyous. So we can do better. We don't have to just go back to normal. We can do better than that. So if we can deal with you, if you can deal with to get to your best, you've got to be able to deal with your worst. And the good news is that's kind of all you have to do is be able to deal with the negatives, and you can get back to get to positives. That's a beautiful thing. So okay. This is, shoot, this is the wrong one. All right, well, let's talk about this. Dr. Ravindra, do you have polls for this one? Should we do this as polls?
You can explain this first slide and we will launch the poll.
I'm sorry, say it again.
If you can explain this first slide instructions, then we can launch the poll.
So yeah, do it as poll.
And explain.
Okay, all right, I'm gonna switch, give me just a second here. Oh, there you go. Okay, yeah, okay, oh, great. Oh, that's better. Okay, so I'm gonna stop sharing my screen right now because this is better how he put it. Okay, so we're gonna do a quick assessment quiz. This is helpful to be able to identify for yourself where you're at, but it also check out the steps that go through in dealing with your emotions. So the first one, as I said, we're going to rate 1 through 5, 1 being no and 5 being yeah, right? Okay, so 1 is very low and 5 is yes, I agree. I do really well with that. So rate yourself 1 through 5, if you would, on. First one is awareness. When your body feels something like fear or anger or sadness or shame, do you notice and affirm that you're feeling them? So if you would, please go ahead and put 1, 2, 3, 4, or 5 in the first part. There we go. Okay, remember 1's low and 5's high. Okay, go ahead. We can't see your answers, so it's still confidential, private kind of thing. So be honest and be honest with yourself. At least one of the emotional intelligence skills is at least be honest with yourself, please. Okay, some 1, 2, 3, 4s, and 5s, mostly 3s. Okay, anybody else? Jump in there. It's really helpful, you guys. It's really helpful for you. It doesn't matter to us. It matters to you. How aware are you of your thoughts and of your feelings in particular? How aware are you? Okay, good. All right, so let's go on to the next one. Identification. When you notice that you're feeling something, how well can you identify or name the feeling you are having? How well can you separate them? Like, for example, fear is different than anger. Yeah. So identification. Yeah. Oh, okay. That's fear. All right. Especially guys, a lot of times have trouble with this. They think everything's anger when it's not. There's a lot of feelings that happen underneath our anger and before our anger, and they're less comfortable and more vulnerable and that kind of thing. And so we tend to not pay attention to them, but it's important to be able to identify what you're feeling. So this is name it to tame it thing. So, okay. And keep track of your score, by the way, because we're going to add them up at the end. Okay. So mostly in the middle. Good, good, good. All right. All right, let's go on. So we had awareness and acceptance, same as before, right? I notice what I'm feeling and I accept it. All right. Wait. Oh, identify. Identify is second. Yeah. Okay. All right. We accept it. All right. So it's okay. Is it okay with you when you feel mad or sad or afraid? Is it okay with you? So that's acceptance. You accepting you. It's pretty important. All right. We got some good numbers in there. Okay, number 4, expression. All right. How well do you express your feelings and let them out of your body as opposed to stuffing or bottling them inside? All right. Mostly 4 is good. All right. I'm surprised. A lot of groups, it's much less than that. Expression is a tough one. That's a tough one. Knowing there's a cool quote. I think it's Aristotle or Einstein or somebody they're attributing to said, it's easy to be angry. It's very easy to be angry. What's not easy is to be angry at the right time, in the right energy, using the right words with the right person, that kind of thing. That's not so easy. And some people don't know how to do that. And so expression is something that's tricky. That's something we got to do. We're going to have to deal with the rest of our lives because that's us. So good. Good to see there a bunch of 4s. Cool. All right. So next is release it. Release it. Okay. Some people are angry and they express how angry they are, especially Americans. They think they need to express how angry they are and they stay angry and they keep on being angry and they find other stuff to be angry about and they just keeping it in their body. And that's not helpful. So once we express stuff, we got to let it go. Right? Like I said, let it flow, then let it go. This is a feel it to heal it thing. We release stuff. Once your body feels a negative, yucky feeling, how well can you let go of that feeling and let it dissipate? All right. So not so good. Right? We need some work in that area, I should say. We need some work in that area. It looks like, according to the poll, this is a very important skill. It only takes a second, but and this is one of the ultimate of it's simple. Yeah, just let it go. Like, yeah, how? Like, wow, how do you do that? And how do I do that? So letting it go is huge part of this whole thing. All right. Now, here's one that people don't really realize most of the time is that once we have pain, we have anger, we have sadness in our body, right? Some people keep like their fear or something, they keep it in their neck, right? They get all tense in their neck or in their belly or in their back, in their lower back, especially. And they keep it in our body. So it stays there and it continues to do damage to our body. But if we can identify awareness, acceptance, identification, expression, and then release, we can actually have a space that pain we keep in our neck. You go find it, look at it, learn from it, understand it, accept it, look at it, and is it what color is it? How hard is it? How is it, smooth or rough, or what shape is it? How big is it? That kind of stuff. It feels like you're just imagining, making stuff up, but it really is real. You try it. It's pretty incredible. And then let it go. You can let it go out of your body. You can take it, and this is called neuro-linguistic programming, NLP. Beautiful, wonderful way of psychology. I guess it's a behavioral mechanism methodology, and you can move this pain out of your body. You can't really see it, but you sure as heck can feel it. You can move it out of your body and let it go. So you can make it float up into butterflies, or you can have it be snowflakes. You can have it drip out of you. You could drop it because of gravity. Whatever you need to do, you decide. You use your imagination, and you can let go of stuff. Okay, then there's a space. Once you let go of that area, say it was in your neck and a big nasty angry thing in there, you can let go of that, and then there's a space in there. Now you can replace that space. You could fill it back up with positives on purpose, right? This is conscious positives. You can use gratitude. You can use a pretty color. You can use, your higher power if you need to. If you're a spirituality thing, you can do things. You can fill up that space in your body with joy, peace, and love, or light green, or a beautiful dark blue, or yellow, or whatever you want. That's up to you. Same cost. And you can fill your body up with positives and your spirit up with positives on purpose. Pretty cool, huh? So you can replace the negatives by letting them go and filling up that space with positives. Neat, huh? So it looks like we need some work on that area. Most people don't like, what? And you start thinking about it, you go, oh yeah, that is, I really can do that. It's pretty cool. So this is a popular step because it's new to a lot of people. And then the last one is rejoice. And that is just about you encouraging and respecting yourself and complimenting yourself for your awareness and your expression. So it's basically giving yourself, I have this funny thing where we put our arm out like this, and then we flip it over, and then you bend at the elbow and pat yourself on the back. So we're celebrating, we're encouraging ourselves, we are building self-trust, we are building a self-esteem, we're building positiveness. So with more positives. I did good by creating positives, and which makes more positives. So anyway, so that's great. Thank you, Dr. Vinja. This poll is really cool. You have to do them all at once, but it worked out well. I hope that was helpful for you guys. I am going to, what you can do is add up your scores. I just made this up, so there's not any specific real high-tech scoring system. More is better. All right, so 5 times 7, 35 is the highest you can get. If you're in the 30s, that's great. If you're in the high 20s, that's great. You're doing good. Maybe figure out, how did you learn that, right? Because you probably didn't learn it in school, and you probably didn't learn it at home. Maybe you did. Maybe you had a cool mentor or someone you watched, or you're just good at this and you figured it out on your own. That's pretty cool. So keep doing it. If you got a lower score, or there's certain areas that you need to work on, please do. So, okay, so we can end the poll now. And I'll go back to, I've got just a couple more slides. I know I'm going over, but I'll try to finish up pretty quickly, okay? So
all the participants kindly answer the poll. We'll be ending in just 20 participants have filled the poll. For rest 22 participants are yet to fill up the poll. Immediately take the poll so that we can end and continue with the rest of the session. Because once ended, the poll cannot be restarted. So kindly take. This is completely anonymous.
yeah.
Your scores are completely confidential, anonymous. You will not know who has rated what. So you can feel free to rate yourself, assess yourself.
Okay.
We will give you another 1 minute to
Okay.
answer, and we will be closing in another 50 seconds. kindly everyone answer the poll.
We got half. That's pretty good, I think. Yeah, I hope that's useful for you. I'll share the PowerPoint when we're done, and you could take this later. I also have it on one page, so you can give it out or print it out or take it again or however you want to do it. But it's
So
I find it helpful.
ending the poll now because of paucity of time. So let's see the results. So yeah, we can see the results. Matt, can you see?
Yes.
Yeah.
Yep.
22.
Yeah, you
almost.
know.
Yeah.
You know what you need to work on now. So please do. Replaces seems to be the weakest one. Expression is the toughest one. Good job. There's a lot of good stuff there. Acceptance is critical to the whole thing. So, all right. Good. Okay. Can we take that down? And then I have a few more slides if you don't mind. Okay, can you see? Oh, Dr. Ravinder, can you take it down now? The poll, end it.
Yeah, now. Yeah, please continue, Matt.
Okay, the poll's still there though. Can you? How do we get rid of it? Is that up to me?
It has been ended.
Okay. All right. Okay. Okay, good. All right. So high 25 up is good. 15 to 24 is middle, and low is not good. Do better. So what do you think and feel about your score? What can you do different to improve your ability to I call them transforming your emotions. You're transforming from negative to positive. What can you do to do that better? It's very important skill. And, how will you do better emotionally? Emotional safety is key to one of the keys to this whole thing. And that is about acceptance again. And it starts with you. It starts with you accepting you. It starts with you accepting your thoughts and feelings. Just accept them. They're there. Just accept them. You might want to change them. You might want to adjust them. You might want to work with them. That's okay. But first, accept. You don't have to like them. You don't even have to approve of them. But you do kind of have to accept that they are how they are. It is how it is. If you guys know Dr. Wayne Dyer, who passed away recently, he was a wonderful personal growth coach. And he said the main point of emotional intelligence or personal growth is it is how it is. If you accept that it is how it is, exactly as it is, then you can do something with it. If you don't accept it, you can't do much with it. Okay. So let's get good at both our thoughts and our feelings. Emotional safety is key. Like I said, you being safe to you and you being safe for other people. I'm going to go just touch on this real briefly. This is, again, model from my mentor, Doc Downing, and he said the events happen, right? I said stuff happens. We then think what we think about what happened and what we feel about what happened. Then when we base our behaviors on that. So a lot of stuff happens in our lives, and if we want to make some sense of ourselves and other people's behaviors, we look at the thoughts and the feelings behind their behaviors. So I made this form. This is a worksheet that we use in our classes. We've been using for a long time. The event is what happened, just something happened. And I'll show you one that's filled out. This is me. We moved, like I said, we moved a lot. All right. We moved a lot. Okay, that happened. That is reality. That's a fact. That's what happened. And it's in the past, and there's nothing I can do about that. What does that mean to me? And what does it mean about me? What does it mean? That's my thought. Something's happening. What does that mean? Well, I thought that we were moving all the time. So I was losing my friends and losing my family, and people were leaving me. I thought that they were leaving me. I thought that they didn't like me. I thought that I was unlovable. And so that's what I thought. That's what I thought it meant about me. I was like 5, 6, 7, 8 years old. And that's what I decided. That was what I thought was the meaning of that. And so I thought life was very painful for me. I thought the world was very scary and out of my control. I thought that my dad wasn't there because we were moving and he was always at work and that kind of thing. I thought my mom couldn't stop it either. She didn't have any choice either. And so she was kind of a victim. And so I put these meanings. I did this all by myself. I put these meanings on the events that happened, right? Does that make sense? I put these meanings on the events that happen. They're big negative generalizations, I call them. Well, guess what? If I have these negative meanings, I'm going to have some negative feelings, right? How about that? If I felt like I was not lovable and that people didn't want to be around me, it was very painful for me. I felt hurt. I felt angry. I was angry at everybody and everything. It just seemed like I was just an angry little boy, as my dad put it. And I was really, really sad. It turns out that was more real than the anger, actually. But with all these negative meanings, I then had negative feelings, right? And guess what? I had negative behaviors based on my thoughts and my feelings. So a bunch of stuff didn't go well as a teenager, as a young adult. Things did not go well for me based on my thoughts and feelings. So that's what happened. That's the first part. Now, what do we do with that? Here comes the good news again. All right. We go down to the bottom part. The bottom part says we moved a lot. That's still true. That's a fact. That is true. Same event, same exact event, right? But if I think that I'm unlovable, that's not going to go well. What I realized later on after doing some work on this is to go, you know what? They weren't necessarily leaving me. They were just leaving. The other kids that we hung around with were also in the military and they were leaving. So either I was leaving because we had to, or they were leaving because they had to, not because of me. So that was very good news to me, as you can imagine. So I was like, oh, maybe it's not me. Maybe I'm okay. Maybe I'm still working on that. Maybe I am lovable. I don't know. Maybe I'm okay. Maybe life is just interesting and the world can be safe. Maybe maybe. And I started working with those. And if I think that I'm lovable, then I'm going to have much better feelings, right? I felt more safe. I felt more peaceful, more connected with people. And guess what? I did better behaviors because of it. So this worksheet available for you if you want it. What happened to you and what did you decide? What does that mean about you? What does that feel? How did that feel? And what did you do with that? Or what do you want to mean? What do you want it to mean? How would you like to feel? And how would you like to behave? So I think this is very, very helpful. This was, again, a life changer for me to realize this. So being able to understand our past allows us to live fully in the future, in the present, and create the best future that we can for ourselves and those we love. So working on our past, I'm a big fan of inner child work, I call it. That's exactly what this is. Or it can be in the present, but mostly it's in the past. And we figure out what our meanings are about life, our belief systems about life. And we a lot of times end up acting on those, whether we know it or not, whether it's unconscious, and we're acting on these negatives that we used to feel, right? Or we used to think. And And that, you know, based on a 5-year-old making these decisions, and we're still working on this 5-year-old's pain, that's not particularly helpful. And it causes us to do things that they don't make much sense to us and they don't work out very well. So anyway, so you can take yourself through this process or take your people through these process and change it, change it. Positive mental health. This is positive mental health. So I was trying to sum it up here. We're getting to the last ones. What matters? Our thoughts and our feelings matter. The thoughts and our feelings matter. Accepting emotional responsibility, that matters a lot. That matters a lot. Accepting emotional responsibility. They're my thoughts, they're my feelings, they're my beliefs, they're my values, they're my actions, mine, mine, mine. And I get to run my own show. All right. Self-care, very important, especially for you guys, for people that are taking care of other people. You got to take care of you also, maybe first, sometimes first. And so self-care is a huge thing. We're doing a workshop soon, a big conference, and the whole point is self-care. So learn about how to deal with you. How can you adjust your thoughts and how can you deal with your feelings both in ways that work for you, that can keep you okay. Belonging and connection is huge, you guys. It's huge. Like I was saying, the person, our relationships, especially long-term loving relationships, are so critical to our happiness and our ability to keep going. So belonging and connecting is really important. We're doing it right here in this group. That's pretty cool. We're succeeding right now. And it's up to you. It's part of the emotional responsibility. It's up to you. They're probably not going to come to you. You got to go to them, and that's okay, but you got to do it. So you got to do it. It's really important. It's really important to have safe people to talk to share with, and to vent sometimes, and just like, God, this is awful. And then let it go, and then let it go. There's a difference between complaining and venting. Complaining is, and you don't let it go, and you're just trying to convince the other person how bad it is. And you're like, okay, all right, it's bad. All right, now we both feel worse. All right. What's the point? Venting, on the other hand, is like, no, this is really going badly, and I'm feeling all this stuff. And I don't want to keep these feelings inside of me anymore. So I scream them out, or I cry them out, or I talk them out, or I do whatever I need to do to express them and release them. And then I can replace them. And then I can feel much, much better. That venting is kind of magical. It's also totally free, but it requires safety from your part and hopefully somebody else. You can do it by yourself, but it's harder. Letting go, another super important skill. Let go of negatives. All right. Yeah. Yep. It's happening. Yep. It's bad. Yeah. It's bad. Okay. I don't have to carry it around with me. I don't have to walk around angry all the time. I don't have to walk around hurt all the time. I can just let this go for a while and just be okay. Right now, everything's fine. RPG, resilience, perseverance, and grit. I love that word, grit. You know, that word grit means this is going to be really hard, and I'm going to do it anyway. And I can do it. And it's going to be, you're gritting your teeth. You just, but I can do that. And that builds, again, self-trust, self-esteem, self-awareness, mastery is the ultimate. Burnout is from not sharing. Okay. In the medical field and the caregivers field, burnout is a huge thing, and that's from not feeling or not letting yourself vent and feel and let go of this stuff. Patients heal faster if they believe their caregivers care about them. Some patients feel healed just from their caregiver caring about them. They're like, wow, somebody gives a damn. That's really cool. And they can actually heal themselves. It's amazing what they're finding with this. So if you can care what people are thinking and feeling, not too much, but all enough that they get it, it really helps their process. And personal relationships lead to longer. You actually live longer. That's pretty wild. There's some of the studies are showing you can live longer. That's pretty neat. So again, inner peace we're trying for, interpersonal peace between us, social peace among us, and maybe if enough of us know how to create peace, we never taught how to create peace. We don't even use that word. If we could learn how to create peace in and around us, maybe someday we can get big peace. And that's what our nonprofit is trying to do by education, emotional education. So accept emotional responsibility, live and love and teach and model EQ, and share it, please, because most people have never heard some of this stuff. Please share it with somebody, anybody. It can be a little kid, it can be your mom, it could be somebody at school, it doesn't matter. Share about emotional intelligence and emotional responsibility is a big deal. With great power comes great responsibility, right? What movie is that from? I love that line. It's really true, especially in this area. So this is my last slide. Yeah, we did it. We're done. Let's be friends if you want. Let's connect. Our nonprofit is EQ for Peace. You could join us. At least get on the mailing list so we can stay in touch, and we'll give you. We have tons of information, and we keep coming out with new stuff and new research and all that. And so, if you want to stay connected, I got a YouTube channel. Got 150 YouTubes on there or something like that. Write to me, matt@eqforpeace.org, or here's my WhatsApp phone number, and we can stay connected. So, all right. Sorry I went a little bit too long, but it's a huge subject. I have hundreds more slides that I didn't go over. But I hope that was helpful for you. Again, thank you for being a caregiver. Thank you for caring about other people. If you're a professor or you're a nurse or you're a student, whatever, if you caring about other people is a big deal. Thank you for doing that. And I hope that you can make emotions, learn consciously about yourself, your thoughts and your emotions, and put those to work in your life because they change everything. So, all right. Any questions or comments or anything else?
Thank you, Mr. Matt, for the wonderful presentation as usual. Yes, like as you said, it's very important for everyone to manage emotions. Today, intelligence is also okay, fine, but without emotions, even intelligence is also handicapped, is disabled. So you have high IQ, maybe 120, 130, 140, doesn't matter if you don't manage emotions properly. And that doesn't help you, in fact. So that's very important topic today. You have given wonderful insights into emotional intelligence, and we are happy that we have taken our emotional intelligence quiz and also has insights about our own EQ, how we are and what we need to work on really, and how to work on. It's a very great session from you. We thank you. Whenever we approach you, you readily welcome and accept our invitation. Join us in spite of hard times. You see the energy levels you have. In the daytime, we are like, oh, and in the midnight, you are like, oh, rocking. And yeah, that's great. Good to see you. I mean, we all have to take you as a inspiration, motivation. See, even we generally used to tell, even if you wake up in the midnight, you should be able to answer it. But that is true example for you. Even in the midnight, we are waking up you for the session and you are delivering an awesome presentation. Hats off to you, Matt. Really very thankful and grateful to you. You did a wonderful job.
Thank you. I'm happy to talk about it, and thank you for listening. I hope it was helpful for you, and spread the word. It's really important, really important, as you can tell. So I'm good. Thanks again. Do you have more speakers or?
Yeah, we have another speaker lined up. So
okay, great.
We'll continue with the session. Thank you, and have a. So you have a night here. So good night. Have a good sleep.
Good night. I'll go take a nap. All right. It's 3:30.
Yeah.
Okay, guys, take care. All right. Let me know. I will, Dr. Ravindra, I'll send you the PowerPoint so you on Google Drive so you can share it. And if anybody needs more information or you want to get in touch with me, please feel free. So, and please share it with other people how important this is. So, okay. Good night, all, or good morning, or good afternoon. I guess it is for you. So, bye-bye.
Thank you. Thank you for accepting our invitation and joining us.
Anytime. Bye.
Bye. Take care. Good night. Thank you, all the participants. You have been eagerly listening to all the sessions. So till now, the 3 sessions are very important. I mean, one is saving our own lives and other lives. And the next session, the recent session, was on managing emotions. We might have whatever IQ scores, but if we are not able to communicate, if we are not able to handle our emotions, identify our emotions, it's very difficult to manage our careers, especially when we are in medical health careers. It's very difficult to manage ourselves. Work-life balance becomes, and the success rate, or I mean the errors or the mistakes committed by us, the wrong decisions that happens. This is all because of we are unable to manage work-life balance, and we are not able to take informed decisions. So even our careers, even our life gets affected, and there is a lot of like already Matt has given an example of US resignation pandemic. See, people are leaving jobs in spite of high pay and all this. Why? Because taking sustainable careers, what you like, doing what we like is more important, and getting happiness, satisfaction of what we are doing, contributing to the society or to ourselves or our family is very important. So these things are very essential nowadays. So now we will, sorry for the delay for the sessions. I mean, we have still session left. So feedback will be shared in the last session. So kindly bear with us. So I invite our next speaker. So we'll have only just one session, and I will be concluding with my session in just a couple of minutes. So instead of 2 speakers, we will be having only one speaker, Ravichandran ji. He will be covering both the topics, HR process and resume building and employability skills. So we invite Ravichandran ji, Principal Consultant, HRM Mapper Consulting Co. And he is currently employed in Ministry of Defense and has over three decades of experience in HR. So you can gain a lot of insights, and at the end of the session, you can also prepare your CV. Kindly have your materials ready, like paper, pen, pencil, eraser, scale, or whatever, if you are doing it manually on paper. Otherwise, you can have, if you have system or laptop or tablet on which you can prepare your resume, you can use them as well. So be ready with the things. We'll be starting the session, and let's all together make our resumes, CVs. Yeah, Ravichandran ji.
Yes, sir.
And unmute yourself. You can start your video and you can start presenting. Hope you are with full energy, which Matt has inspired us in spite of midnight. He is so energetic. And in spite of being in daytime, if we are dull, then so take all the inspiration and energy from all the previous speakers, and let's continue to rock the sessions.
Sure.
Over to you, Ravichandran.
Thank you very much.
Yeah. So do you have PPT?
Yeah,
right.
the PPT is made ready. It's in front of you. Can you able to view it?
Yeah. So can you check? Can you move the slides?
Viewable now?
Yeah. Can you change the slides? Okay, it's working. So you can go to the first slide and you can continue. Over to you.
Good evening to all of you. Precisely, no, just I would like to give a very short form because many of them were sitting in the platform for quite some time. I do understand. The entire platform was quite energetic, and all amongst Dr. Ravindra, the way he takes everything in the biggest and a very positive form, which is quite necessary along the participants was also. We're all on the platform without any missing of anyone. But at last, when the contribution comes from the doctor who, the one who gave a detail about the medicinal importance and clinical importance, Madam George, she was also giving a lot of interpreting, understanding the women, employment, curriculum profiles, everything. It was where we landed, along with the EQ is so important for the employment industry of today because the EQ, IQ differs a huge difference. Though I'm coming with a different topic and dialogue on the beginning of the CV itself, why do you want to connect? EQ is also quite important, essential skill which is needful at this point of time. Because we are more connecting towards the EQ rather no IQ. Our IQ, we feel that IQ is already we are an achiever, and I'm sure I'm going to get a job or I'm going to get into the moment of my employment wherever. Because let me tell you, the current scenario, I just want to talk to you all in quite general form. I feel somewhat all the participants to put one tick on the chat because that's going to be quite important to me to initiate this entire speech. I want to make the entire platform to be quite live because all the way we were sitting for the past 5 hours without even missing off any of the faces, any of the names. I could easily feel it. Only the importance is how present you are in here. Because my last 10 sessions should complete in the biggest way. This is what I do hope and believe in that things should go and all winded together kind of guidance, suggestions, opinions come from you as well. I should also learn from you when I complete this, the presentation I'm planning to give it. At last, any presentation I go, we usually as a HR people go with the speeches of moving on the floor, holding the mic on the collar and carrying either mic in hand. Possibly I go with the mic, collar mic, because we move over, we give it a lot of movement on the eyes, hands, and walk on the floor, go along and nearing to the participants, talk to them, touch their shoulders, touch their shoulders behind, make them to connect. Rather, here I'm unable to do so. But at last, by words of my cosmetics, should make you all people to just keep yourself little brisk, make a little energy. I want to give you 50 seconds to all of you in my session. Keep your eyes closed. 50 to 60 seconds, please take it from now and make a little longer breathe and feel yourself, the breath is within you. Start the time now. You are going to start with your breathe in and out for next 60 seconds. Yes, you are taking an oxygen in and out. I'm sure none of them were even able to understand they were taking breath in and out, because most of the time we feel that we are, no, as a human today, we are more into a machinery model, no, more of machine method. So that's why I want to say you please take 60 seconds now starts. Take inner breath, outer breath, and feel the oxygen pull along, pull out, pull along, pull out as your common practice. We start now.
Are you still connected, Ravi?
Well, okay, I'm connected.
Yeah, please continue.
Yes. Well, initiating the moment of, especially I would like to say the truth of what is resume? What is resume and why do we need? Dr. Ravindra sir, in the beginning, what do I feel to say is, in the chat, you can see whoever is on screen, just let them enter JS, job seekers. Let's see how much of them are really job seekers here, because this platform is so important to them, apart from whoever is a commoner, no issue. Let them type on their chat box JS, 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 job seekers. So it makes more penetrating to the mind to take up this call. So now, well, and you please count them, make it yourself ready, then we'll go with it. Anyway, let them go ahead with JS on the chat box. That means job seekers. So this start with their pencil, papers are ready. It will make them really good to them when at this point of time. These people have started replying you, Dr. Ravindra.
Yeah, we can see, you can also see the results.
Is it so? I am unable to view it. Let me view it. Let me chat box. Yeah. How much of them are looking for a job really? Let them type JS, JS, JS. No issue.
Yeah, participants quickly answer so that the more you quickly respond, the more we can.
Yes, dear participants, all my friends and ladies, please hear my voice carefully. Enter on the chat box. If you are a job seeker looking for an employment, please just type JS, JS, JS. Quickly complete the chat call. So what helps us? Yes, it makes you to really understand at this point of time, you want to understand this particular context. Anyway, things, let it go. You keep it ready. Anytime you can raise a question and we can go with the question and let it stay. Right. And why do we need a job? And why do we need really a resume? We all commonly look for a job. There are applications available. Dr. Ravindra sir, my slides are running.
Yes, we are in the second slide.
Okay. See, the job seekers, especially to understand their own importance, they are like a brand. They are like a brand product supposed to sell it to the employer. The employer commonly looks for their exact needs. Any of the current employer in the current business market, even including the NGOs, social NGO, social centers, communities, and even the UNICEF. I was going through certain requirements given by the UNICEF just 2 days ago. They were very, very exact measuring on the job description, what they expect. So, including the NGO organization, their contribution towards the social development, they exactly pointed what job description you were accomplished for the past 4 years, 5 years. Though it could be a charity, in an understanding what we feel is an employment for UNICEF, even the CRY, Child Relief and you, all were exactly measuring the quality of the importance of the objective and the job description given by them matches to the candidate. So keep aside any of the industry, and they are corporate companies, nothing other than their script, what is given for an employment curriculum required, and what is the script given by the candidate is so connecting each other. So that's why the job lookout is very important. You need to accomplish and accommodate all the connected inputs to your CV in a very rightful manner, in a rightful sense, and a rightful support. Otherwise, there are several sets of CVs arrive for each employment lookout. So be careful when you look out job, your CV, that's either resume. I will explain what is CV and resume a little later, because it carries its own product of inputs given in English understanding. But CV and resume are quite similar to each other. Even the previous time, they call it by biodata. In the years 2000s, around 15 years ago, nobody would use the word of a resume. Curriculum vitae. It is an UK and Italian word. I can call it by Italian word curriculum vitae. So now we call it by short form CV. So those times used to say it by biodata. So the day changes, everything differs. Your period, that means the year 1990, when we were looking for an employment, and year of today, 2020 later, all were changed rapidly, phenomenally. The entire technology have got into the world. Let me tell you, all the participants, please do note. The entire technology in the world, the one you have it in the handset, mobile set, even the aircraft, the helipad, or anything, the train, travel, journey, technology, television method, all new technology methodologies all came up in the world only after the World War I and II, and approximately not anything beyond 115 years of time. 115 years of time, the world is changed in a drastically highest way of speed. Repeating it, the drastic speed in just 110, 20 years of time, the entire technologies got changed. I'm putting the word, I'm giving you a silence in the middle, because you please feel where were you earlier, where are you today? We all were having a different, domestical background. Our business of employment was only with our ancestors' properties. We We all were the richest people if we do 2 acres of land doing a farming work 3 years ago. That means 120 years ago. 50 years even behind. If you look at, your father could be a farmer, my father could be a farmer. But today the entire agriculture domain got in behind. And all the technologies are coming up front. And we all lost our limelight of the previous period, family life, joint family togetherness, and we all become a single man. We are at 4 at home today or 2 at home today. We all live in an individual family, having all the things are two at home. Those times we all were living in the joint family. So imagine how the totality of the entire lifestyle is changed. The needs are becoming a rapid speed. The technology is in a rapid speed. Why I'm giving all this before as an introductory in the employment domain when you look for a job, to make and not alone to abreast yourself, to reach the accomplishment, whatever you achieved, so make it as a quote, you are a brand of today. You are a Ray-Ban glass wearer. You are wearing a Ray-Ban glasses. We commonly wear some other glasses without the brand image on top of it printed, or Lee jeans you wear and you carry the image of the brand and you become the marketer for them. You are having a bag in hand and it is showing the name called Nike, Nike. You are the brand manager for them. They are selling through you. Please do understand. After buying the product of Louis Phillips shirt. Louis Phillips shirt, you are wearing a shirt which is the highest, costliest brand, or whatever, Lee Cooper. Anything you wear, for the matter of fact, Microsoft, you are having it in your bag, written behind of your bag. You become a marketer for them. You bought the product and you become a marketer to them. Hope you understand what I'm explaining you, please. Yes, you are the brand yourself, looking out for an employment, unless until you sell yourself carefully with a more accomplished way, with the best way of communicating, you become in the ocean, fall into the ocean, unable to withstand of whatever, either the post-COVID period or pre-period. It becomes quite nullified. It becomes a little slower in pitching up yourself. Nothing else. It takes time. But anyway, freshers, I'll tell you, you got a big market available for you. You will certainly land up in a good job. But over a period of 5 years to 8 years and 10 years later, how you're going to employ yourself, how you're going to skill-oriented market changes often and often, you're going to match with it. It's all up to you where you are going to stand. Okay. Now I go straight to the curriculum vitae. I'll still explain what is curriculum vitae later. And I suggest copy this, take a snap of this. Commonly everybody uses. There's no big wonder I'm putting it in screen in front of you. But please take a click of this by your camera or by writing it by pencil. I suggest writing it by pencil, whatever. Quickly make a point. These are the quite impressive way of putting your CV in top. On the right side, photograph of yours. Photograph of yours, passport size photograph, fix it. And profile, skill set, right on the point of 5 itself, just next to employment, that is the email, right? Skill set is very important. Don't miss it. Word can start with motivator, dedicating, creative, self-starter with clear experience mentioned 2 years, 3 years, 4 years, 5 years, and put it in after experience in the domain of the job description given by the employer. Where you are applying for a job, don't miss it, write it clearly as per the job description by the advertisements given. Do not circulate your CV, resume, biodata, whatever it is in form, in a single format. Make a little correction on the profile of the life importance. The reason is it is becoming a very catching, otherwise your CV will become one amongst the other. It may get missed, not by the person who is looking for as a manager in sales, manager in technology, manager in deliveries, because he is quite serious thinker, but the HR may not be in a position to understand everything of your knowledge. The HR department would accept it and take it up. The CV may get eliminated, rejected in the first screening itself. I repeatedly say the CV, most of the CVs, 85% of the CVs getting rejected by the first screening itself. You would be pondering yourself that how come it's getting rejected, no reasons given. So make sure your job description is matched in the profile. That means skill set itself. I'll go to the next now, please. Anything in this relevance, you can ask individual questions or share later to me along with Dr. Ravindra. Okay. Going to this session, academic qualification can be put in the same box the way I have put it. Take this image also, very important. Don't miss it. It all should be mentioned on top of it. For the freshers, especially for the freshers, please ensure your academic qualification, maybe the technical, you can put it down below in another similar format of box. Academic start from the chronological order, PG qualified, on top of it put PG, school, year, institution, everything the same format. If you do not want to mention your percentage of scores, no issue. Then accordingly you can make in a different format, but don't put like this and don't put a dash if you don't want to mention your percentage, because certain years of experience beyond people do not tend to show their percentage of scores due to various reasons. And they will have the second thought that maybe my CV get rejected or whatever. So that way, don't worry. So otherwise, this is a best format for entrance for the employer. Can new freshers. This is a very standard input. If you are 1 year, 2 years of experience, go within a kind of an experience clearly mentioned in chronological format. Similarly, chronological mean your previous experience should come earlier. That means in the bottom side, the current employment should be on top of it. Got it? No? Your current employment experience should be set as year 2002 or 2021, 2000, 2020 or whatever till present day. That should be on top of it. Previous experience should come behind. And before to that experience, come into the third file. Anything in middle, there is a gap of employment. There is a gap of employment. I will guide you, and you can even keep it in a different form to giving a personal reasons. But don't leave it blank. That will make a puzzle to the candidate, to the employer, which will make a little awkward. So you can put it due to reasons, certain reasons commonly accepted. It can be even mentioned. That's not a problem because it's a dynamically accepted over everywhere common. Repeat skill set. You can write your skill set in the CV, which is quite important. Why I'm saying skill set is so important. You can write like computer literate, excellent communication skill with the fluency of languages, mentioning your mother tongue on top of it. Next subject, your technical skills, whatever, always need to be very important, mentioned on the top of it by 4 lines of the skill set. As I said in the beginning itself, you are a brand. You need to mention as you are selling the product of Maruti car as you feel or whatever you feel. So make your individual name as a brand building. It helps you, and actually it helps the employer to know you better. That is the reason we always say it represents, the CV represents exactly your inputs are matching to their needs. Otherwise, it misses out, it goes to the ocean of CVs commonly available. It provides idea of your career, it provides your information to your employer. And make sure that covering letter is quite mandatory. Even 3 lines, the same skill set is printed with a little diligently written in a formal way. That is also quite important. Dear sir, I would like to submit this application for the position of blah, that particular designation, and repeat the covering of the same skill set. I am Ravichandran. I am looking for the opportunity of so and so, and particularly writing the skill set, whatever is given over. Repeat those. That will easily take the CV without even seeing the first sheet beyond. They'll put it in the tray as a CV shortlisted. So while you make your CV building, now you are in the status of CV building, preparing your biodata CV. So make it very careful in the initial itself. Okay. Commonly, this is after CV shortlisted, but ensure when you make your CV ready, it's common question. Everyone asks, everybody asks. It's quite cumbersome to answer it. You little get jot down, or you little shaky of answering. What is this? Though everybody knows, this commonly raised a question. Tell me about yourself. The moment you sit on your desk, every employer would raise a question to you. Tell me about yourself. Anybody feels, just think over. In case I could have been in the hall, I could have made 2-3 brains come stand and answer it. But anyway, anybody want to break in the middle, you can break it with the permission of Dr. Ravindra. It makes quite senseful for others to understand. But anyway, I would like to take it up straight away. Let's take it in the next chart. Tell me about yourself. You can say it by straight answering that I'm Ravichandran. I have a work experience of 5 years in the field of sales management with my ability of knowledge learned, I could handle 2-3 juniors in the years of my overall years of experience with the skill of team managing along with my specific skill of sales manager for the company of the industry where you are talking. So make it very crisp, clear, sharp answering it. This is not after you go attending an interview. This is the CV building we are talking about. This is, I'm saying, when you are CV building itself, make yourself ready, make practicing, make it very comfortable. Tell me about yourself when the question arrives. Give in the shortest time, in the highest pitching, answering it. That's very important. The first round you would get carry along quickly. While you do CV preparation now itself, make yourself organized in this question ready. As I explained you, the next slide moves the basic design, structures, elements, do's for resume, don'ts for resume, how to avoid errors, proofreading. Let's come back to the document, because I was talking about the moment you are selected in interview for a discussion, that makes you to make your shoulder and raising up yourself. You are sitting in an interview hall now. I don't know. Let's feel it like you are in an interview hall. So this sense of responsibility when you carry, you will become an alert. I hope that you can catch my words very carefully. You sit like an interview hall now. All of them, please, all the participants, job seekers, make alert. You are in an interview hall now. I hope that you are looking for a job. That's why I would like to suggest, make yourself ready and make your pencil ready. No, sharpen pencil, sharpen your brain. Just tick, 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 write it on the paper, possibly, essentially, it's becoming very important. I know you could have gone through larger numbers of websites, available inputs on desk, on your computer itself. But feel like where you are now, you are in an interview hall. And take these points. Basic design structures, do's for resume, don'ts for resume. So you will know how your CV need to be quite alert to get along the next call comes. But basic structure of resume CV. Now, my dear participants, all please look at the paper I have given. The carry statement. Want to write it or photoing it, image taking it on screen or print screen form. Take it, print screen, whatever, copy it on the desktop of your Word or whatever form. So the moment you complete this session, you will understand easily why the importance were given so important. No, like, look at this. See, I have given strategic planning, blah, blah. Global operation 1, business transformation all. You know, these are the job description of the employer had given in the paper ad or website portal. No, they have mentioned strategic planning. You write the same word over here. Global operation. No, maybe the CV looks a little thicker to you, but anything relevant to the input they have given in the CV, that means in the job description, you connect to it. Come and connect to it. This is what the CV building. CV building does not mean that you print a notice, hand slips, and send it through Indeed, Naukri.com, Monster India, and just forward to 100 people. 100 people. Never ever post your CV on website advertisement straight away. Your CV will fall into everywhere, like a WhatsApp, group WhatsApp. So never do that without any referring of advertisement. Don't worry. I'll give you a little later how not to worry. How not to worry, I will teach you later, since we all come across over a period of years of experience. Okay, take this sheet. Well, I'll go to the next. Your CV sounds the way you write. The CV shows your personality. The CV shows your communication skills. Hope you got it, what I'm telling you. The moment you put your CV carefully, naturally it shows your personality of it. Don't put too much of jargon words. Though I said it in the initial, little be careful. Don't put lot of jargons. I'm quite go-getter, passionate. I'm more do-getter, go-getters. These are commonly used words. When you mentioned about your pre-employment project experiences, your research study works, all need to be very carefully pointed out, because don't put any cooked up by data, cooked up CV, it will make you backfire. So whatever you did as a fresher, any projects you completed, be careful. As I said, these jargon words, don't try to use them. These are commonly used by everyone. Find a difference subject to the job need. Passionate, good communication skill, extensive experience, go-getter, team player. It's a very common, everybody writes in their skill set itself. So, no, very important. Don't write it in the skill set mentioning all these words. At last, you need to be put more of your straight experience or straight your project knowledge. Anything will lead a team. That should be a job description. That means skill set. Okay. Career objective. Career objective. You need to be prompt enough understanding who I am. Commonly, no, in a philosophically, if you take, that's a different answer. But in the employment industry domain, who I am, it differs a huge amount of differences. What I want to be, who I am, who am I? These are the common phenomenon used in this employment industry. The current employment industry looks to the people only to their tailor-made needs. They carry a shoe in their hand. They carry a shoe in their hand and put it in front of you and put your foot inside. They don't look at your size of the footwear. They look at their shoe is available and they try to put your foot inside. This is the methodology of recruitment domain of today. The most of the corporates look for their needs, not to your passions, not to your needs. I'm not giving any negative approach on the employment industries over any corporate sitting in this podium. That means in the participant hall. But I want to suggest, make sure that you are made up for the employer, not to your own interests. Because employment industries looking for their commercial achievements, including the NGO organization, is looking for their achievements of their projects. So be careful when you put anything, it should bring grabbing attention, grab their attention. It's your importance. As I said, interviewer versus CV shortlist. It's like a match. Versus. I said it as a versus. It's a match winning game, like employment lookout is a match winning game, cricket match. Repeat. Everything makes the quite sense. As I said, job description relates to your objective to specific job. When you would like to have an alternative employment, that means different skills are need, make your CV also changes. Slight differences is always important for even the same job needs. Why I say is this, you go to the website of their company, you apply for any company employment, look at their websites first. Visit their website, look at their future forecast programs, match with it, connect with it. This is the CV building. Not the CV building, just writing your name promptly, writing things and common things, projects you did, and all, that's not allowed. And you must visit every employer website, have a connect to it. Connection between is very important. As I said again, grab attention on the CV itself. It's a machineries. It's a machine formula. Everybody looks at their needs. The assembly tools, ratchet wheels in front of their brain and your brain should connect. That's why I put this as the machine model. You see, there is no brain and nerves and bones and flesh inside of their man to man, no body to body, brain to brain. It's all the machineries. Though philosophically, I'm sorry, philosophy man who is in front of me may not accept it. But industries, we need to respect the value is given for their needs. They are working phenomenally on certain principles. And you are need to achieve on these because you are a young man, fresh mind. You should connect. Without a connection on CV building, how will you cope up? I'll go behind later screen, explain all reasons of what is the employment industry of today, post-COVID. But ensure at this point of time, you are in a formula of whatever is in front of you. This image is quite important to me. Otherwise, I don't put too much of images. It's not a joke of image. It's a seriousness I'm putting you, since you are putting your CVs ready. The machinery is like. Next slide is again, look at it. It's the dice of the interviewer is already gripped in a similar format. Now your a jigsaw. It's a jigsaw, I would say, game like. Connect to it, exactly connect to it. This is the way CV build. This image is, look at it. Look at the image, then you will understand what, you don't need to even read the contents. Look at the image alone. The brain of sitting a person in front of you, how he's conducting an interview. He's organized the clips in front and you are little shaky, not connected each other. Now you need to get in connect. Till the connect comes, the employer will look at you as a shackled form. The image is sufficient to you. This is what the condition of today. So then you read it. Now I'll tell you what is CV resume. Earlier I said what is CV and resume. Today I'm going to explain CV, it means that you are going to write it in the biggest form and lot of description, lot of annexures, and only 3 pages of CV, including any. Only 3 pages should be there in the biodata. CV, resume. CV means having only 3 pages or more, little more, but anything beyond the 4 pages, I suggest go with annexure. I know many of the research scholars could be looking out for an employment after 3 years, 4 years, having a lot of piled up works they have completed during their employment tenure or in their college research works, having a large amount of papers. It can be connected as an annexure. Don't put it in the CV itself. If the college institution is asking their own format, no, I'm not denying to that. Your CV can also be attached with those formats in the format of 3 pages of CV annexure in the form. Then if it is a resume, try make it in 2 pages. I majorly commonly write only 2 pages of resume. I don't want to put all my experiences of 15, 20 years and write from the day one what and what not. May not be relevant. So everybody employer looks at your first 2 pages, 3 pages, later they put it either decided, get shortlisted you, or decided not to take it up further. So in CV building, make it very clear before writing it, nothing beyond 3 pages. Yes, we are coming back very clear, commonly used. Covering letter is mandatory, use keywords. As I said, keywords in Naukri.com, Monster, Indeed, everywhere there are in search by keywords. Mention and search in the form of keywords. You write keywords as per their format, and those keywords, take a copy of it. Exactly, you put it on your CV. Hope you are getting. Anybody is wanting to raise a question, please note it. Raise a question on this because it may be a little confusing to you. Make a point, ask me later. Use the keywords of Naukri.com, Monster, and Indeed, whoever. Take their keywords and put it in your CV. Now see how quickly your CV is getting shortlisted after making the best CV building. Always grab attention. Attention is quite important. Size of the font. Size of the font is quite important. Don't use any colors. Very important, use action verbs. Action verbs. Grab attention. This is what the grab verbs. This is action verbs. I was selected to direct group of 5 people. This is attention bringing on your CV. Because of strong interpersonal skill, I was selected as a team leader, 5 members team. Okay. Action verb. I was explaining what is action verbs. This is also quite important. I was handling and addressing clients' queries, concern. This statement should be returned as I handled, addressed client queries, concerns. I handled, not I was handling. Don't bring it in a present continuous format or past continuous. Make it in a breaking ice kind. Write it in action words. More impact, impressive, decisive, professionalism. These brings for action words. It makes a very clear to them It makes a quite serious to the employer when they look at your CV. I'm assuring you this kind, very important. Now don't use color papers while you send by papers by any chance, or putting your image in colors, too much of colors, colorful papers, colorful writing, or some fundas of like chart by diagram, something. Make always black color written on plain white paper, or white screen, black images, black script writing by exact font, which I told you. Don't fold your CVs. These are common, but anyway, you are anyway going to send by email. Sometime when you go there in person, attending an interview, don't fold your papers and open it, unfold it, don't give it, and give it in the plastic folder and give it in their hand. Let it know that we should present it. Proofreading is very important. Your biodata should not carry any spelling mistakes, different meaning of things. Certain spelling mistakes are quite common in every CV. In commonly people use. Read it carefully. The biodata should actually be read 2 times, 3 times, 5 times, not alone. Read it from backside even. Read your biodata from the backside. The spelling mistake you see, look at it. Sometimes our thesaurus, our Windows does not catch all the spelling carefully. License spelling, you see. I have seen license manager who applied for the job with a spelling mistake. A license manager himself. Tuition. There are several people who are conducting English tuition. They write the tuition spelling itself wrong. I'm not trying to explain things are wrong. Why I'm saying is, check it. If you are doubt about spelling, I know there is a board I have seen on the road, having playing on the gates of some homes. Tuition conduct. I'm conducting English tuition, and they write the spelling mistake of TUTION. Anyway, these kinds of spelling mistakes need to be very careful. Yes. Comma, double quotes, single quotes, where need to be carefully written. Make it carefully, essentially important. Find out things when you are in doubt. Because the CV sounds a little awkward to the people. I know everybody does not look your English language identifying, but make your little seriousness. See, there is a mistake in the comma. If you put it, you will have 100% difference in the meaning. That is why I have given an example. Let me eat, mother. Let me eat, mother. The comma, when it's got removed, you will find the meaning of the total things gone and it becomes dicey. Add short-term career goals. Read the career goals here, and in your CV building, write it carefully, because this is the one going to connect to your employer. I will explain you later if things are in the question my session comes. Make your short-term career goals connect to the employer. Giving up one thing to get something else, employment change, focus, and focus on things that are most important towards employer job description. Create your own words, sentence always. Try to create your own words. Others to read, your CV. That's also too important. Everyone actually read not alone, make other to read your biodata, your next to your friend to yours, or you are known to whoever. Now I am coming to the general form where when you look for a job, you need to be a thorough understand and not alone. Should commonly understand what is our nation today, post-pandemic, and where we are, what we are, how unorganized industries. There are huge amount of unemployment in the industry. We all know about it. We are saying that I'm a qualified engineer, BE. Then why did you study ME, man? You looking for a job, mostly BE completed, and nobody goes nowadays to ME or whatever. Why did you look for a job after BE? Yes, I did it. I did not get a job, so I got into ME study. I know there are many boys who are saying, I did my BE, I did not get any campus, so I went to the ME study. I did my BE, I could not get a job, that's the reason I got to the MBA. So you need to be very careful when you look out for a job. You see, only 8% of the working in India is organized. Imagine you are in 8% of employment lookout, your CV building. Now, how important? 60% employment is in unorganized sector, not organized, sorry, unorganized sector. A large decline in the employment industry today of women. Women employment is got reduced. No women are going to employment now the recent time. I don't know why there is a big force flaw. But 30% of women employment lookout is gone reduced. 40 rural employment. Many change in this. And 40 per self-employment has become only 1,500 drawing in the rural areas. Official Employment Bureau shows the record of 3.8% are only in the employment domain of organized sector of overall. So these are the kind of situation of India today. Though the huge, massive available, but you go to nearest any shops today or any big showroom, wanted salesman, wanted accounts executive. Employment industry is having a large needs and large employment lookout for the people, but at last there are many boards are showing wanted people. I'm quickly finishing off because the session should go to crisp and clear. There is a big change in the employment industry, as I said in the initial time, how we were running the last years of time. You know, the employment scarcity is gone, raised, huge, massively changed after the World War I and II. Why the World War I later employment got into retrenched? Retrenchment is not today because of the COVID alone. Let me tell you, repeat, retrenchment is not happening because of the COVID alone. Retrenchment happened during the period of even the World War I and II later. Even happened during the time of the currency change in India. Devalue, 500 and 1,000 rupees devalue. Doctor in the morning, Sachikumar, he was explaining the death toll rate is increased too high. Let me tell you, the road accident and other accidents, the death is much more than of our COVID of experience of today. The life, anyway, I'm talking about their life loss. But imagine the COVID made tremendous change in the corporate domain because of the business have got into huge drastical change and the turnaround and the employment domain change. The perseverance of the people mindset have changed, large amount of mind failure, like I want to show you the very interesting slide here. Look at it. Have a look at it. Take the image. It's going to help you where you are standing. At your age, where do you stand? This is it's a kind of pandemic, I would rather say. Every 50 years, everything changes. Today, the importance, after 5 years, the importance is lost. Today, the highest essentials have become lost. In next 2 to 3 years of time, all the ATM will vanish. Imagine it. All the ATM machinery will vanish. All the bank counters will vanish. We all would pay only by phone pay, Pearl Pay. Employment industries have got changed into the typical format setting, got changed. So we all need to maintain ourselves to match with it and go with the biggest, either spiritual way or conscious way, mindful way. I would like to put you into little more, psychological attention also in my next slides. Going to complete very fast, quick enough. I don't want to put you all, pull you along for a long time for you. While you make your CV building, I am reiterating the word CV building, make your mind why you need to be shortlisted. You are making your CV ready. You are taking paper, pencil ready. Here we called you with the pencil paper. Why I'm taking? It's a conscious to reach you. Any of here sitting, consciously think on why your CV need to be shortlisted. You are sitting the same board. As you fall into the HR systems, how will you shortlist the CV? So that way you need to learn rather than your CV need to be shortlisted. Having 100 CVs I am giving to you a hand, you need to shortlist only 10 people. I got no time to conduct 99 people interviews here, 90 interviews here. So the CV is quite important. Unless until make your papers clearly, carefully, and raising whatever doubts after completion of the session. I know you become a commoner again, and you become your own sailing boat. So it's a brainstorming exercise I'm giving you. Any of your own ideas, please share with us. You are in the generation, I'm sure, in the middle of 1980 to 2000. Anybody in this platform, I'm very sure, you fall in the middle. This slide 1990 to 2000, or 1980 to 2000, or 1975. Maybe some senior people could also be sitting over here, and they could have been a little far away of making their own CV made up. 75 born, they were not knowing exactly how attentive on the CV importance, because the generation gets changed. Many of them got changed. Early times paper was seen shortlisted, but today by clicking, finger clicks, the CV is getting shortlisted. By machine model only CV is getting shortlisted. So how will you make your CV machine to understand you? Not by captcha words, not by your OTP. It simply thoroughly takes your skill set you have written in the job description. It's as simple as a OTP. You write your sense full of OTP, your CV is getting shortlisted. Hope I could reach you in a well way. Today, everybody writes OTP, OTP. Every moment you get OTP. But so you are in the generation of millennial, generation Y, Zoomers, generation Z, or generation X. All behind, you keep look at it, baby boomer, silent generation, all were there behind. You read them out later. I'll go next. I want to show you a little brisk, I know, little relaxed, and please look at it. Now we are coming to the just few minutes video session. Raviji, Ravindra sir,
Yes, sir. Please.
I want to give a little screen view, video running. Finish it up quickly
Please
now.
go ahead. You can play it from there. You can
Already
select video file and open it. Do you know where is the file located? Video file.
Yeah, well,
Maybe it's on the desktop or download section.
yeah, I have put it on the desktop. Sorry, you
Okay,
know
then,
my
you need
desktop
to
now.
type
Sorry.
all those things.
1 minute, I'm just taking it. It's on the
The
desktop.
file, video file on the desktop.
Yeah, it's there on the
Yeah,
training crisis.
double click it. The share screen option, you will also find the option as share system sound. You can enable that so that.
Ravi sir, can you able to view the video or what? I didn't.
No, we can view the video. Is there any audio in the video?
Yes.
Yeah, if you want to share that audio also, you need to share in the settings, there is an option, share computer audio or share computer sound.
Is it so? Just hold on, sir. Just hold on.
Otherwise, it's fine. I think you can play it. We can understand.
The sound makes a little senseful. That's why. Let me know.
Okay, then let me do
The
it
screen
in
is
my
here.
screen.
Share. I'm giving a share again. Share sound. Yes, I take
Yes,
that.
yes. Yeah, you click on that.
Optimize for video clip is required? No.
No, no. Now you can play video.
Yeah.
2020 has been an unprecedented year. The COVID-19 pandemic has forced many people to lower their expectations, from living out their dreams to simply surviving. Like a sudden specter, the coronavirus barged into our lives, disrupting our daily activities. But we are overcoming the fear, or at least getting used to it. At the end of 2020, let's see how the pandemic has changed our lives. Socializing before. Now. Wearing masks before. Now. Commuting before. Now. Working before. Now. Staying fit before. Now. shopping. Before. Now, seeing the doctor. Before. Now, in a life marred by newfound inconveniences and loneliness, internet-powered services have come to the rescue. But still, there are some unexpected troubles. The daily commutes have been restricted, but boundaries between work and life have blurred, and achieving a work-life balance has become difficult. Life now revolves around online shopping and food deliveries, which were supposed to be contributing to a low-carbon lifestyle, but ended up generating tons of packaging waste. Although telemedicine has curbed the risk of getting infected by coronavirus by reducing face-to-face contact, the elderly are still struggling to get a hang of the digital world. But one should still be optimistic. As the saying goes, never waste a good crisis. The COVID-19 crisis offers us a chance to adapt and evolve as we try to conform to a new lifestyle, while reflecting on the deficiencies of our current lives.
It's all actualizing our inner mind, I would rather say, because the condition of today changed massively compared to years back, just hardly few years ago, 1 year, 2 years ago. So our entire life modality is changed. The inner mind itself got into huge amount of change, a lot of mind pressure, mental agonies, unable to carry forward, large amount of stresses. The child born, the one who left the age of 75, everybody got into trouble because of the school situation. During this period, the people who have qualified, especially their PG studies, looking out for an employment, become a biggest task for them today. Campus interviews never happened in the last 2 years of time, 3 years of time, even I would say. Last few years, there are many changes. At last, the COVID made a bigger change again. So you're building your mind is quite important at this point of time. And understand this crisis is a universal trouble. In an interview, there was an interesting answer. In an interview, what you are doing for the past 3 years. The interviewer was asking in a letter form, I'm telling you, just for joy, make you to little be alert. What you are doing for the past 3 years? He was raising a question, the interviewer. The boy who attended interview candidate said, I was washing my hands. So this is what the conditional happened because of this COVID. Now, when no other choice, we take it in a latter sense today. This is what happened. We all were washing our hands. So our exposure got into trouble. Families got into trouble. Many were happened. Like, Matt was saying, huge amount of turnover in employment, turnaround, retrenchment, all were happened. This health is a very important. As doctor was saying, Dr. Ravindra was explaining me in the last call, Ravichandran, you should also explain about the health reason behind. Many of them are simply, we are teaching them how to get employed, how to make the CV built up. Like a bodybuilding, how to make the CV building. And you are saying that you should also put a little word across. Many of them got troubled health. So I want to add up few more slides and finish it up. It's a last moment addition, but at last I want to heal it. not as a simple HR man. Because I take a subject of organizational behavior, principal management papers, subjects, doing a teaching for online studies nowadays. Any boys wanting to join, conditional we are in today, online teaching for subjects of HR, their elective papers. Now read this. Did you know 9 out of 10? Please read it carefully. I'm leaving your time. This is what the research found, including India. You are not anything happened with a strange happened to you alone, not alarming to everybody it is. 63% of the people, students, came out of their college. %60% of the people dropout. Dropout was happened. Anybody who was doing either chartered accountants or MBA or postal studies, unable to continue with their studies. Anyway, I'm going to the next slide. Anybody wanting to have these comments, slides, please ask Dr. Ravindra, and I would also forward it to your email ID, wherever, whatever form. Please do not hesitate calling us. What are the kind of implications we passed across during this period? See, the image of the photograph shows it's not a simple image. I put it on the slide. This image, I don't know whether I put it in a very small form, but I put this image to make you to come along in this current condition of post-COVID. A girl was taking a big skating on the airport, which was totally isolated. Otherwise, this particular airport in the Phoenix city will have minimum 10,000 to more than 1 lakh crowds entering in, entering off. This entire pitch was total free, and she was skiing practice on to make the life sensual understanding even the post-COVID. As I've shown you the video in clip, this is the way it actually happened. So make your thoughts acceptable. It's a common. I can give a little more history about it. Anybody wanting to know, but at last I want to quickly go and finish up. Anxiety, stress, meningitis, cold flu, sore throat, eating disorders, common illness. These are the common happened in the last 3 years of time among students, new employee aspirants, family disorient, family disorder, many dysfunctions, unexpected violence, mind lost. All were went through during this period. Loss of life. Any one of them certainly had any of these, one or the other, or two or the three, whatever. This is what happened. The instant connection is the best. This is the quote I feel. My feel is this quote, self-quoted. It's my own opinion, I put it. Unless until we start in the beginning itself to understand what is the trouble happened, and we wait for it and let it go for some more time, and we can pull along and come out of it gradually. Don't feel it like this. Try make yourself, prepare yourself, start yourself, go with it quickly. Try to come out of this pandemic lateral period. Please read this sentence carefully, boys, girls, students, all employee lookouts. Look at this statement. Why? Don't think any of your troubles to go continue. Let it go. All along it will come out. You will come out. Little sensible way, make it faster. Try to come out of it. This is the right time. Please come out and make your CV ready and go with in a very fun way of employment lookout, which I would also tell you later. Take it in a a spiritual way, passionate way, looking out for a job, happy moment, it's a common, it's happening with every 3 out of 1 is looking out for a job today. Particularly in the corporate domain, any industry for that matter. I want to give you 5 simple steps, sir. Let's finish it up very fast now. Only 5 steps, nothing else. Keep aside all the slides I have shown you. All the slides you keep it aside. Don't worry about it. Everything is not necessary. Now I'm telling you myself. Not important. Take these 5 alone. If you are in condition of this post-pandemic or little dredgy, read it. Get momentum, keep momentum. Anything, you feel happy, go with it for this today. And make little practice. Even you are unable to get employment, connected immediately, and do engaged in the practice itself is called progress. Either you achieve or not achieve. Achieving and not achieving, in Gita, Upanishad, there are many scripts, failure, success, does not make any sense. That's all the philosophical, all the scripts are available. I don't want to more touch on the, because I'm talking more on the CV building today. I don't want to show any Gita Upanishad statements over here because Dr. Ravindra will take care of those. He will give a large explanation. But anything you practice, that itself is becoming a progress. So, you CV building man, please involve in, get along, even you are not currently employed, in case of any situation came up in the middle. I'll tell you one issue. In this place, I want to tell you, after completing of this slide, please read it. Number 1, minimum 20 minutes, 30 minutes, read a book. Number 2, a basic body exercise that makes your body ready for the day. It's a transformation, your body transmits day by day to next level. The day of yesterday, you'll never get it. The loss of cells in your body never come back. It's need to be replaced with the new cells. So that is a youth man always gets the large amount of cells getting in and huge amount of cells going die. As long as you are the 48, your human cells, cubical cells gets generated in a larger amount and lesser amount of cell dies. So that's why I say transform your mind, not alone, transform your body. Basic exercise, anything in sense of your understanding, you feel yoga, do Surya Namaskar, or do your own determined practice anything, or join somewhere, or learn yourself. Ground exercises sufficient. By any chance, just for 10 days you go for swimming, go for shuttle playing, network, net game, carrom board play at home. These are, the day becomes happy. That's it. Number 3, you should always carry the courage. Courage does not mean that you don't need to be fear. Fear does not, courage does not mean you are not afraid. All the time you can't fight against certain things. Courage means you will do it by any way. I want to put you one more statement. Retreat is the better part of valor. Sometimes, you watch a movie of Jackie Chan. Sometimes, Jackie Chan runs faster and he runs like a coward. In many of the Tamil movies, you could have not watched it. The villains always run and the hero runs catching hold of him. Many of the movies you can see the thief runs and the police chase them. Rarely happening, the police runs and the chief catches, trying to catch the police. So this way, Jackie Chan movie, usually he runs, escaping from the point like a coward, and the villain trying to catching him off. Run sometime as a coward. It doesn't mean that you are running as a coward. You are going for retreating yourself to come with the biggest stamina and courage to facing him straightforward at his own pavilion. The villain pavilion. I mean it by whatever. So take your role model. Number 4, I'm repeating number 4. Coming to the role model. Have some role model, no problem. Something. Living model. Living model is an important. We always take Mahatma Gandhi, Nelson Mandela, whoever, take Sachin Tendulkar. They are living agenda. At your age, you take your own age demand. Be more dynamic. Commonly we take the old men and the old time role model. Take the current situation of newer models. Take their roles, read their interests. How did they come across? I suggest, Tendulkar himself, at your age or people. Take the role model of somebody, create a plan and engage into action. This is the number 5, last. It's the least, but at last, it's very important. Connect with the passion as your engagement. So I'm completing this slide, very important. So this way you start with it. I know your CV building would also happen in a practical sense. Your approach in looking for a job also quite sensible. Okay, now quickly finishing it up. Do not go with too much of social media. Do not eat improper time. Minimize news feedings. These are the common happening among young minds up to the age of whatever. Even the 70-year-old man in the social media and all the time he's spending time over on the social media. That's all keep aside. But what I'm suggesting is don't get into social contacts all the way across many times, nothing beyond. So fix yourself certain amount of time, connect everything. For most of the time, you try to write a little small calendar and go with that kind of practice. That will help you. As I said, again, screen time, restrict time, video games, yes, quite tempting. Video games, I know many of the boys, even 40 years old lady was playing a game on the phone, Android instrument. They play game, they play rummies, they play other games, whatever. Video games, making their mind, they say, I get tempted, I get my motivated. I watch a tele-series, I learn few things from the tele-series also. People are commonly saying nowadays, watching a tele-series through, they learn something. It's a cooked up food. So serious. People watching the screen, while watching their faces of telescreen, when I look at the faces of the viewers, I get big view than the tele-series view. Their face reacts to the tele-series view. Already cooked the food is in front of you, running on the screen image. Don't make yourself more connected to it. You become too much food. And I suggest please watch it. It's your importance. Make your life little entertained viewing it. Make the time fix, nothing else. I'm sorry if anybody gets hurt on this statement, but watch it in time sets. That's it. Help, reach out, socially connect, go to people, reach to some social centers, community centers, go to the old people, go to the child centers, go to the rehabilitation places, de-addiction centers. Go and connect to them. I didn't much talk about these, drug, liquor subject over in the civil building center point, because those are the different contexts. At last, I want to connect to the subject in very full form. Go to the social connects, some nearest centers, old aged citizens, senior citizens home care, child care center, NGO connects, give a little service hands if you can. Take yourself as your life is a treasure. Your life is a treasure. You are having a treasure in your hand. Feel yourself and your inner mind call yourself. And I'm telling you, please make a note. There are 3 senses within ourselves, not alone. 3 minds, M-I-N-D-S. We are not alone, a single mind man. We have a 3 mind, physical, astral, and three minds, physical, astral, and conscious. So I know your brain works here. You are watching the screen of here, and your movement of mind, physical mind, and your sense of the third mind goes into the somewhere different flash. So connect somewhat if possible, and do some yoga or whatever, little 15 minutes silent sitting, close eyes, little exercises, a little yoga or meditation, feel it. That kind would help you wherever importance. Because I do yoga, dhyana. Yes, I learned dhyana, made me a larger differences. I'm not talking because of me what I do. That makes it senseful to you. That's right. I know all these passing through. It's my last slide. I hope all the participants were engaging till the last moment. And all the participants, in my humble feel is, most of them are looking for their next employment after seeing this CV or true or not true. Maybe their CVs can be built up. I want to put a very clear statement now. Always carry your CV in hand. Always carry your CV in hand, even you are not looking out for a job. Suggest your mother to make your CV ready. Ask your mother to make CV ready the way you made it, sir, today. Why I do say is this: what is the accomplishment you reach? As I said, make your CV built in a rightful, sensible way to express your sense of pride, achievements, accomplishment. Its success, failures are quite phenomenal. The success you achieved, it means the failure you pulled out from the other one. I repeat it, the success you achieved today, you pulled out the failure of others who waited for the same one what you are looking for. So this is what the way I would like to say you, give me more. I'm sure, I am very, very sure after this context of discussions on CV building later, getting into an employment, you can reach me anytime. I'm more subject relevant. I'm a tutoring, I'm a faculty of subjects, like as I said, organizational behavior, principal management, business environment, business ethics subjects. I'm very assured when you give it this, I'm 100% sure you will give it to others beyond your reaching. Thank you for all of you. I would like to complete my session. Dr. Ravindra, please take care of this.
Thank you, Ravichandran ji. Thank you, Ravichandran ji.
Thank you.
For your,
Hope I reached all the participants. And I still ask a question. How much of them are looking for job seekers here on this platform? Write the chat. Let them only type JS. How many of them are?
You can just respond quickly so that
we can finish it
the
up.
meanwhile,
It's almost.
You can start typing. Whoever is looking for job, JS, and in the meanwhile, Ravichandran ji, you can just watch the chat box. So we are running out of time. Already we are ahead of time.
Yeah, I completed in my exactly selected time alone. That's what I thought of doing it quickly.
And because today's sessions was very important, the main reason we select topics, the first purpose of selecting topic is to impart skill development and empowerment of our health fraternity, medical and health fraternity.
That is what I covered in the last 4-5 slides. Otherwise, I could have completed earlier. Health is also put forward, so that's why.
And also, what we are seeing is we have set sustainable development goals by 2030, and we are in 2022, and still there is a lot to be done. And I don't think at the rate which we are going on, we couldn't meet the Millennium Development Goals, and I don't see, though I am very hopeful and optimistic about meeting the goals, but in reality, there is a lot of gap between achievement of SDGs as well by 2030. So that is what we are doing. Everyone needs to contribute. So we are running this series. I mean, entire development series or organizing programs. We are inviting speakers across the domains, because sustainable development does not limit to one sector or one domain, because it is across all the domains, all the sectors. So we need to understand all the sectors in a holistic way so that we can understand, because sustainable development itself is interrelated. It's related to all the domains. So that is very important to understand that all the domains are, all the sectors are interrelated and interdependent. No, nothing is in isolation, and we cannot take it to a sustainable development level if everything goes in isolation. So thank you, everyone. We need to appreciate you all. You have been there since morning till now. And, we should appreciate your patience. And one more thing before I conclude, we can, I will be sharing feedback link in just a couple of minutes. So, and also these 3 aspects which we covered today, which are very important. One thing is this life support systems. We all need to be aware I am sure most of the social workers or psychologists or counselors are not aware of this. That is the feedback we have received. That's why we have organized, in spite of having busy schedule, and the speakers are very eminent speakers and very professional and very qualified, experienced, and they are very busy also, in fact. So in spite of that, they agreed and came here and shared their valuable insights. So these kind of skill development programs are very much required by our fraternity, which is lacking in this. So we are taking this opportunity because we feel that we are part of the fraternity and it's our responsibility. See, we always keep asking what nation has given us. It's not like that. What we are contributing to the nation is more important. So what we are contributing to the nature, what we are contributing to the sustainable development goals is more important. At an individual level, the charity, you can see how, see, when we talk about charity also, because this entire month is auspicious for everyone, even for Hindus, for Christians, and for Muslims. All Ramzan is there, and this today Easter is there, and a lot of things, and we have a lot of New Years, Hindu New Year, Tamil New Year, Telugu New Year, and Sri Ram Navami. Lots of this whole month is so auspicious for everyone. See, charity, when we are talking about charity, charity is also very much necessary for achieving these sustainable development goals. When we are talking about charity, it's not that charity should be in relative to one's income. What happens is generally we see how much you are earning and within that how much you are spending as a charity. That is more important. When person is earning thousands and thousands of crores of money, and he spends just 1 lakh and creates lot of hype and publicity, and people also are like that. Media is also like that now. See, when a person is earning 100 rupees and he is giving 10 rupees charity, whether he is great or whether a person who is earning $1 trillion per year, $1 million per year, and he is spending just 1 million or say for that matter 1 lakh rupees, who is great? Now we need to develop that kind of perspective. We should not be carried away by this lot of hype that is being created. We have to be more realistic. We need to appreciate everyone. What we need to understand is everyone is contributing in a small way or a bigger way in whatever capacities they are. So we need to appreciate that. We need not be carried away by the propaganda or the hype that is created. So we need to be very conscious of that. It is not the great people who does the richer people, or not the the trillionaires or the tycoons who do the charity. It's the common man and it's the middleman who does the most of the charity, because they know, because they give, because they know what is the pain of not having it. So they understand that what kind of pain or what kind of feeling or what kind of emotions or what kind of experiences they go through when they did not have them. So that's why they share some amount as charity, some contribution, some resources, or even if you have nothing, they share kind words, at least. They show empathy. So these are the things that we need to learn even for the sustainable development. Otherwise, what happens, the development becomes more materialistic, and we need to have one more goals. Maybe we will name it soon. We will also have to find some other name to achieve that. Recent IPCC report also has given a lot of frightening reports which is making us more anxiety driven, or provoking more of anxiety and fear among different populations of the nation. Because now see, even in India, or even for that matter in cities, now even in March itself, we have seen so much of temperatures, and in April, by the mid of April itself, you can see how the temperatures are. And can you imagine in May what's going to be? And every year, temperature is rising, and seashores, glaciers are melting. Seashores are, sea levels are increasing. So all these factors are there which are contributing to the climate change. So what are we doing? What are we contributing? And how do we meet these or attain these sustainable development goals? So to meet this, to bring awareness on various topics, we are organizing this series of sessions, webinars as part of this thing. See, there is no money involved, or no, no payment involved anywhere. See, we are investing our money from our organizer side. Whatever we can do in our own capacity, we are trying to do. And speakers are also, they are not paid anything. They are giving their valuable time. You know, everyone time is very valuable. As a professional, you know how much they charge for every minute, or every 15 minutes, or every 30 minutes, or for each session. In spite of that, this is also one kind of charity we are doing. So, to giving back to the society. We are not expecting anything from here. So the speakers are also invited in such a manner that they are also generously coming forward to share their knowledge and to contribute towards sustainable development goals. And we are also selflessly doing this service. In spite of all, we all have everything to be done, met. We all have office, we all have families, we all have, everyone have everything to be done. Apart from that, we are doing additional work. We are allotting time, resources, money, we are spending everything, and we are organizing these sessions only so that we can contribute to the sustainable developments through awareness, through skill development, through career enhancement, and through knowledge dissemination. So this platform is entirely dedicated for that, and it will be forever free only. Will not entertain any commercial activity or commercially on this channel or platform. So this will be free for the lifetime, as long as we are there, at least. So this is a free platform. Anyone who has knowledge, who would like to share their wisdom or knowledge or expertise, we welcome everyone. So we want, because many professionals, like health professionals also, doctors are being abused. They are also committing suicides. They are killing themselves because not able to balance this work-life balance and pressures, and they are also getting abused. So these all things are very much required because they are burdened by the system. More and more diseases, more patients, and they are also, I mean, everyone is strained, everyone is stressed, everyone is overwhelmed by the pandemic and other things. So everyone is becoming restless, everyone is becoming impatient, intolerant. So what is happening? We are not able to control our emotions. We are not able to control our feelings. We are not able to identify our positive and negative emotions and how to convert them into positive, how to be more productive, creative, optimistic in all aspects. So this is very important session today. So we are taking up these sessions only for the benefit of everyone. So there is no commercial aspect, no profit involved here. So feel free to join and widely promote. Jaychandanji, can you
I'm,
move?
yeah, I'm here. Sorry.
Yeah, because I need to conclude.
Yeah.
Yeah.
Anything on the question side, you just put a call on. Anybody
The chat
wanting
is
to,
open for the participants so
any
that they can
question,
share their messages.
want to have that?
Yeah.
Any questions?
You can close the sharing, screen sharing. You can stop sharing. Thank you. So these things are very much essential because we all need to understand why these programs are being conducted and what was the purpose, what is the motive behind, because that helps out to reaching more people. Because when we do things, we don't understand properly. What we do, we don't reach the optimum, this thing. See, when we are talking about sustainable careers, how a career can be sustainable? Only when you love it, only when you like it, only when you have compassion, only when you have passion for it. See, when you love it, you will take as much as pain you want, as much as you will put in your maximum efforts to ensure that you are meeting all the requirements. If you don't like that job, if you don't like that career, everything will be a burden for you. Everything will be a pain for you. So you will keep hating and doing the work. That will never attain anything. So you will be more disappointed, you will be more discouraged, you will be more demotivated. So at the end of the day, you will not have the satisfaction. So then there is no purpose. That's why there is no further development in that. And there is no satisfaction for yourself, and even the employer also is dissatisfied with the performance, and your performance will be also affected. So the entire career itself gets affected. So these are the various aspects we need to understand when we are talking about sustainable careers. So sustainable careers, in the sense, they are sustainable irrespective of the inflation or irrespective of the industry. That's why in the earlier days or even now also, there are some evergreen careers we call, like doctors, engineers. These are required no matter what industry. Even for IT industry also, you need civil engineers. Without that, no construction is possible. And without any buildings, how can we construct these research centers or industries, or even for that matter, IT companies? So these are like evergreen sustainable careers. Apart from that, because nowadays more and more engineers are coming out, more and more other fields are emerging out. So it is very important that we need to understand these careers and choose up different careers so that everyone gets employed, because there is a huge competition. Lots of colleges have come, and more and more like schemes has come up for the students to take up education and career. So more and more people are getting opportunity to study and even pursue their higher studies. That is also creating more human resources. But that is to get employed, we need to explore more resources, more opportunities, more verticals, more domains where we can get employed. So through that, sustainable careers can also be possible. So thank you everyone. Once again, I would not take any more time with you all. So thank you very much once again. I'm sharing the feedback link in the chat box. You all can fill it up before leaving the webinar. Before concluding, let me thank all the speakers for the day. So on behalf of Sri Holistic Health Foundation India and Sri Research Institute and Center for Art, Sciences and Wellbeing, I thank all the speakers. Dr. Sajid Kumar P, Assistant Professor, Medical Surgical Nursing, Government College of Nursing, Kozhikode, Kerala. and Dr. Reena George, Assistant Professor and Head, Department of Psychiatric Nursing, Institute of Mental Health and Neurosciences, Kozhikode, Kerala, and Sri Ravichandran Ji, Principal Consultant, HRM Mapper Consulting Co. And also Prashant Joseph Ji in his absence, though he shared his presentation through a recorded video, but due to time constraints, so we have requested Ravichandran Ji to cover both the concepts. So we again once again thank Ravichandran Ji for covering both the topics, and Matt Perliston, CEO, EQ for Peace Worldwide Inc., USA, and Dr. Ravindra RM, and all the eminent speakers, and especially the participants who have been there with us in the day-long international webinar cum workshop on health, life support systems, careers, and sustainable development. Thank you everyone for joining us and being there with us, patiently listening to all. Yeah. So kindly find the feedback link in the chat box. And if you have any queries regarding the sessions, you can reach out to us. We will be always happy to take up any queries. And while we are filling up the feedback form, Ravichandran Ji is available to take few more queries, maybe for a couple of minutes before you fill up the feedback form, or while you are filling up the feedback form, you can share your comments or observations or your requirements, anything. You can use the feedback form also for the same. And there is also link for this Telegram link and Facebook. We are sharing all the links there. Otherwise, each webinar or website has a different link series, so it's difficult also for me, because for everyone, because daily one program is going on. So instead of that, I would request everyone to join this Facebook group as well as the Telegram channel, where you will get all the updates, even not only the previous and upcoming future updates also. You can receive all at one place. Many are not joining Telegram channel. Because of that, we also have an additional efforts, like we also need to post in various groups and various like-minded friends, where we are sharing in those groups also, online, offline, everywhere. So it is also difficult for us and also time consuming also, daily sharing in so many groups and channels and social media. So if everyone joins this channel, then that will be the one source where we can daily share, and that will help us to organize more programs and organize, and we also can prepare much more better, in a better way, and share the knowledge. So kindly join our Facebook group as well as Telegram channel. And whoever has prepared resumes, so what we will do is we can have one more day somewhere in next week or something like that. So whenever Ravichandran Ji permits, we'll have one more session with a different audience on that day. Whoever has prepared resume, they can come up on that day so that they can be reviewed. Otherwise, what you can do is you can email your resumes to our email address. All the email address, contact numbers are available in the registration form, as well as this Telegram channel, Facebook group. My contact number is available, WhatsApp number is available, email address is available, and you can also put in comments in feedback form also. You can share with us, and Ravichandran Ji also shared his contact number, email address also on the slide. Then you can mail him directly as well. So thank you everyone once again for joining us and patiently bearing all of us since morning along with us.
Thank you, sir. Thank you so much. All the very best.
Thank you, Ravichandranji.
Thank you, sir. Thanks to all the participants.
You also was there since morning, listening to all the sessions. And,
Thanks very much. Thanks, sir.
look
I'll take it.
for your support also in future.
Sure, sure. We all are there together. All the participants would also be. And wherever they're relevant to subjects, even there is somebody was saying I'm doing a second year MSW. They can be taught in their subjects also, anything related to online, wherever, whatever form we can support individually at this point of time, since they are all joining here. So wherever. Thank you very much. Can I take a leave, sir?
Thank you, sir.
Thank you.
After filling up the feedback form, you can leave so that I will also know who all are left. This meeting will be open for another 5 minutes so that you can fill up the feedback form. Kindly fill up the feedback form before leaving the webinar.